Good morning, good afternoon, those who have joined virtually. Welcome and warm greetings to you all for the launching of the Climate Change and Health Advocacy Toolkit of WHO Southeast Asia region. I am Hussein Rashid, Regional Advisor WASH and Climate Change from WHO Southeast Asia Regional Office. We are connecting from the Health Pavilion at the COP26 from Glasgow. This year, health has been included as one of the three key science action areas to bring stronger focus on health and ambition to COP26. For the launch, to begin with, I would like to now invite our Regional Director, Dr. Poonam Ketrapal for her remarks.
Warm greetings and welcome to the launch of WHO Southeast Asia region's Health Climate Advocacy Toolkit. Climate change is the single biggest health threat facing humanity. In the Southeast Asia region and across the world, it is putting the health, well-being and sustainable development of billions of people at risk. Climate change imperils decades of progress in reducing disease-related morbidity and mortality. It increases the frequency and severity of extreme weather events, threatening whole communities and countries. Between 2030 and 2050, climate change is expected to cause approximately 250,000 additional deaths per year globally from malnutrition, malaria, diarrhea, and heat stress, hazards that are already prevalent in our region and which disproportionately impact low-income and disadvantaged communities. The Intergovernmental Panel on Climate Change has concluded that to avert catastrophic health impacts and prevent millions of climate change related deaths, the world must limit temperature rise to 1.5 degrees centigrade. My message today at this 26th session of the Conference of Parties is concise but urgent. Inaction is not an option, not for health, not for well-being, not for a fairer, more sustainable future for all. In the Southeast Asia region, health leaders continue to lead from the front, spearheading multi-sectoral advocacy while taking targeted action to mitigate the health impacts of climate change. In compliance with the 2017 Declaration on Building Health Systems Resilience to Climate Change, all countries of the region have identified key health vulnerabilities to climate change and are greening the health sector and strengthening health information systems. They continue to ensure that health is included in national adaptation and resilience plans, while at the same time integrating climate risks into climate-sensitive disease programs. To accelerate momentum, it is my pleasure to hereby launch WHO's Regional Health Climate Advocacy Toolkit. The toolkit aims to inspire policymakers, individuals, and communities in the region to act on health and climate, and to do so based on the best available evidence. It provides a summary of key health-related climate issues faced by each of the region's countries, offering tools, fact sheets, and infographics that can be downloaded and adapted for use in local campaigns. I thank UK DFID for their support in developing the toolkit. and I look forward to our continued collaboration with partners in the region and across the world. I urge everyone, everywhere, to access and utilize the toolkit to confront the climate crisis, protect health for all, and ensure a fairer, healthier future for generations to come. I wish you a successful COP26 and thank you for joining today's launch.
Thank you, Regional Director, for your message and for officially launching this toolkit. Now, let us have a short video about the toolkit.
The climate is changing even faster than we expected. Higher temperatures, shifting rainfall patterns, rising seas, and more storms are happening now. This means big changes for health. The diseases and patterns we have known are shifting. The gains we've made on water and sanitation and disease prevention and elimination hang in the balance. In 2017, the health ministers of 11 nations of the WHO's Southeast Asia region united behind the Male Declaration, a statement recognizing the impact of climate change on human health and health systems in their region. They committed themselves to health climate resilience. A commitment like this cannot be achieved by government alone. It takes individuals and communities invested in change. The challenge is big and complex, so change will be hard. But if we mobilize a whole ecosystem of champions, change will be easier and it will come a lot faster. The WHO's framework for climate resilient health systems identifies building blocks for action. In Southeast Asia, for example, health climate resilience means that healthcare facilities can function effectively even during disasters. Surveillance systems can detect climate-driven changes in disease, and financing is available to support action. WHO's new Health Climate Advocacy Toolkit is one example of the ongoing efforts to tackle health climate resilience. Created in consultation with the WHO country offices and health officials in the Southeast Asia region, this online resource is meant to inspire action. It targets people from all walks of life, but especially healthcare workers, students, community leaders, and government officials. It provides information on the health impacts of climate change and tools to plan a multifaceted health climate advocacy strategy. Those tools help advocates scope out their strategy, assess campaign tactics, and craft key messages. The toolkit has ready-to-use downloadable creative materials such as posters, banners, and issue briefs. Videos and social media content will enable advocates to jump right into a campaign. The Southeast Asia region has more than 5 million healthcare workers. Imagine if they all united around health climate resilience. As noted in the toolkit's key messages, no one can sit this out. Please join us in spreading the word about this toolkit.
Thank you. We can now have a look at the toolkit. So this is how you can see it at the home page. And when you go to the resources, you can see all these, the downloadable PDF versions of the toolkit, as well as the PowerPoint presentations, all country factoids and everything. And if you go to the Explore by Country, through the map, it's an interactive tool where you can see the different anticipated climate changes, possible risks to health, adaptive actions for health sector, and the top health climate priorities for each country of the Southeast Asia region. So it's an interactive one. Thank you. Now, I would like to request for remarks from the Director, HQ Dr. Maria Naira, for this occasion. Could we have the message from Dr. Maria Naira?
Greetings from Glasgow at the COP26. Ladies and gentlemen and colleagues, friends, Let me congratulate Seattle for launching online this advocacy tool on climate change and health. I have the opportunity to have a look at the tool and it's really fantastic. You will have the opportunity, it's a live tool, you will click on the information and you will have the opportunity to see very relevant information for advocacy purposes, but as well for policy recommendations, for making policy analysis, and I'm sure that it will be very useful. Of course, this is a Seattle tool, but I'm convinced that it can be very useful for other regions as well, and we count on your support to be able to, once you use this tool, to be able to share it with other regions and with other countries. Let me congratulate the regional director, the Seattle colleagues, and all of those who have contributed to that. And thank you very much for what I am sure it will be very useful for all of us. Congratulations again. It cannot be more timely. We are at the COP26 discussing on climate change and health, and I'm sure this tool will contribute enormously to raise awareness, to provide an interesting information and allowing everyone to take decisions and make policy recommendations. Thank you once again and congratulations.
Thank you, Dr. Maria Neira. Now, as I mentioned that, and also in the video, this toolkit has been developed with support from DFID, and therefore I would like to invite the health advisor from FCDO, Dave. Could we have his remarks for this occasion? Thank you.
Good morning. My name is David McCullough and I work in the UK Foreign Commonwealth and Development Office in the Global Health Directors, where we're working really hard on climate change and health. I just wanted to say congratulations on this really impressive toolkit. I think it's going to be incredibly useful and really impactful. The COP26 Health Programme is the UK COP presidency and partners, including WHO, Healthcare Without Harm, and the UNFCCC Climate Champions team. And it's our way of delivering on the health agenda within COP26. Now, that includes at the heart of it health professional advocacy, and that's really critical in terms of delivering those messages on what the health argument for climate change is. And that's really important because the climate crisis is a health crisis, and the impacts are health impacts. It's how long we live our lives, the quality of our lives, and the quality of the lives of our family and communities. But it's also really important in terms of offering a positive note, in terms of what the co-benefits are for action climate change. So as we pursue actions which deliver on climate change, we're also delivering in the short, medium and long term on the health of our populations. And that's a really powerful message to give out to our negotiators globally. It's also really important that we get our own houses in order within health. And that's why in the COP26 Health Programme, we've been working with countries through our partners, chiefly WHO, to try and get countries to make commitments or give them the platform to make commitments on developing their health systems in ways sustainable and low carbon. We also think this toolkit is going to be really effective in terms of pushing more countries to do more on developing climate resilient and sustainable health systems and making those commitments. So far, we have 50 countries, and many of those are in the Southeast Asian region. And we're hoping to have many more. But we also really want to help those countries push for stronger and more ambitious action as they move forward. And this toolkit will be incredibly useful for that. So I just want to say thank you very much to WHO Zero for all of the work on this. I think what they've produced is really incredible. It's going to be really incredibly useful. And I hope that the people who have a chance to use it and engage with it will go on to take that message and take the approach of the climate and health within their work. Thank you very much, and I really appreciate the opportunity to provide this short message of congratulations to WHO. Many thanks. Bye.
Thank you, Dev. This toolkit was, of course, developed with a lot of inputs from country officers. The data validation, case studies, and all has been a collective effort. Country office, WHO country office staff, as well as coordinating with Ministry of Health and other officials. So now let us hear from the Director on Climate Change from Ministry of Health, Timor, on this occasion.
Welcome to the launching of the Climate Change and Health Advocacy Toolkit of WHO Southeast Asia region. It is my honor to participate in this event as a part of the side events of the COP26. This is very useful and important toolkit which will help us, the countries of the region, for design and implementing climate change advocacy campaigns. It is providing us practical tools to support and decision making at the regional and country level. This will help to deepen on our knowledge and awareness of anticipate climate change impact at the regional and country level and how they will affect health outcomes and health systems. The presentation of climate advocacy guide with tools, the roadmap capturing advocacy opportunities, and down-level content for advocacy campaign are indeed very useful for the country. It is very easy because it provides all the resources and information in one toolkit, and this will help to improve our work at country level. Therefore, we are extremely happy and congratulate WHO Sharon for developing this tool. This is an excellent initiative, and we hope to contribute to improve the toolkit with future case study on climate resilient healthcare facility and others initiatives from Timor-Leste. As other speakers highlighted, climate change is impacting our health, and these innovative tools are important as we recover from the COVID-19 pandemic. For a small island developing state like Timor-Leste has faced many climate challenges, including floods, landscape, prolonged drought, temperature rise countrywide. As a part of the health ministry programs to address the climate impact on health, it has been conducting a climate resilience of the health care facilities. Public awareness for prevention of the climate-induced disease, moreover, to protect the health of local community. Another health ministry programs are providing a water treatment or filtration in each of the health facility and providing water safety plan for the local community. In addition, providing medical waste management in health facility for nationwide. These advocacy tools provide us another opportunity to accelerate our efforts at the country level. We hope to work closely with WHO and partners to address the impact of climate change on health in the country, and once again, thank you for launching these toolkits, which will be very happy and beneficial to all countries, including Timor-Leste. Thank you.
Thank you very much. So that comes to the final and last remark from the speakers. Before we conclude, I would like to thank Regional Director Dr. Poonam Ketrapal-Singh, Dr. Razia Pense, Director HPN, WSC team, and others who have guided and supported throughout in developing this toolkit and up to the launch of this toolkit. I would also like to thank CRO IT team and each and everyone, including the colleagues from HQ who have contributed to make this launch event a success. I also thank all those who have connected virtually from the country offices, regional office, and those who have joined us at this health pavilion for this event. Thank you very much and wish you a very good day. Thank you.
Hello? It's on? Okay. Good morning, everybody. So we should get started here. We are so welcome to this session that is looking at building the climate change, family planning, population, environment, and development nexus. Oh, they can't hear me. You can't hear me? They can hear me. Because they, yeah, sorry. So welcome to the session where we are really looking at how to optimize the climate change, population, environment, and development nexus. It's a very, very exciting panel that brings together a range of speakers, including the Minister for Malawi Minister of Forestry and Natural Resources, who will be joining us shortly. There's Dr. Joan Castro, Executive Vice President of Path Foundation in the Philippines. Mr. Gordon Smango, the gentleman on my right here.
Elliot, the mic's gone dead again.
Oh, it's gone dead.
It's better, yeah.
All right. Yeah, the gentleman on my right here, Mr. Smango, who is the All Africa Confederation of Churches liaison officer at the African Union in Addis Ababa, and Dr. Paul Disanka, who is the manager in the UNFCCC, who will be joining us shortly as well. And online we have Dr. Joan Castro, but I think we have to get started. The other couple of speakers will join us. But as I said, we are really examining linkages between reproductive health, population, climate change, the environment, various aspects of the environment, conservation, food security, and biodiversity, to see how these issues are linked to one another and how they affect both the adaptation and the mitigation agenda when we talk about climate change issues. It's important to note that I think if you've gone around this conference and the previous COP meetings, the word population, or what I call the P word, seems to be a forbidden word in some ways. People don't want to talk about it that much, yet the various aspects of population change, starting with population growth itself, looking at how the numbers will grow in population, especially in sub-Saharan Africa and South Asia, which will account for over 70% of all global population growth for the rest of this century. But other aspects of population growth as well, population change, including migration, forced and voluntary migration, on age structure changes, all these have very, very big ramifications, not only on determining how the issues about mitigation will shape up going into the future, but also in affecting the capacity of communities and countries to adapt to the impacts of climate change. So the reason here is really to look at these issues. Welcome, Honorable Minister. As I was just introducing the topic here, but I would like to welcome in a special way Honorable Nancy Tembo, who is the Minister for Forestry and Natural Resources from Malawi. Welcome, Honorable Minister. So I was just doing this, and we're going to get started here by introducing the panelist who is online now, Dr. Joan Castro, who is the Executive Vice President for Path Foundation Philippines. And I want to get her started by asking her a question to really to get us started by helping us understand when we talk about the population, environment, and development nexus (PED). What do we really mean, and why is this important? So, Joan, if you come up and get us started where you are. Joan is in the Philippines. She couldn't join us. Yeah. Hi, Joan.
Hi, thank you.
Please go ahead. You have the floor now. Please just try to explain to us why is this issue important, and yeah, take it from there.
Okay. Greetings to my distinguished co-panelists first and everyone joining us today. So the PED nexus is also called the PHE approach. It places particular emphasis on the population and environment sectors, but it is also amenable to other sectors like agriculture, education, water, clean energy, and others. The underlying philosophy is fundamentally a deliberate effort to integrate and collaborate in order to create synergy and attain value added results. The PED approach actually applies a systems thinking framework to analyze and respond to the environmental conditions by understanding the human needs that influence the behaviors and activities on the state of people and the environment. Integrated approach also factors in demographic changes and characteristics such as population size, growth, migration patterns, spatial distribution, age structure, birth and death rates, and the effects of climate change and the pandemic, plus other factors that pose threats to improving human and ecosystems resilience, well-being, and sustainable development. So in order to institute appropriate mitigation and adaptation measures that are holistic and comprehensive, such as the PED integrated approach, it is key for policy and decision makers and for program planners to understand the context and the multi-directional interactions between the sectors, and for this matter, primarily population and environment sectors. Over to you, Leah.
You building on that. You've worked for many years in promoting really this integrated approach, how to get family planning, reproductive health really integrated in environment and climate change programs. Can you give us a specific example of an initiative that you've worked on, and what really came out of that, what impact this initiative had, briefly, please?
Okay, so let me share with you some initiatives that employ the PED approach. Firstly is the Integrated Population and Coastal Resource Management Initiative, otherwise known as IPOC-FORM, implemented in the Philippines in early 2000. It's a pioneering PED approach program with a goal to improve food security and quality of life of communities that depend upon coastal resources while maintaining biological diversity and productivity of coastal ecosystems. The PED approach was informed by recognizing the declining productivity of the coral reefs, threatening food security and health of the communities. There were surveys that were done in the area that revealed high levels of fertility, population growth and momentum, migration, childhood malnutrition, poverty and chronic insecurity, food insecurity, analysis of the interconnected dynamics of population and environment informed a holistic PED approach by integrating coastal management as a strategy for food security and family planning as strategic intervention to reduce fishing efforts and population pressures in the areas that we work in. The project resulted in improved coral and mangrove conditions and family planning and reproductive health outcomes, and we gained policymaker support in more than 30 communities. And at the end of the project, we had a constituency of peer educators and community-based distributors that were operational. There were about more than 50 policies passed, and fisherfolk organizations, people's organizations, and non-government organizations capacitated on PED approach. The same project actually also provided the evidence that integrated approaches generate higher impact than sectoral approaches. And the paper was published sometime in 2010. The best practices of the IPOC-FORM was replicated in a global project called Balance, in late 2000 to promote the PED approach. And it was jointly implemented by conservation, health, and academic institutions, namely the Coastal Resource Center of the University of Rhode Island, Conservation International, and my organization, Path Foundation Philippines, with support from USAID, both offices of population and reproductive health and environment. Across the project areas, the balance built PED capacity in 21 organizations working in marine, agriculture, watershed, forest conservation in 8 biodiversity-rich countries in East Africa and Asia Pacific, where population change is dynamic and climate change is a serious concern and impacting the lives, loss and damage of key infrastructures, inequities, and food insecurity in various degrees. The PED approach also gained champions among our key environmentalists, conservationists, and I'd like to mention a special person, Dr. Angel Alcala, a recognized scientist, a Pew Fellow, a previous minister of the Philippines Department of Environment and Natural Resources, and the father of marine protected area management. He espoused and promoted the PED approach, he believed that meeting the unmet family planning and reproductive health needs of women in tandem with coastal resource management is a best practice. So our lessons across the countries and ecosystems were consistent. PED approach is essential to assure sustainability of conservation gains and resiliency. PED approach contributes to greater female and youth involvement in environmental actions and stewardship. And there is no downside to PED approach. It is described as a practical solution to interrelated issues and relates to the way of life of the communities and aligns with the visions of the policymakers that we work with. Thank you. Over to you, Willie.
Thank you, Joanne, for that. And I think what is clear from what you are saying is that these PD approaches operate well when there's an intervention, both at policy, strategy level in terms of government guiding this, but also building capacity at community level of where the actual action is. So, Joanne, I'll come back to you a bit later as we go in this, as we continue with this conversation. But for now, I would really like to turn to the Honorable Minister for Malawi, Honorable. Hello, yeah, Honorable Nancy Tembo. Honorable Nancy Tembo is an MP and as I said, the minister responsible for forestry and natural resources in Malawi. She's really, I was joking with her yesterday that if we look at ministers at this conference who have spoken the most, that she might get an award. I'm always seeing her 2-3 times in all sorts of conversations here. And she's really a big champion in Malawi on issues with to do with reforestation, banning of plastic papers in the country. She's also championing reforestation, charcoal substitution, and how to get a sustainable potable water. So Honorable Tembo is going to open up by giving a statement, and then after she gives that statement, I'll ask her 1 or 2 questions just to get a few insights on what she's going to say. Honorable Tembo, over to you.
Can you hear me? Good, thank you. Well, good morning, everybody, and very happy to join you this morning for these conversations on building climate change, family planning, population environment, and development nexus. I'm going to address you here today on the case study of Malawi. Malawi is a highly populated country. We are a very highly vulnerable country to the impacts of climate change and weather-related disasters. This is mainly due to our location. We are a landlocked country in the Rift Valley of Africa, heavily reliant on rain-fed agriculture, and we have a rapid population growth, rapid urbanization, and settlements that are not really, they're really haphazard settlements, and poor economic status and environmental degradation. And you can see that this is a recipe for disaster on our part. The World Bank ranks Malawi among the top countries, 10 countries in Africa, heavily exposed to climate change effects. Research done by AFIDEP categorizes Malawi amongst the 14 African countries that are population and climate change hotspots because they are highly vulnerable to the adverse impacts of rapid population growth and climate change, including acute water shortage. In 1919, Malawi experienced one of its worst cyclones. This cyclone killed over 60 people, but the damage it caused was vast. It is estimated that for us to recover, we need $370 million just to recover from one disaster. And apart from that, there's various other disasters in between that have come up before we have even recovered from the disaster of the 2019 cyclone. Now, as a government, we've not just sat idle. There is frameworks that we have put in place to ensure that we begin to address these issues. And we've put in place a number of policies and strategies to increase community resilience to climate change effects. However, implementation of these instruments requires financial and related technical resources. The Malawi National Climate Change Policy promotes adaptation, mitigation, technological transfer, and capacity building for sustainable livelihood through green economy. Gender considerations are important in the planning and implementing climate change management programs because girls, women, and children often suffer the most. When disasters such as extreme heat, flood, drought, cyclones happen, girls and women are the most that suffer. And if you get into a situation where, because of desperation, families will marry off their girls early for economic reasons. Disruptions to the provision of sexual and reproductive health services may result in unplanned pregnancies, and displacement of people increases in gender-based violence. And we have experienced this during this period where we've had this, the COVID period, the last 2 years, where a lot of girls have dropped out of school due to pregnancy because of the situations in their homes, and families really desperate to get something from a son-in-law that can provide to fill a gap that is there in a family. Challenges coming as a result of disasters. Malawi's population is so huge that we have often to depend on our landscapes. Malawians have, because of lack of education, most of them have large families. A Malawian woman has an average of 4.2 children in her lifetime. This high fertility stems from low levels of female education, early onset of motherhood, and high rates of unmet need for effective family planning methods. Rapid population growth puts a lot of pressure on land and natural resources. And most of Malawi uses biomass energy for cooking and heating. As you can see, the rate of population growth exceeds economic growth, which affects the government's capacity to fund social and public services. 48% of females meaning girl children, enroll for secondary education. But at the end of 4 years of secondary education, only 7% will complete that 4 years. And the factors that lead to that decline are the ones that I've just cited above. Now, the problem of girls dropping out of school is exacerbated by the effects of climate change. Health is an essential component of Malawi's NDCs for climate change mitigation and adaptation from 2015 to 2050. But health is, can you just help me with this? Just take that, yeah, no, take that one. I think, what page is it? Page 3. Page 3? Yeah. Okay, can I, yeah. We do not have adequate health facilities for a population that's rapidly growing. Our facilities are really not adequate. The capacity of our population to be resilient to extreme weather events and adapt to socio-economic changes related to climate change requires knowledge, skills, and resources. And all these, you can see, are in very short supply. Now, what is required to be done? What we must do is to ensure that gender and population dynamics are at the center of climate change adaptation and mitigation strategies to offset the growing pressure on natural resources and degradation of the environment. This requires us to invest in education, to reduce the gender gaps, to be able to plan for our urban growth, and to provide finances to ensure that those who need family planning services can access them. An integrated approach to doing development is essential. There are linkages in sectors of development with population and the environment. A high population growth will impact on the environment negatively. And so issues of population need to be at the center of mitigation and adaptation. We must develop and strengthen intersectoral partnership that acknowledge the interdependence to achieve complementarity in addressing climate change vulnerability. Finally, we must strengthen the resilience of the health sector to climate change related shocks through infrastructure development and capacity building. And just to add on to that is that climate change in our country is impacted. I think our ability to address issues of climate change are impacted by our inability to ensure that we have a populace that is skilled, that is educated, especially at the community level, where women provide for families. Most households at communities are headed by women, and they're not able to provide for their families because of limited access to education, to health, but also to fuel, wood. And therefore, they resort to the landscapes and forestry in order, one, to gain their livelihoods, but also to make sure that they are able to provide for food for their families. So this nexus that we are discussing today is very critical. And I hope that all the conversations here at the COP can address the issue of population, because unless we address issues of reproductive health, unless we address issues of population growth, we will not be able to achieve anything. So all we're doing will be in vain. And I'm glad that here you have decided to address these issues, because as you said, I've been in most of these conversations, but this population issue has not been addressed, and we can't do anything unless we address population growth. Thank you.
All right. You can hear it for yourself, Honorable Minister. I think you've articulated the issues so well, and I wanted to ask you even a question on why the government, because when you look at the climate change policy, the population policy, there are issues of environment in the population policy, of climate change. In the environment policy, you talk about population. In the broader Vision 2063 that the government just came up with, you talk about both issues as being central for achievement of this socio-economic transformation agenda for the country. So, I think you've already said it. My other question, I just wanted to say, why is this important? I think you've answered that. But I think part of what the government of Malawi, when the president was here, you were talking about climate justice, and the president talked about, okay, either the North needs to pay up. But I think what you seem to be saying here, and maybe you can comment a little bit more, is on why even southern countries, African countries, need to play a very, very proactive role themselves as well. If you can maybe just add to that.
Yes, indeed. I think our president was correct. The North needs to pay up. Climate change really has been caused largely by the North. Our contribution to that is really negligible. But we also cannot sit idle and not do anything about it. And I think some of the degradation that has taken place within our countries has been as a result of our own inability to address issues. So we also have a responsibility. I'm talking about issues of population growth. Governments have to take responsibility. We have to ensure that we provide for services that address issues of population growth. We have to sensitize communities. We have to engage communities on issues and the negative issues that families will encounter if they do not address the issue of population growth. We have a big role to play. We have to ensure we restore our landscapes. This is not, the North is not going to come and restore. We have to have policies that are in place to enable whatever financial support we get, those programs should be in place. So we cannot sit back. We have to do something. Issues of girls' education, we have to ensure that we provide for the environment for a girl, to enable the girl to go to school. So yes, the North has a responsibility, but even countries in the South have a huge responsibility for their population to make sure that there is development that is sustainable, development that makes its own population develop. Because it follows that if you do not send a girl child to school, they will not understand the need to have a smaller family. If a girl child has a big family, or if a family is huge, they will not be able to send their child to school. And if they're not able to send their child to school, that huge family will go back to nature in order to survive. And we will continue to degrade our landscapes. So this nexus has to be addressed. We cannot just sit idle and wait for other countries to do this within our own countries.
All right. Thank you very much, Honorable Minister, for that. I want now to turn to the gentleman sitting on my right here, who is Mr. Simango. Mr. Simango, as I said when I introduced him at the beginning, is the director of the All Africa Conference of Churches, and he sits at the liaison office at the African Union in Addis Ababa. He's an experienced and accomplished human rights governance and peace advocacy leader. He really tries, his work has focused on how to bring voices from the underserved, underprivileged people to decision-making tables. So I just wanted to ask you, Mr. Simango, welcome to this discussion, and thanks for accepting to be part of this. This nexus, we're talking about reproductive health, population, environment, climate change, and sustainable development. How do faith-based groups look at this? Is this an important framework that you think needs to be looked at from the perspective of faith-based groups? Thank you.
Thank you very much, Dr. Eleya. I feel very privileged to be here today, and I think some of you might be wondering, what does faith has to do with climate change? What has faith to do with population? And what could be our reason and purpose as faith-based organizations to be present here? And some might think that faith actually could be more of a hindrance to progress somehow. But we're here to share a story as it relates to the question on the nexus as has been posed to us. You would understand that faiths do not have one common approach or one common understanding of the nexus between population, climate change, and environment. So there's not one specific story to look at. But for us in the All Africa Conference of Churches, just to say that we work in 43 countries in Africa, but we also have 204 members across Africa. So we bring together these members together to look at issues around justice. And as it relates to population and the environment, we use our faith as a resource to begin to enter into this dialogue on the nexus. And so, for example, for us, we are Christians, what we have started doing is actually to read the scriptures with the lens of population, read the scriptures with the lens of climate change and the lens of environment. So one popular verse among Christians that you would hear is what is taken from Genesis 1 verse 28, which says, "And God blessed them, and God said unto them, be fruitful and multiply and replenish the earth." Oftentimes people say that it's a mandate, and it's a biblical mandate, that we have to be fruitful, we have to multiply. But reading the scriptures, it also says that we have to replenish the earth. That's our responsibility. And so sometimes we tend to read the scriptures selectively to suit what we want. Like I read here, be fruitful and multiply and replenish the earth. So it is a responsibility given to human beings. And when God created earth, he rested on the seventh day, seventh day, and looked at what he had done, and behold, it was good. And he gave the responsibility for stewardship to man, because what he had created was good. If we look at what the word replenish means, I mean, there are English people here, you will be able to explain it much better than me. You would have to restore, you would have to restock, you would have to make up, you have to fill up, you have to renew, you have to replace. But sometimes there is selective interpretation of the scriptures. What we are also saying here, one of our main theme as we were coming here, we brought together bishops from about 30 countries to reflect on preparing for COP26 in terms of what our key asks would be. And what they recommended for us in the reflections was that we should take this theme, which is the welfare of the earth is our welfare. So if we take care of the earth as humans, the earth would take care of us. So it's a cyclical relationship. And the more we throw waste, the more we throw toxics to Mother Earth. At some point when it throws back to us, I mean, when the earth begins to throw back to us, then we have intensity in droughts, we have very intense cyclones, and we are not able to cope with. So the mandate for us, as we see it in the All Africa Conference of Churches, is to take care of the earth and reading the scriptures in a different way, and also saying that we have a responsibility to replenish the earth, knowing that creation itself, I mean, from what I have just said, it is an expression of God. And when God created the earth, he saw that it was good. And it is our responsibility as human beings to maintain the status quo of what the earth was. If we multiply more and take more from the earth, I think we are going beyond what our call is. And that's the reason why we are interested in the whole issue around the nexus. And for us is to create the dialogue and the spaces, in the sense that we come from different denominations, and we also have sometimes doctrinal differences. But we think it is important for us not to sit on the sidelines, but to create the spaces where we can already begin to have that dialogue.
Yeah, well, thank you very much. Are there specific things that you your organization is doing, especially in trying. I saw that you were at the ICPD conference in Nairobi in a big way as well. This is the space where maybe the church has shined. Are there specific things? How do you see this agenda going forward, especially in looking at how this nexus goes?
Okay. So thank you very much. We have been working since I joined the organization 2 years ago, and I know very well that we were involved in the ICPD conference in Nairobi in 2019. And I know that there was lots of controversy from faith groups and some actually demonstrating around the venues in terms of this is a foreign agenda when you're talking of population. But for us, it's actually an opportunity for us to begin to reflect what does this mean to us as opposed to sidelining that. We were coordinating a group of faith groups that were interested in dialogue, and we were even able to come up with our own statement. And so 2-3 things that we use a resource is actually this theology of responsibility and stewardship. And our interpretation of theology is God talk. How do we talk about God when we talk of creation? How do we talk about God when we see the environment? How do we talk about God when we see population and possibly the nexus as well? And also the theology of sustainable families. Like the minister was saying, that the more we are and the more we empower the girl child to be able to control or to be able to have the number of children that they would have decided on, maybe the better it is for the environment. Because the more we are, currently in Africa, we talk of a demographic dividend. And we have so many young people. And we see how many people are drowning in the Mediterranean or trying to cross the Red Sea to go to the Middle East because they don't find opportunities. And what we are saying is that we should be sustainable. We should be able to have what we know that would be able to sustain in terms of our relationship with the environment. We also have, because we think evidence is very, very important, we talk of, we have been facilitating dialogues in terms of trying to say what's the nexus between faith, science, and climate. And just before we came here 2 months ago, we had one dialogue with UNEP, Faith for Earth Initiative, Stockholm Environment Institute, and us as well, trying to say what is the information, the evidence that is out there that can inform our interpretation of the scriptures is very, very important. We also have taken interest in the AU population policy. They're currently going through a process of coming up with an African Union policy on population. There is no policy at the present moment, but the member states of the African Union have already started a process of discussing population, and we as faith leaders or faith organizations are already participating in that process.
All right, thank you. I think I would like to also just turn to the minister. I think what Mr. Simango just pointed out here, that this is a controversial issue. I think you often hear that it's a foreign agenda, you know, and part of the reason maybe the P word that I talked about, population, is forbidden here, is that people don't want to touch it because it's like a sensitive issue. But I think as you've heard from the Honorable Minister here, the leaders in the Global South in Africa are seeing the visible impacts of rapid population growth, how it's affecting people. And I think if we want to help them, then we need to listen more to what the leaders there are saying rather than box the development agenda. But Honorable Minister, I think you wanted to say something also in reaction to what Mr. Simango here said.
What I wanted to say is that the issue of politics is at the center. Because even us as politicians, we shy away from talking about the population issues and the reproductive issues because we do not want to offend sectors of the church, but also cultural beliefs. And so we will share even here because the politicians are the ones that draw the agenda for this COP26. So even that is not highlighted in the discussions at COP26 because of politics. So and people are looking out for votes. You don't want to lose votes from a certain sector because then you have talked about something that's sensitive for them. But I think what we need to be doing is to begin to sensitize, to work together with faith leaders. And we have in the past, but not to address reproductive issues of the population. Unless we do that, I think we'll just be going round in circles. The faith leaders are critical in this conversation because the citizens listen to the faith leaders. Once they start to highlight their voices, the politicians will follow because the leadership would have been taken by the church. They should now redefine. God did not say we just multiply and not look after the planet. No. So that, the other part of that conversation, of that thinking, should be highlighted by the church so that it makes the politicians comfortable to even talk about it. Because we feel that the faith leaders really have a bigger audience than us, and we do not want to offend that audience, the followers of the faith leaders. So we need to now start to engage and sensitize, to work together with, and the faith leaders should take the leadership in this discussion. Thank you.
All right. Thank you very much. And at this point, I think I'll allow for a couple of comments maybe from the audience. But before we do that, I would like to welcome our fourth panelist, Dr. Paul Disanka. He was speaking at another session. The meeting had to be shifted there. But Paul he actually manages the unit that supports national adaptation plans in developing countries, including less developed countries from UNFCCC. And he also manages, the unit also manages the mechanism on loss and damage. And over the last 20 years, he's been supporting adaptation planning under the convention at UNFCCC. And we thought that it would be important in this discussion to bring him on the table here, maybe to speak to a couple of issues. But first of all, welcome, Paul. We're talking about this nexus between population, environment, and development. And so when we did a look at the interconnectedness between climate change and other development issues, whether it's gender, it's population, it's food security, and so on, how should countries in low and middle income countries respond as part of adapting to climate change when there are all these interconnected issues?
Thank you very much, and sincere apologies for being so late to this. That's a very important question. In the early days of adaptation, we used to focus on individual projects where we focus on one solution, one community, etc. But over time, we've very quickly learned that things are very interconnected. It's all about people and their vulnerability and so forth. And any solution does need to recognize how things are interconnected and perhaps develop solutions that address multiple benefits. There's a lot of support now under the convention, several funds, some of them quite big, such as the Green Climate Fund. So it's essentially up to countries to mobilize their communities, local governments, subnational level, etc., to actually put together projects that have significant impact in the long term. I think issues of youth, gender, and so forth, they all need to be interwoven into a solution. I think days of just saying we'll go plant trees and that's it, that's the solution, count how many trees we planted, I think those days are over. We do need to see how are things connected locally, regionally, globally, and so forth. Adaptation is a very global problem, so it needs solutions that cut across all the scales and stakeholders and so on.
Yeah, and maybe if you can just... thanks a lot, Paul, for that. But maybe if you can just follow on to that, and in terms of part of your work, you help countries to monitor progress. How do you see this agenda moving forward, whether it's in relation to the SDGs, especially when you are looking at these, how the countries have to look at the interconnected issues as we are discussing here, in terms of a measurement?
That's another $1 million question. Am I on? I think early on in any project, we count inputs and outputs. How many reports have we produced? How many stakeholders are in a workshop, etc. But very quickly, we are realizing that we do need to ask deeper questions about how effective are the interventions that are being supported. That requires going a little above a project and an activity. SDGs provide that initial entry point, but we are struggling in the discussions under the convention, under the global stocktakes. How do we measure concrete outcomes and results of adaptation efforts? That requires, I think, as I said, looking beyond individual activities to something that captures the essence of what we're trying to achieve. So reducing vulnerability and making communities resilient to climate change, the ability to bounce back. We're not going to ever be able to avoid losses from climate change, but it's how we're able to handle it. So instead of focusing mostly on disaster risk reduction and preemptive actions, we have to think about how do we address losses when they happen, how do local communities recover when their houses get washed away, etc. We have to build that into solutions so it's not an afterthought or just rely on humanitarian efforts as a charity when it happens. We do need to integrate this into planning.
All right, thank you. So let me just open up to you. I don't know how many people want to say something quickly. We have one here, Robin. Yeah?
Shall I stand up?
Yeah, and I think you can use this for the other people.
Can you hear me? Is that good? Thank you so much, and thank you to the WHO for hosting this event. And I just want to say how refreshing it is from all the speakers to hear you talk about the population issue, because it has been a real, as you said earlier, a P word which nobody quite wanted to say. And I completely get it. And I think the responsibility on the global north to curb consumption and to cut greenhouse gases, that's absolutely the primary driver. But to hear the Minister, and thank you, Minister, for being so clear on this, that equally there is a role for countries with high population growth to address that, primarily for the benefits of the women and girls directly. But I heard you say, and I think also earlier, that there is a benefit in terms of biodiversity and climate change longer term, and that benefit will come back to those women and girls in those communities, because they're going to be the ones most hard hit by climate change impact. And I just really wanted to ask why you think, particularly politicians here, our own politician, let me not say that he's got 7 children, but I think he has and counting, but there is no mention of population in terms of its, not just adaptation, but its contribution and its mitigation of when you have met the unmet need for those hundreds of millions of girls, not only for education, but for safe family planning. And it seems to be a dirty word, but not one that you find difficulty speaking to. So I just wanted to ask you to talk a bit further about that. Thank you so much.
Thank you. Go ahead, Honorable Minister. And Giovanni, maybe, I don't know, there are some people who have joined us online. I don't know if there is anything that people are saying there, if you just want to summarize, or if there's something. If not, yeah, Honorable Minister, over to you.
Thank you. Yes, indeed. Yeah, like I said earlier, there's not been much said on the population and reproductive health. But for us, we cannot avoid it anymore. We just have to grapple with it and deal with it. Because the rapid rate is 4% per annum in Malawi. And it is impacting on the environment, like people like homes, so the requirement for fields to farm on. It is because of this population growth. It's the main driver of degradation in our country. So for us, we have no option but to deal with it. The challenge I think that we have in Malawi is that we tend, and I think throughout the South, operating in silos. So like he said, we encourage communities to plant trees. We should be now dealing with talking to the Minister of Health. The Minister of Health should be doing their part. The Minister of Education, and I'm glad that now there's that realization, the Minister of Education is here dealing with that. And we are working closely with the Minister of Education to ensure that we embed issues of the environment within the curricula of the Minister of Education. But we have to work with the Minister of Agriculture for smart agriculture, as we're going to build adaptation build resilience within communities, we have to work all across. But the way we operate, I think, is we have a budget for our ministry for this year. Let's do the activities. Well, there is no opportunity oftentimes to integrate, to work across sectors in government. And I think that's where we need to start the conversations. How can we integrate all programs within our budgets that lead to safeguarding of our environment? But bottom line, it's the issue of the population. Is it an education populace? Is it a populace that has access to reproductive health services? Is it a populace that has been sensitized on smart agriculture, on issues of the environment? So all these are issues that we need to grapple with, and we need support, but we have to do our bit as well. Thank you.
All right, so I think we have to be wrapping up this, but I'll let you just quickly maybe come in and make it quick if possible. And then I'll ask the speakers just to give us their take-home message, starting with you, Joanne, there online. Yeah, please, go ahead.
Okay, thank you. Thanks so much for your contributions. I think it's been really fruitful for us, for also lots of food for thought for us. I would just wanted to just highlight one topic that perhaps sometimes it's missing in this kind of discussion. We are quite focusing our discussions on the need for people to be educated and for sexual and reproductive health and rights, and also knowledge and education for people to reduce the number of children, etc. But also, we need to take into account that the countries also need to implement social security policies for people to be able not to need to have more children, for them to afterwards to take care of the elderly. So because this is something that is happening in the Western countries, in the global North, so we cannot ask other countries in the global South to do the same if you don't have structures enough to implement social security, strong welfare state structures that takes care of the elderly. So this is something that sometimes it's missing in the discussion. So.
All right, thanks. I think that's well noted. I think if you ask the minister, she can go on and on talking about maybe efforts that are being made. But Joanne, I'd like to bring you in just to kind of give us, in practical terms, what do you think are the most critical things that whether it's governments or other actors need to take into account to operationalize the PED Nexus?
Thank you, Leah. Maybe I just like to premise it by saying that based on experience, the PED approach is complex, but it is doable and build resilient people and ecosystems, especially in lower middle income countries. And if policymakers and other development practitioners acknowledge the PED Nexus as a valuable framework, break silos, and invest in holistic package towards strengthening local capacities, empowering governments and organizations to seek collective results through efficient utilization of scarce resources. And this can be done specifically by creating dialogues and forging and consolidating partnerships between health, climate change, environment, and development actors at all levels on systems thinking, planning, and response. We need also to identify opportunities for integrating the PED package within the country's intended nationally determined contributions and related policies and programs. They also need to invest in a PED package of services that include accessible family planning and reproductive health services as part of climate change compatible development strategies in order to achieve the co-benefits of climate change and management outcomes and health outcomes. So that's my contribution.
All right, thanks a lot, Joanne. And I think we really have to wrap up now. Mr. Simango, your 20-second take-home message coming out of this discussion, if we're wrapping up now.
So my takeaway message is the welfare of the earth is our welfare. And also let's take faith as a resource instead of it being a barrier because of the access that faith communities have to populations. Thank you.
Dr. Disanka people have said the population factor seems to be forbidden here. You had the UNFCCC. Should people have hope that this will become a key issue in future COP deliberations? Or maybe what's your advice on what needs to be done to reinforce this integrated approach in looking at climate change issues?
Thank you very much. We live, our process is the diplomatic process. So in that sense, it's very country-driven. As long as countries continue to push for an item, it will continue to appear on agendas. Issues of population appear actually across many aspects. It's not just about controlling numbers of people, but also reproductive health and how to deal with people when they're displaced due to impacts of climate change. So that's a huge topic. Displacement, migration, either locally, internationally, etc. That we actually have a special expert group, a task force on displacement that deals with these issues. So these issues are there. We just have to look at the details as to how to best benefit from what they're producing. So this is an important topic. It is covered in multiple ways. So let's find ways to build on that and enhance on that. Thank you.
All right, thank you. And Honorable Minister, maybe just give us the last word and then we are out of here. Yeah.
Okay.
Oh, you want to comment? Oh, from WHO, okay. Maybe you should go first. I want to give the Minister the last word out of protocol.
Yes, thank you so much. So, thank you so much for being here. My name is Antonis Kolimenakis. I'm representing the African Regional Office Team for Climate Change and Health. I would just like to comment that even though we are hosting this event, just kindly to let you know that we do not always share the same views of the speaker and participants, and I think this can be well understood and democratic. And just two key messages that I would like to pass is that for us, ensuring access to sexual reproductive health is a human right, and we promote it in adaptation and development context, but not as a mitigation option. So I would just like to leave you with this message from our side. Thank you so much.
All right, thank you. And I think, yeah, Honorable Minister.
For us, we already are working on issues of reproductive health. We are working with World Health Organization, WHO. We are working with UNICEF. We are working with UNFPA to ensure that there is access to reproductive health. Sexuality issues are being discussed as we speak. There's programs, but what we need is more support. All these issues are embedded in our NDCs, and we submitted our NDCs here. We would like to realize what we have submitted. What we require is support, more support. We are getting support from these UN agencies, the ones I've mentioned, but I think more needs to be done. We are suffering. The country is now completely, in my view, we need restoration, massive restoration. And we need to tie these issues, this nexus has to be recognized across all sectors of governments in the LDCs, in Africa. These are issues that we all must champion. And I hope that COP27 will put issues of reproductive health and population at the center of its discussions. Thank you.
All right, thank you very much. I think I speak on behalf of all of us here to thank the Honorable Minister for sparing your time and sharing those deep insights to the group here on the really contextual realities that countries, not only Malawi, but other countries are experiencing. Thanks again, Dr. Disanka. Thanks, Dr. Castro online and Mr. Smango. And thanks a lot, everybody, for being part of this discussion. I would just like to note as we finish here that actually this discussion was made possible by a program called BUILD that AFIDEP, where I work, the African Institute for Development Policy, is leading a consortium that includes PACJA, Pan-African Climate Change Justice, lead Southern and Eastern Africa, led by Professor Chuota here. We have FHI 360 and PFPI in Philippines. And the whole aim is really how to promote uptake of evidence and advocacy to promote the PED nexus in the environment sector. So we hope that this has been a useful discussion, and that from now on, I think what Dr. Disanka said, when we talk about population, it's not just population growth, it's actually population change. We're talking about population change. There's age structure changes, about the demographic dividend issues, there's migration, forced voluntary migration. But I think the critical thing is that we can't really talk about sustainable development without looking at how people and the population dynamics are impacting and being impacted by climate change. Thank you very much. It's an ongoing discussion. We are out of here. Thank you.
Good morning. We're about to start the session. I hope that can you hear me? Super. So, is it okay? Great. So, good morning, everyone. Thank you so much for joining this event. For those here at COP, I hope that you have had a wonderful few days. We're very happy to also welcome in for this particular event to people online. We're very happy to have hybrid models so we can include people who are beyond these walls. Let me first introduce myself. I will be your moderator for today's session. My name is David Imbago. I am the chair of the Adolescents and Youth Constituency of PMNCH, hosted in WHO, and also Strategic Partnerships and Programs Coordinator at Core Group. I have been here for about 5 days, and I have been feeling so inspired by leaders, especially young leaders from across the world who I had the privilege to meet over these past few days. I also had the opportunity to meet Rosamund, the mom of Ella Roberta, last week, who died at 9 years old due to air pollution, and is the first person in the world who has air pollution on her death certificate. In addition, in my experience as a health provider, I have seen in the Amazon rainforest how pollution also affects young children and adolescents in communities that are affected by mining and also oil drilling, who have terrible skin conditions, and these are things that are not shared widely. This is the largest cohort of adolescents that we have had ever. We have 1.2 billion adolescents living right now in the world, and I think it's very important to highlight this number because we need to be aware of how many people are affected by climate change and how many of these are adolescents and young people. Today, I'm delighted to welcome you to a conversation that will focus on the intersection of climate change and adolescent well-being. But first, we need to start talking about what is well-being in the first place. We usually use the words health and well-being as things that are interchangeable, but they are not. When we talk about well-being, we're going beyond health, and particularly PMNCH, in partnership with different UN agencies and other partners, develop a definition of what well-being is. Adolescent well-being is achieved when adolescents thrive and are able to achieve their full potential. One of the recommendations from the call to action of PMNCH for adolescents' well-being is for a holistic, multi-sectoral approach to adolescent well-being. And we have developed a framework for what is well-being in this case, which underlines 5 domains, which I will mention now. The first one is good health and optimal nutrition, and you will see that health is only one of the 5 domains, because we're going beyond health for when we talk about well-being. The second one is connectedness, positive values and contributions to society, safety and supportive environment, learning, competence, education, skills, and employability, and the last one, agency and resilience. Please do check the COP26 edition of the PMNCH Advocacy Brief that is titled Young People's Fight Against Climate Change, and you will learn how we are seeing the intersection of climate change and adolescent well-being. At a recent event organized by PMNCH, I heard a poem by a poet called Mumbi Makaria, which has a line which I would like to resonate right now. If you're not on the table, then you are on the menu. And I think that that's particularly important here because this panel includes young people and adolescents themselves who are the people affected by climate change and who should be here speaking about the issue and speaking about how they see their contributions as well. Adolescents and young people are among the most heavily affected by the impacts of climate change while having contributed the least to the issue. As adolescents and youth will carry this burden of climate change, it is all the more essential that partners engage as meaningfully in matters that affect our own well-being. Partners have come together to agree on the definition as well of what meaningful youth engagement is, and you can also see what the definition is on the PMNCH website. Now, without further ado, let's proceed with this fantastic lineup of speakers. Today's event will focus on how climate change and adolescent well-being are related, what youth is doing to tackle climate change from a health and well-being perspective, and why the engagement of young people is critical, and why we need to start working on building resilience to climate change now. Before I introduce you to the amazing panel, I would like to start with a keynote speech by Helen Clark, the PMNCH board chair and former Prime Minister of New Zealand.
Buenos dias, David, and greetings everyone from around the world, and to those of you able to meet in person in Glasgow, and great to be with you for this PMNCH event at the COP26 Health Pavilion. The climate crisis is one of the greatest public health threats of the 21st century, and adolescents and young people are among those worst affected by it, despite having contributed virtually nothing to it. In our world today, we have 1.2 billion people aged between 10 and 19 years, the largest ever adolescent generation, making up around 16% of the world's population, and as much as 23% in some developing countries. Almost everyone under 18 today is exposed to at least one climate and environmental hazard, and many are living in countries at extremely high risk from the climate crisis. Adolescents and young people living in low-income countries and humanitarian and fragile settings and small island developing states are particularly vulnerable, actually facing a perfect storm of challenges to their overall well-being. And those risks could include extreme weather events, whether they be heat waves, drought, floods, storms, wildfires, and those events are often compounded by shortages of food and water, poor sanitation, damaged infrastructure, and lack of access to education and to health services. So we see the direct and the spillover impacts of climate change posing the greatest risks to adolescents and young people's well-being, impacting on both their physical and their mental health. The direct health risks could come from rising temperatures and increasing air pollution. Pollen seasons and conditions for tick breeding are longer, and malaria and other mosquito-borne diseases are being found at higher altitudes. On mental health, we see rates of post-traumatic stress disorder, anxiety, and depression among adolescents increasing significantly after climate-related disasters. And that in turn increases the risk of self-harm, of suicide, the third highest cause of death in older adolescents aged 15 to 19. The impoverishment and the forced displacement caused by extreme weather events is also traumatic and dangerous for adolescents. Evidence from experience of drought, for example, in the Horn of Africa, shows how girls are put at greater risk of sexual and physical violence, of child marriage, and of teen pregnancy. So, world leaders at COP must recognize climate change as a global health emergency impacting on adolescents and future generations severely. And we must support the resilience of adolescents and young people and place their needs at the very center of adaptation policies and promote and protect their rights to be heard. That is what the Global Consensus Statement on Meaningful Adolescent and Youth Engagement of PMNCH and the Call to Action for Adolescents, launched by PMNCH and partners, are all about. The need to engage and empower adolescents and young people in all matters concerning their well-being. And adolescent well-being should be being prioritized in the nationally determined contributions. And as we build climate resilient health and other systems and infrastructure, and we do need multi-sectoral approaches, holistic solutions like net zero carbon cities, which cater to the needs of adolescents and young people. The Call to Action for Adolescents from PMNCH emphasises multi-sectoral approaches and the need for a focus on adolescents and youth in the Sustainable Development Goals Summit planned for 2023. If we are serious about delivering on the SDG promise of leaving no one behind, we have to accept that the well-being of adolescents and youth is a non-negotiable priority and that the cost of inaction is just too high. If we fail to act now, the harm caused by the climate crisis will be far greater and longer lasting than even the very serious damage inflicted on our societies by COVID-19. I think the eyes of the world's adolescents and youth are on Glasgow right now. And let's hope negotiators don't let them down. Let's do everything we can to ensure that adolescents and youth and their needs are front and centre in designing the inclusive and resilient zero carbon world of the future, their future and our common future. Thank you, and back to you, David.
Thank you so much, Helen, for those inspiring words and for continuing to be, for your ongoing and permanent support for climate change, for adolescent health and well-being, and for also championing meaningful adolescent and youth engagement here. We're very happy to have you as board chair and for your words. Now, over the past week, we have also been hearing from young people from around the world talking about their personal experience on how climate change is affecting their communities and is affecting their well-being. And we have prepared a short video for you as well, so we're making sure that many young people are represented in this panel beyond the ones who are actually here.
I'd like to tell you about how extreme climate events particularly affect me as a young woman living in a climate-vulnerable country. When these events occur, young women are more likely to drop out of school, be victim to sexual and physical violence when living in temporary shelters, and they disrupt access to reproductive health services that young women rely on.
The impact of climate change on young people is through different directions. Just for your information, I would like to tell you the results of the recent study according to the Lancet Scientific and Medical Journal. 3 out of 4 youth are anxious about their future. In Australia, India, Portugal, Brazil, Philippines, around 80% of youth find the future frightening.
Hi, my name is Mark Haver, I'm 23 years old, and I'm chair of the Sustainable Ocean Alliance Youth Policy Advisory Council based in the United States. When I went to college for 4 years, I didn't anticipate that I'd have to evacuate 3 times because of hurricanes. I'm from Ellicott City, Maryland, and I wouldn't have anticipated that not only in 2016 but 2018, my hometown would be destroyed by climate-related floods. Before we make the ocean our enemy in the fight against climate change, we must seek to leverage it as our friend.
What I noticed from the climate change that it is really affecting our life, especially in Yemen, because recently we had some floods, and these floods destroy many houses, and many people lost their houses. And not only that, it's affect the historical countries, because in Yemen we have like many traditional and historical countries from like thousands of years, and they got destroyed. But unfortunately that my country or the stakeholders of my countries are not really care about the climate change issue, because honestly it's not a priority for our country because of the current conflict and the war situation.
To ensure climate adaptations, global and national leaders need to make the policy and legal framework friendly to smallholder farmers, support learning institutions to offer ecologically sensitive education, and also increase investment in peasant agroecology.
The global and national leaders need to invest in meaningful adolescents and youth participation in decision-making about climate adaptation. We are the ones who will experience the adverse effects of climate change for all our lifetime. That is why we deserve to have a voice in the processes that directly concern our future. Young people ask for more accountability, young people ask for true commitment, and young people ask for the space to speak up.
Oh, that was very inspiring and interesting to hear from people not only here at COP, but who are beyond these walls and who are actually being affected by climate change. On that high note, I would like now to move to our first panel discussion, and I will start by introducing you to the stellar lineup of speakers that we have for you today. To my right, we have Marina Romanello, the research director of the Lancet Countdown on Health and Climate Change. Welcome, Marina. We also have Hita Lakhani, the global focal point from Yongo, and to my right as well, Julieta Martinez, founder of Tremendas Collaborative Platform and co-founder of Latinas for Climate. Thank you very much for being here. We might have two more speakers who are still coming, but if they come, I will introduce them later. So let me start with you, Marina. Marina, just a few weeks ago, the Lancet Countdown published its new report on the impacts of climate change and health. As the director of research, do you think that there is enough research on the potential impact of climate change on adolescents' well-being? What are the research gaps and how do we address them?
Thank you, and thank you so much for this incredible panel. To answer your question very short, no, there's not enough research, absolutely not. Adolescent health in general is not being researched and is not being looked at even from hospital settings. Very, very few hospitals have a guard that is dedicated to adolescent health, and adolescents are generally being included within children. That goes from children from 0 to sometimes 17, 18 years old, or adults, and they're neither. As we have heard, adolescents are we know they're quite resilient. We know it's a relatively healthy age, but they also have very important vulnerabilities, and particularly to climate risks, and that's where they come in. And not only because of their vulnerabilities, but also the essential role that they play today and they will play in the future to address the health and climate crisis. Mental health risks, mental health adverse outcomes develop mostly on adolescents. They're very vulnerable because they're developing their psychosocial, their behavioral world, their social environment. Climate change through extreme weather events, through extremes of heat, affects massively mental health, and that is a very challenging thing to look at, none least because we don't have a unified definition of what mental health is around the world, so it's really, really hard to address this in a fair way. They're also very vulnerable, for example, for injuries, road traffic injuries. That's the lead cause of death for adolescents. And in our urban design, our urban planning that is so central to addressing the climate crisis, urban design needs to take into account the risks that our roads, the way that we live in urban centers is affecting adolescents, and also the central role in promoting their well-being through more socializing space. They spend time outdoors, they have friends, they have a social life, and they're the center of the social activity in many times. And that's excellent for society, for building a sustainable future. So they need to be empowered. And they're powerhouses. We have seen the youth movement that has completely changed the way the world is addressing the climate crisis and the way we are responding. So they need to be empowered, and their voices, their interests, and their health needs to be at the center. There will be the people, the workers, and the adults from now until net zero in 2050. That's what will happen. They will be the ones taking this forward. So they really need to be at the center of the conversation. And unfortunately, today they're not still.
Thank you very much, Marina. You're absolutely right. When we talk about adolescent health and well-being, we usually talk about the triple investment dividend when we are investing in adolescents that are youth themselves now as future adults and also as potential future parents who will also be leading the next generation. So it's very important what like you were saying, the importance from so many angles, mental health, from injuries, from direct effects of climate change, of course. So yeah, I do hope that next year when we have the next Lancet Countdown, we'll have like specific focus on adolescent health and well-being. I'm sure that it will be the case. Let's hope that there will be more research as well from different partners who are engaging on the topic of adolescent health and well-being, and also from climate change and how we're intersecting these two areas. Thank you, Marina. Let me move to Hita now. And just give me one sec. Hita, Marina just spoke about the importance of adaptation assessment on adolescents' resilience. As the global focal point for Myongo, what are other the priorities on adolescent well-being that you're advocating to be included in countries' national determined contributions while you're here at COP?
Thank you so much for that question. So for those of you who have never heard of YOUNGO before, YOUNGO is short for Youth NGOs, and we're the officially mandated mechanism for engagement of youth under the UNFCCC. So we're not an organization, we're not an entity, but we're a mechanism, we're a group of volunteers from across the world. We have close to 10,000 volunteers or 10,000 people who are part of the membership who come from 160 plus countries and close to 1,000 plus organizations that form the membership. And at COP in itself, we have close to 100 to 150 at any given point that we've managed to bring as a YOUNGO delegation to COP26 this year. And it is one of the largest youth delegations that YOUNGO has ever brought to a COP, and that has come in support through a lot of other entities because we don't have badges of ourselves, but we've gotten support from lots of different entities to bring young people. What we do is we work with youth, of course, throughout the year, but also at the UNFCCC sessions. Our main focus is on the UNFCCC because we are part of their mechanism, we're part of their process, and we can send representatives to meetings, we can have speaking slots, we have interventions that we can make, so on and so forth. So through the process, we engage young people. We've been doing capacity building workshops, we've been doing sessions, and we have working groups that function throughout the year on different topics. So we have close to about 20 working groups focusing on different topics. One of them is focusing on the NDCs. And this working group has been trying to engage at home, but even otherwise, how do you work with different entities, say, for example, the UNDP Climate Promise with the NDC partnership, but with countries back home on championing processes, on championing the NDCs, championing ambition, trying and getting youth inclusion or a consultative process when NDCs are being revised. So it's super hard to focus just on adolescent and to answer in that sense because we're working in general with young people. But we do have a lot of people, mostly my members are between the ages of 15 to 29, 30. So it's a little bit of the adolescents and then it's youth in general that are part of the constituency. But we're open to anyone under the age of 35. So the range is varying, but this is where the majority lies. Focusing specifically on the NDCs, it's not the easiest across the world to work with governments to champion whatever the agenda might be, whether it's youth inclusion, whether it is looking at well-being, whether it is looking at different aspects of NDC engagement. So the working group has been functioning through its volunteers, through its members. Quite a few of them work pretty closely with their offices, with their national governments. But each country is very special. Each country is very different and they focus on different ways when it comes to engaging youth. So there are certain countries who are really, really closed. I had yesterday a negotiator from a country that I won't mention, but who told me that young people, negotiations are not meant for youth. It's super technical and it's super boring and we don't get it. We work until late in the night on Excel sheets and this is not something that youth are interested in. And telling that to a young person who has been part of the negotiations for 6 years, doing exactly what he's been doing. So it's different from country to country. There have been youth events led by countries where we've been told as part of the advisory board that youth cannot contribute to technical negotiations. So there are different countries who have different approaches. But there are some really good practices that we're seeing, and I also met the Minister of Foreign Affairs from Panama on Youth Day, and she was saying how the entire delegation is entirely young or mostly young, and the average age of the delegation is between 27 to 29 years. So there is champion countries like this. I also just got a text, which I haven't finished reading yet, but I got a text from somebody saying that Mexico also has one of the youngest delegations. The average age is around 30 years old. So there are a lot of champion countries who are working with young people, not just at the NDC process, but also to bring them into the UNFCCC, build the capacity and ensure that youth are negotiating that at the tables. So there are two sides of the same picture where you really have, on one hand, somebody saying that, technical stuff is not for young people. You should go out and work in your countries, tell young people to do bottom-up action, tell them to, make individual change. But at the other hand, you also have countries that are really supporting and, including young people. So national level action really varies across the whole scale. But we do have a lot of great partnerships with a lot of UN agencies, but even outside organizations that we've been working with to try and ensure that youth are meaningfully included. UNICEF is a really great example of that. For the past 2 years, we've had amazing support. They've also, of course, supported to bring 51 youth to the COP in getting them badges. But other than that, they've also been working, of course, because their mandate is with children, they've been working with us to ensure that we are championing whether it is inclusion, whether it is any declarations that they're part of. It's really been a bottom-up approach with them. So there are pros and cons in the UN, outside and in country-wise. So it's not a very direct answer to your question, but the situation is a lot more complex than we would like it to be.
No worries. It was a complicated question in the first place, so it was a complicated answer as well. Thank you very much, Gita, for guiding us through how youth are being engaged through the UNFCCC processes. I think that, it is, for someone who is also trying to engage in climate change as a young person, it is sometimes overwhelming just to be here to navigate through the processes of UN. Usually is not very youth-friendly, so we're doing our best, and congratulations to Yongo, who is doing amazing work to engage young people in these not so easy issues. Now we have also been joined by two additional speakers, and I will introduce them now. Mohamed Eisa has joined as well. He's the liaison officer for public health issues from the International Federation of Medical Students Associations. And also we have been joined online by Mr. C.K. Mishra, former secretary from the Ministry of Environment, Forest and Climate Change from the Government of India. So I will go to the online section now, and I will ask Mr. C.K. Mr. C.K. Mishra, we have been speaking about gaps in research, the need for adaptation assessment, and prioritizing young people's well-being, including health. How do you think governments can accelerate the action in adaptation policies that address the resilience of young people and future generations? What will prompt governments to scale up adaptation finance and policies? Please. And I'd just like to kindly remind the speakers to please keep it to 2 minutes so we can finish the whole presentations. Thank you. Mr. CK.
Thank you. Thank you for the opportunity, and thank you, PMNCH, for organizing this, not just because I've been closely associated with the organization, but I think it's most timely. I wish we'd been doing it earlier and doing it more strongly. The reason why I say this is that if climate change is a reality, so is its effect. And if these two are the greater reality in this is that the most vulnerable population will be the adolescent and the younger generation, because they are the ones who in coming days are going to face the fury of climate change. So they must be at the center of our attention. You know, I've been to many COPs, and in all COPs, the focus is always on mitigation. It's time we move to adaptation, recognize reality, and start looking at adaptation world over. We've been talking in various COPs on resilient infrastructure, resilient industries, and a whole lot of resilient concrete things. But we've never spoken about how do we make human being resilient given the fact that climate change is a reality. What is the coping mechanism that we are trying to give adolescents today to cope with the future challenges of climate change? And let me be very honest. This webinar is successful only if it is able to influence decision-making at COP. Otherwise, it really means nothing. And when we plan for the adolescent, we can't do it in a standalone basis. It had to be integrated approach in the overall growth story of an individual country and the globe as a whole. We've been looking at perhaps the correct deal project. We always talk about assessed needs of the adolescent and youth that we are assessing, not the expressed need of the adolescent. Let the adolescent decide, let the youth decide what they want, rather than our imposing what we think they want. So given this background, let me just quickly put the whole thing in 3 compartments. The first compartment that I would like to talk about, and I'll only mention the points because the time is limited, is what do we need to do for this? So what we need really is A, finance, regular identifiable finance. B, technology. The globe needs to break barriers of technology transfer. C, we need to make our entire planning process tailor-made. That is, let's say the urban development planning, for example, must be focused towards the adolescent and youth so that they are able to become more resilient. And D, has to be country-led. Let there be no mistake that there is no global solution to the problem. It must be a local solution led by the country, but certainly helped by global thinking and global planning. The second category that I would really like to talk about is that what is it that we need to focus on? Here I would like to say that A, we need to focus on institutional, continuous, identifiable resources for adaptation. It's not going to be a story of one-time infusion of funds. Unless in our regular planning process, we are able to identify and place finances at the disposal of adaptation, we are not going to succeed. And let me inform you here that India is perhaps one of the few countries, or perhaps the only one, which has an national adaptation fund. But even that is focused on infrastructure, not on human development. Infrastructure is important to protect human beings, but they need to be resilient enough, knowledgeable enough to take care of themselves. B, I would like to say that we need to factor in adaptation in all our policies. There is a bit of health and bit of climate change in everything that we do, every ministry, every department. That integration must happen on a common platform. Unless that happens, the youth are not going to get what they deserve. And C, let us try and improve resilience of services. So to fast track this, as the question said, let us put in finance where it is required. Let us look at sanitation, let us look at water, let us look at health, let us look at education. And above all, if I may say so, let us look at preventive health, because we must start talking about well-being of the adolescent and youth. That is where the future for them belongs. Let's not talk about in compartments of a disease here and a disease there. Let's talk about well-being. Let's talk about preventive health. And the third compartment that I would like to talk about is, what will the success depend on? And two things I would like to point out here. First, this will depend on the kind of partnerships we create. Let us not be under any impression that a single body or a single organization can resolve this issue. Governments, NGOs, civil society, youth organizations, any and everybody needs to come on a platform. It's not an easy job. So everybody needs to contribute his might, and realizing the need of the other person rather than the want of what he wants to do. So if we can create this kind of a platform, and governments must invest in this platform, they must provide finance to this platform, whereas others would do it as well. And the last point is that if you want really to fast track adaptation and take care of the adolescent and youth, promote innovation. And promotion of innovation is not just about encouraging innovation. It is actually about drawing up projects and plans for innovative thinking, for innovative production. And the innovation, again, I would say, must come from the youth. They know best what their future problems are going to be. Let them innovate for themselves. But once they have innovated, bringing enough finance and technology to bring it to scale. It's a huge population we are talking about, and we cannot let it be just at the stage of planning or at sporadic financing. Globally, we've failed on financing issues till date. I don't know what the current COP will decide, but it is up to the countries to muster enough finance and technology, and green ones at that, so that they can help others. Thank you.
Wow, thank you so much, Mr. Mishra, for that wonderful speech and presentation. I think that, we heard very loud and clear financing for climate change and adolescent health is very important. There is this quote that it's not my quote, but I really like it, is that true love is shown in the budgets, and I think that resonates here as well. So back to our in-person panel. Mohammed, as a young healthcare student, how do you see the role of the health sector in the discourse of climate change and adolescent health? How can building low carbon resilient health systems support adolescent well-being?
Yes, thank you so much for the question. And sorry for joining the panel late. So regarding this question, I believe when we get to talk about health systems, it's important to understand that health systems includes also the people. So it's not just the organization or the hospital or the government. No, it includes also the people whom we are providing the services to. So in our case, the adolescents are part of the health system. Okay, so so the adolescents are already part of the health systems, and it's very important that we get to focus also on their role. And from my side, like what I believe the health system should do, or like the organization should do, or the service providers should do, that they need to focus on the education and they need to focus on the service that they are providing to the adolescents, that it should be following a coordinated approach. And as it was mentioned here, it should be focusing more on the prevention. Yes, we are here to treat. Yes, we are here to stop illnesses and stop complications. But it's very important, and it's also very much like protecting and preserving our resources to work on the prevention of the diseases themselves. So, and one way of doing this is establishing the climate resilient health systems in which education is provided to adolescents, in which information is provided to adolescents about how climate change is affecting them, and including them in the establishment of these health systems, of these resilient health systems, and working, as I mentioned, on the coordinated approach. Because like adolescence, or like this period of life, it's a period of transition. It's a very important period in terms of even brain maturation, in terms of the social determinants of health. Everything keeps on changing. Their neighborhood change, their education change, even their peers and their friends change. So there will be so many different determinants that will be affecting their health. And in the absence of the promotion of like why climate change is important and why climate change is something that we need to focus on, they are vulnerable to, I would say, infodemics in terms of climate change and in terms of how they can be resilient to it. So in conclusion, what I would say is that the health systems, their focus should be on the education, on the awareness of the adolescents, and focusing on the approach that like starts from the very primary prevention or from the very primary healthcare to the very, like I would say, tertiary and quaternary healthcare approaches. All of them should focus on climate change and should have climate change as a part of their service provision. So yeah, thank you.
Thank you so much, Mohamed. Yeah, you're right on point. Information is so important. And actually, Julieta, you were mentioning about information yesterday during the high-level event on health. Now, I'm going to move to you, Julieta. You are the youngest panelist here. You're an adolescent yourself. So climate change has a huge impact on young people's lives, like we just heard. As a climate change activist, Julieta, what do you think are the existing challenges to including adolescents' voices and their well-being in the climate change discourse? How can adolescents and youth be engaged to drive the agenda of climate change and intersection with health forward and well-being?
Thank you, David. And I would just like to start by saying thank you for being here. Thank you for hearing about youth, about health, about climate action. And we need more of these spaces, inside and outside of COP26. So I try to keep it short, and just to give you a little bit of background of what I do, I came here because of an academy called Climáticas. That is an academy that got together 600 girls from Latin America and the Caribbean to give them access to environmental education, but with a gender perspective. Today, just the idea of being here is such a privilege, because I came here with 16 other girls, and some of them live in something that we call sacrifice zones. That, just to, maybe if you're not used to this concept, is a place that is completely contaminated. The air is polluted, the water is polluted, everything is polluted. And that girls are here in Glasgow today because they want to talk about how the mining industry have take all the water they have for the communities, or they can breathe. And why I'm saying this specifically, I think one of the main things that we should be talking about right now, that actually it's little by little is more and more in the table. It's about more than intersectionality. It's understanding that every single agenda that today we have, it's completely connected. When we talk about the health crisis, of course we're talking about the climate crisis. When we talk about a climate crisis, we are talking about a climate that has a woman's face. And I want to start by that, because yesterday was Gender Day, and I didn't say way too much about gender. Today, 70% of world poorest people are women. 80% of climate refugees are women and girls. Yesterday, I was learning about some statistics that the PMNCH showed that says there's a lot of girls that today are dying because of climate crises, like climate disasters, because they don't know how to swim, they don't know how to climb, and they get trapped, and they feel abandoned by the system. So I started this talking that we should talk about this inside COP and outside COP. I think the mic is kind of getting...
We can hear you.
Really? Great. Cool. I'm glad. So, and why I'm saying this, I'm pretty sure you mentioned it before, it's about education. Today, a fundamental tool that we must need and we must have is education. It's about making the information accessible. It's about talking about this, but how can we ensure that everything that young people are talking about in the streets are getting into actions, getting to the tables where decisions are being made? Because one thing is criticism, right? I'm angry about the system. I'm frustrated by the system. I'm sad about the system. So now what? What do I need to do? Where can I work? And I know how so many young people, so many young activists that today are making law projects, that today are making public policies, that today are making initiatives, but some of them, lots of them, don't find the space to talk about it. So, and just to tell you that yesterday a friend told me that I have been working for at least 4 months, 3 months on the first public policy, gender policy in my science ministry in Chile. It has been such a wonderful job because it was the first time that a group of young girls had the opportunity to talk about not only women get finished finishing this gap that we have, but also talking about girls. And I came back to intersectionality once again, because it's completely different to talk about people that live in urban areas than rural areas. If you're part of a migrant community, if you're talking about young people, if you talk about women, this is all these little details, let's say, that are not little. They are super, super important. So I think that's the biggest thing that we should talk about. And we need to remember that if we talk about sustainability, and I've said this before, it's not just about making a green world. This has 3 pillars that we must have into account. You have an economic pillar, you have a social pillar, you have an environmental pillar. And that 3 things must find a balance, must find an equilibrium. So we are working for an intergenerational dialogue, of course, but we need a long way to go. And I really hope that in the future, if I decided to have kids, or if I have to talk with younger generations, I hope that I really hope that they don't have the need to be activists, but not because I don't like activism, but because it's not needed, because we did what we made to do.
Julieta, thank you so much for those inspiring words. You thank the audience for being here, but I really thank you for being here in this panel, because you are an adolescent yourself who are advocating for climate change and health, and this is exactly what you're saying. It's what we need is to give you the tools, the resources, the capacity, and the space for you to be here and being loud about these issues is exactly what's needed right now. Thank you so much to all our panelists for your presentations. Now we're moving to the Q&A section. So if there's any question from the audience, please, now's the time. Please.
Hi, and thank you so much for your comments on this panel. I really love to hear about the intersectionality between health, justice, climate change, economics, and really all of the above. I think that statistic about 80% of climate refugees being women and girls is really shocking. And the problem with these climate refugees moving across transnational borders is also about access to health. So I was wondering about what ways we can support access to health as part of an intersectional approach to how we can address the impacts of a changing climate on women, children, and girls.
Thank you so much for the question. Anyone who wants to take this?
I can talk a little bit about that. I think it's super important if we're trying to search for solution, it must be multi-sectorial. We must find this common ground, right? For example, what I did with the Climáticas Academy, we didn't work alone. We try to find people from the health community, from different universities, from different NGOs, actually also from the private sector, so we can have a little bit of everything. And for example, when we talk about environmental education with a gender perspective, it's understanding we just don't want to talk about, oh, we have a crisis and we must fix it. We must talk about sexual and reproductive rights, and we must talk about climate resilience, and we must talk about circular economy. And I want to just remark something. I know it's really important to talk about mitigation. It's really important to talk about adaptation. But I want to stop in adaptation, because we must remember that we cannot adapt to poverty, and we cannot adapt to starvation, and we cannot adapt countries that today are being the most vulnerable cannot adapt because they are already in such a big crisis. We need to talk about transformation. There's it's kind of would take a mitigation adaptation, just make a mix, a really big solution. So I think working based on multi-sectorial works is a really powerful, really important, and that's when the health community takes place. Today, I think, and just to finish, the one thing that health community has that a lot of people want, the private sector wants, the politicians want, is trust. People trust in the health community, and that's what I think that should be one of the biggest tools to basically work on that ambition that we're all talking about so much.
Thank you so much, Julieta. Yeah, I have myself a personal question. Marina, we're just talking about right now about sexual and reproductive health. I don't know if there's any evidence on how climate change is also affecting that particular area, and if you want to elaborate on that.
Yeah, is this working? Yeah. There is quite a lot of evidence on how it's affecting, but there's not enough. Again, we're coming back to the same problem. There's never enough research being done on the very vulnerable groups. One of the things that we have been looking at quite extensively through our data, through our indicators, and particularly through a side project that is being held now at UCL, looking at children and their futures, is precisely about how climate change is starting to impact mostly on the very, very young children, because they will be the ones that will be exposed to a different climate and a very rapidly changing climate throughout their lives. And when you talk about reproductive rights, that's a key issue. You have to be able to raise a child in a safe environment, and that's what we're denying children in the future. One of the key issues here is that the highest income countries, those countries that in general provide the safer, let's say, environment for children, that score highest in the performance for children's rights and children's health, they are the ones that are mostly affecting their health because of the detrimental effects of emissions, of environmental pollution on their environment, of the children in their country and around the world. So it's important to take into account when we look at how we approach children's health, we approach maternal and child health, to take into account how we approach also the environment in which they will grow and in which they will live, and it's there that the highest income countries score the lowest. And it can tilt the balance of inequities again around the world and injustice around the world if you look at it that way.
Thank you, Marina. Yes, we cannot speak about health without speaking about injustice and speaking about equity for sure. We have, we can take one more question from the audience, and we'll take one online as well. So, yeah, we can start with you. Go ahead, it's working, yeah.
Hello, good morning. My name is Pura Jekazo. I'm the president and founder of Haiti Kalawa Research Funding Foundation. No affiliation with Haiti, but USA. Today, I need to say to each one of you, thank you. Health is my specialty. I breathe, sleep, and eat in health. Climate change is a burden to public health. As a former college professor for public health only, it was very pleasant for me to come here to hear each one of you. When you come to climate change, when you come to health, this is what you call emerging and re-emerging infection disease. Whenever the climate rises, temperature, you rise back the diseases. So therefore, we ask for investors to invest more in health to prevent the disease coming back. People do not realize when the ozone, the highest, and then with what you have in the microbiology, you have aerobic and aerobic. So therefore, you recycle the same way that we recycle plastic, is the same thing you recycle disease. This is a very important for people to focus on health, not only to educate, also to prevention and promote health and climate. Thank you very much.
Thank you. You have a question? We can take one, sorry, only one question, and we do encourage you to just reach out to the speakers later so we can finish the session. So sorry for this.
It's working. Can you hear me? I'm a child and adolescent psychiatrist working in London, and I was really encouraged by what I heard. My question is, what can we do to raise the resilience of young people and adolescents in terms of their mental health and the huge mental health impacts of climate change, and what can we do now?
Super. Anyone? Mohammed.
Yes, thank you so much for the question. And yeah, like I believe mental health is already a burden without climate change, burden with a climate change, and it has always been a burden. So like what I would suggest, and it's very important because this is actually what we're doing in the climate change, for example, let's get the adolescents and like ask them or help them identify what is causing their mental health issues. like research, I would say, in other words, because it's very much important when we get to take our approach in tackling their mental health issues to take it in form of evidence-based approach, and this would require research. And like the problem is, the research is global, the research is everywhere, but we need to tackle or we need to target the specific issues, and we need to target the specific target groups. Unfortunately, there are not much research in terms of adolescents' mental health. So this would be the first step that we need to focus on. And as Julieta mentioned, like the multi-sectoral approach. For example, you are a psychiatrist to deal with adolescents, so you meet them when they get to ask for a service or when they need service. Their parents are dealing with them at home, their teachers are dealing with them in the educational facilities. We need to get all of these to get involved in these research projects and get to understand, and based on that, like get them together and work on the multi-sectoral approach that would involve what each one of them needs to do in terms of targeting mental health. Because like when I was, for example, at high school, they used to tell us, you spend most of your time in school, then you spend the time with your parents, for example. And this is correct. And that's why, for example, it's important also to build the capacity of parents, build the capacity of educational facilities, of service providers. All of these also need to build their capacities in terms of how to tackle mental health. And last thing, for the time, it's also important that mental health is not just for healthcare professionals to understand. And it's not just for doctors to understand, and not just for nurses to understand. Mental health is something that we like tackle in our everyday life, something that we get exposed to in our everyday life, and everyone needs to understand at least the tips and tricks and the baseline that everyone must have in terms of like what is mental health and how we can take care of our mental health. Thank you.
Thank you, Mohammed. And I'm going to take the question also from our Zoom participants, and this is for Hita. For young people who are joining COP for the first time, how can they stay engaged in the fight for climate change and adolescent health activities post-COP? What are your recommendations?
Yeah, I think for people, if this is your first COP, it can be extremely overwhelming. Just coming, being in the venue, walking around the space, all of that is extremely overwhelming by itself, even if you're not in the negotiations, and that's a whole different game of its own. The best way for young people to stay engaged, and what worked for me, was to be part of a community. That community turns out to be Youngo for me. It can be any other community, but within the youth climate space, like I mentioned previously, Youngo is the official mandated mechanism. So if you'd like to be a part, the only criteria is to be under the age of 35 because we're a youth constituency. So stay engaged. We have working groups on multiple different topics. We have a mailing list that you can sign up to, which is our official membership. Once you're on the mailing list, you will get updates even post-COP on what the working groups are doing. Working groups will keep engaging. Of course, the amount of activity that you see right now will diminish for a while. December, people will take it slow. We'll come back by the start of next year and continue engaging. It has provided me, from personal experience, it has provided me a community. It has provided me a space where I can make friends. I have built networks. I have literally, this is second family for me. And I hope really we can provide that for a lot of other young people who are joining in the first time to a COP, feeling a lot more overwhelmed. But hopefully when you come back, you have somebody else who can understand what the space is like, how complexities are like, and can talk to each other and come through it together.
Thank you. Thank you very much, Hita. So that's the end for our Q&A session. This was a very inspiring conversation. Thank you so much, everyone. Before closing the event, we're going to do a very rapid fire session, and I'm going to ask each of our panelists to, in 20 seconds or less, just give us your last argument on climate change and adolescent health. And I'm going to start with Mr. CK, who is online, so we can start with him.
Thank you. About climate change and adolescent health, I would just say infuse finance, create resilience, design youth-centric policies, give them a better world. If you don't do this, you are never going to be forgiven. And this is one time in history that you have an opportunity. Make full use of it.
Thank you. Back here to in-person, Marina.
I would echo that pretty much and say we have to start bringing visibility to adolescents, to adolescent health, within the health community, within the research community, to be able to address their issues in a way that puts them at the center and have tailored policies to ensure that when we deliver a climate resilient future, we actually deliver it for adolescents as well, not only for the people in charge.
Gita?
Yeah, I think I would echo what he said, but I would also mention that ensure that you're speaking with the young people and not just speaking to them. There's a difference when you engage youth. You need to really take it bottom up, let them come up with the ideas, and really take into consideration everything that they're suggesting. They're the first ones, first-hand facing the issues. They know what they need best for themselves. So when you design policies, when you design platforms, when you design programs, schedules, whatever that might be, make sure that it's a bottom-up process. You're speaking with the young people, you're engaging them in a manner that they would like to be engaged and not in a manner where you feel you should be engaging them.
Super. Julieta?
Thank you. I want to invite every single one of you that after this panel, ask yourself, what does it mean to be an activist today? Is just the people that you see on the street striking? Because, yeah, that's a type of activism. But at least for me, it's so much more than that. Activism is taking everything that makes you frustrated, angry, sad, anxious, and that should be the boost that kind of moves you to search for real changes. The health community today, the people that work in the health community are activists as well. The young people that work in negotiating our future are activists as well. And you can be an activist as well. Take everything that it's kind of getting in your way, everything that makes you frustrated, and based on that, I think that's one of the best solutions that today we can have first, in our hands. And
Thank you, Julieta. Finally, Mohammed.
Yes, thank you so much. So, I would just say two things. The first thing, I would ask everyone, no matter what our ages and how different our ages are, but just reflect on our adolescence years, and remember how much we faced of troubles, how much it was full of lack of engagement and lack of education and lack of inclusion and lack of so many stuff that we are advocating for today. And let's see how it affected us right now in all the different ages that we are. And let's stop this from happening to the existing adolescents at the moment. Let not the past mistakes be repeated again in the future. And last thing, I always believe that this COP, yes, it's an event for us to negotiate, to advocate, to speak, but everything starts just after we go back home. So it's not the end here. It's not the end in this panel. It's not the end on Saturday. The end will be hopefully, as Julieta mentioned, hopefully soon when we don't need activism anymore because the job is done. But let's start this in our homes and let's start working on this even in our local communities, because if we change and if we make it better, the life of one adolescent, I guess this is an achievement. So yeah, thank you.
Thank you so much. Round of applause for all speakers, please. On behalf of all the speakers and the partners involved in this event, I thank you for your time and engagement, both in person and also online on Zoom. And most importantly, for your action that you're going to take forward. As we are starting just this journey on mainstreaming adolescents' well-being and climate change, your voice, your input, and your engagement is more vital than ever. This has been a wonderful discussion, and we hope that you could take some action after the solutions and ideas that were presented today in the near future. Thank you so much for joining us, and have a great day.
Hello, everybody. Welcome to this event in the World Health Organization Health Pavilion titled Monitoring Air Pollution and Health Benefits Within Climate Change MRV Systems. My name is Chris Malley. I'm a researcher at the Stockholm Environment Institute based at the University of York. And I'm very happy today to be moderating this session where we will be presenting a new initiative for climate action transparency and Climate and Clean Air Coalition guide on integrating short-lived climate pollutants and air pollution into climate change monitoring and transparency frameworks. And the reason that this is relevant in COP26 is that if we look at the new nationally determined contributions, we see that they're much more ambitious in terms of actions on air pollution and health. In 2015, we had 26 countries who were explicitly acknowledged the benefits for air pollution and human health within their NDCs. In 2021, that's 50 countries. 2015, we had one country that had set a target on black carbon air pollution. Now we have 3. And as we'll be hearing later, countries are explicitly quantifying the health benefits in their NDCs. But what we're here to talk about today is what we do next, how we move forward to make sure that we can track progress on these air pollution and health benefits. And we've got a panel of presentations here that will present this new guide and also hear the experience of countries who have actually taken steps to get started on tracking air pollution, setting targets on air pollution and beginning to track progress on it. But I'm very pleased to be able to hand over to our first presenter today, the director of the Initiative for Climate Action Transparency, Dr. Henning Wüster, to tell us about the reason for this new guide and the importance of it. Henning.
Thank you very much, Chris, and very good afternoon, colleagues. Both those here physically present and those online. Of course, I'm very happy to see many colleagues physically after such a long time, and including some colleagues that I've been engaging with online very intensely over the last 2 years. And that includes also the colleagues here from SEI and from the ETHUP, which is now a partner of ICAT, and of course the countries that are represented here on this panel, Colombia and Nigeria, that are also ICAT partner countries. So I'm very happy to advance the work on this particular guide. The Initiative for Climate Action Transparency, ICAT, is supporting countries in developing their transparency frameworks. And we are very happy to do this together with the Climate and Clean Air Coalition, because we believe we have some important commonalities in our objectives. What ICAT does is that we really encourage countries, when they collect data, when they put together data systems, to include data that show the domestic benefits of climate action, together with data related to that they need for emission inventories and for planning climate actions and climate policies. But having that knowledge of domestic benefits is absolutely crucial if you want to roll out policies in an effective manner. And air pollution abatement is, of course, one of the key potential benefits of climate actions and climate policies. And that's where we see a potential scope for building synergy, both in terms of collecting data, which is what we will hear about very much today, but then also in terms of developing policies that have both that local, national perspective and then contribute to the global climate objectives that unites those that have come here to Glasgow this and last week. So the guide that we are developing in this partnership will complement a series of ICAT methodologies that help countries assess policies from various perspectives, including, of course, the impacts of policies on emissions, but also then the wider impacts on development priorities and in rolling out policies at a subnational level and with non-state actors. The guide will provide practical advice how to actually move forward on integrating air pollution into climate change efforts on the data and policy side. What we intend to do is to use that guide subsequently in our country projects. We have at the moment 40 country projects across the world. We are developing 2 regional hubs, and we have seen a lot of interest in that linkage to air pollution, and I'm absolutely convinced that the synergies that can be used and can be built on will help countries to be much more effective moving forward. So I'm very happy to have that opportunity here for you to hear about the guide and to see where we are in terms of the drafting. I would encourage you to engage with questions here or subsequently, but also be available if you are interested to become part of the review process, because we of course want to make sure that this guide becomes reflects state of the art and best practice in order to use it as a guide that can help countries in advancing on this important topic. So with that, many thanks to the colleagues from SEI and Ether, and back to you, Chris.
Thank you very much, Henning, for telling us about the importance of this guide, and I don't want to slow us down, so I'm going to pass over now to Dr. Justin Goodwin, a director at Ether, to give us an overview of the guide.
Thank you. Thank you very much, Chris, and thank you, Henning. Relatively new to the ICAT program and enjoying learning about the network and everything that's going on. This guide is really, I suppose, the culmination of a lot of work that we've done over many years to develop inventories, which have been this little sort of back room activity to support policymakers with air pollution and climate challenges with policy making. So what I'm going to do is just go through a little bit about the guide, some background, and then hopefully after that we can take some questions. Next slide, please. But first of all, there's a little bit of interactivity, not very much. You don't have to participate. There's a QR code here that will hopefully work with your devices online, hopefully, fingers crossed. And now, or you can go to www.menti.com and put in this code. Really, it's just a word cloud. Those that want to can help contribute with some words about how we can develop this guide. You know, what are the useful components? What do we need to include in this guide? Next slide, please. There's a little QR code down here all the way through, so if you do get bored of me speaking, you can click on there and have some fun with words. So, first of all, the background to this, and being the new boy, learning this as I go along, but there's been a long, good relationship between ICAT and the Climate and Clean Air Coalition. A lot of work done there, already work done looking at how to integrate air pollution, air quality into NDCs, and you'll hear a bit about that work already. Sorry, that's down here. Like this? That's better? Okay. So the key thing is to ensure that we've got these frameworks, these transparency frameworks that are broad enough and are not too narrowly focused on trying to solve one issue while creating issues elsewhere. So this was a joint aim and goal between the Clean Air Coalition and ICAT. The other focus is on providing more transparency information into the climate science and arena through understanding the short-lived air pollutants. But what we want to really get to is this practical advice and support. So this guide is quite detailed. It's focused on the practitioner And there is a lot in there that's quite difficult to digest if you haven't been doing inventories for a while. Also, what we want to try and do is focus this evaluation and tracking of air pollutants, and particularly health, in association with NDCs, with the big push for climate action and reducing greenhouse gases. Next slide, please. So, a quick overview of the chapters. We've got, at the moment, 5 chapters. We will probably have a number of annexes. The chapters, first of all, start out with sort of answering the question of why bother, why do we want to do it, highlighting the issues around climate change and air pollution, some purpose, and information on how to use the guide. And I go into some of these chapters in more detail. We want to also, in chapter 2, look at the demand. What is the demand for air pollution and greenhouse gas integration? So we look at the Paris Agreement a little bit and highlight some key elements there that are really calling for this information. We look at the Sustainable Development Goals and see that some of those are looking for air pollution as well as climate change solutions. Chapter 3 is really where the meat is, the technical guide. It's really very detailed. And then 4 is really picking up one key element of this integration, is looking at health and how to use this data to improve the protection of human health. And then finally, we look at the management process, realizing that we've got to develop a sustainable team of practitioners that can use this information to inform policymakers. So we start to unpick about how to do that in the new world. Next slide, please. So the first, I'm going to talk a little bit about chapter 1, this sort of orientation chapter. Next slide, please. So what we do here is we introduce the concept of air pollution, what the impacts are, remind people the imperative to do something about it. We also look at the importance of having healthy, productive people, and realizing that we need to do things on air quality, on our local air quality, on our national air quality to make sure that happens. We're looking at highlighting the need for better decision making. And when I say better decision making, I mean more integrated knowledge about the pros and cons for air pollution and greenhouse gases of certain actions that we are going to implement in the future. And we know we're going to have to implement a large number of actions, particularly being driven by greenhouse gases. We also know that some of the actions that we've implemented in the early years weren't necessarily brilliant for air pollution. So we need to think about this, about having a data set, the evidence base that can inform decisions better. So we explain a bit about how we do that, but also by bringing the air pollution community into the question about reducing greenhouse gas emissions, we gain a much stronger, in many cases, and broader set of stakeholders. We will achieve, hopefully, more ambitious and better climate action as a result of bringing in air pollutant stakeholders. Next slide, please. So who are we focusing on with the guide? Really, it's national, local emission reduction policy makers. So these are the people that make the policies that drive the action in the countries or at a local level. Focal points, so we have focal points on air pollution, focal points on climate, engaged in the UN, engaged in lots of other international agreements. So we want to focus on those people, give them the information that they can exchange with their international community. And we're hoping we get a range of sector-based stakeholders, academia and the public really engaged and invigorated by this flow of data that's helping them understand how to make good decisions about what you buy, how you travel, where you go. Next slide, please. So the scope, this is getting more technical, but these are the pollutants of focus, and there's some more complex explanations about what's important for climate tracking on the short-lived climate pollutants, these SLCPs. It's a combination of primary air pollutants that then mix in the atmosphere to create problematic gases for climate, but we also have these gases that create problems in city centres, in rural areas by mixing and creating air pollution that's bad for human health. I'll leave you with the details when we share the slides. I won't go into it right now. Next slide, please. So chapter 2. Chapter 2 is really about the opportunities to integrate this new systems way of thinking into the work that's already going on, often in silos. Next slide, please. So really what we want to try and achieve through Chapter 2 is to highlight this imperative, making the Paris Agreement a force for change, not just for climate change, but for change to improve our sustainable development. And there's a lot in the Paris Agreement about sustainable development. We want, from the bottom to the top, from local, from individual actions and activities to national and regional actions and activities, we want to make a compelling action. We want to make that action as good for everyone as possible. Co-benefits, we talk about co-benefits a lot. Air pollution is a key co-benefit. If those actions are done in the right way, it's a key co-benefit of climate action. And we want to use this information to engage as widely as possible to accelerate action. And we want to go beyond these siloed ways of looking at things where we have the climate people in one department or one agency and the air pollution people in one department or one agency, using different data, using different approaches, coming up with their own priorities and their own policies that don't fit well together. Next slide, please. So there's a bit more detail here on the specific opportunities. We want analysis to look at air pollution and greenhouse gases at the same time. So this, in more technical terms, is adding air pollutants and enhancing greenhouse gas inventories into these very dry, very boring, for some people, exciting for me, data sets on emissions and emission trends. We want the climate policies and measures to improve air quality. So how do we make sure that we show which climate measures have a high priority for air pollution, air quality? We're reporting a lot now, especially in the climate domain, in these NDCs, these nationally determined contributions, these documents that are the front end of a strategy and plan of each country to meet its climate targets. Net zero is talked a lot about. The NDCs are working towards net zero. So these documents need to show that there's an understanding of air pollution as well as greenhouse gas emission reduction. And finally, I don't know, many people must know now about the SDGs. There's several, there's 17 of them. Key one, number 13, is about climate. Number 3 and number 7 is all about improving human health and where we live and how we live, and that's the air pollution component. Next slide, please. So Chapter 3, this is the nitty-gritty detail. I'm going to skip through here really fast because I'm probably running out of time already. 8 minutes, okay. There's a lot of detail here. My first draft of these slides, most of them were removed because it's the detail that I enjoy. For basic principles, we've got the way emission inventories work, which is super simplified here. You have an emission rate, you have an activity value, and you multiply them together to give you an emission amount. That emission amount allows you to prioritize sources. We get really into the detail by having lots of different parameters that feed into these two key components. One is activity data, so this is national statistics or data from industry, counting cars, counting agriculture and livestock and what they do, measuring trees. That's activity data. The emission factors are the rate of emission, or in the case of land use change and forestry, the rate of sequestration. But these are complex factors. To help, beginning we have the IPCC guide, which gives defaults and methods and approaches for greenhouse gases. We also have the EMAP EEA guidebook, which does the same thing for air pollutants. So we can start to build an inventory around these data sets with some process of continuous improvement. Next slide, please. So this is a simple system flow. This is what happens at the moment with greenhouse gas inventories. So we've got a load of activity data, some emission factors. We get some emission estimates. We put those into the reports that we know and understand if you're in the climate domain. We use those for tracking progress. We can do some policy analysis if our inventory is quite good. We can answer some questions from policymakers. That can go into some decision-making processes, and that feeds into the ideas and thoughts of how to reduce those emissions or increase the removals, increase the forests. That's a simple process. Next slide, please. We add in the layer of air pollution, and we have some extra complication because these pollutants don't directly, at the point of release, have such an impact. They go into the atmosphere, they mix, they float about, they congregate in certain places, and we need to try and understand the subtleties of those pollutants and how they're impacting on our environment and on human health. So we have a much more complex system arrangement around here. And as you can see, we're even bringing in a model, and we're bringing in receptor information. So where are the vulnerable people, vulnerable areas? We need to know about the weather. We need to have maps. We need to have spatial scales and temporal scales if we're going to use this information to inform decision making. Next slide, please. Okay, so there's some key technical issues. We need more categories because there's more important sources for air pollutants as well as greenhouse gases. We need to incorporate more knowledge on the technologies being used, because air pollutants vary depending on technologies being used. They vary depending on the way you drive a car, whereas greenhouse gases don't so much. We need more spatial detail because we're really worried about human health and where the people are. And we need temporal detail because sometimes we get all the annual emissions emitted in one go or over a short period of time, which creates a massive load compared to it being trickling out evenly over the year. Next slide, please. This is some beginning table that's showing the way we're trying to look at the information. The key development areas for Chapter 3 are looking at air pollutant reporting, which is relatively simple, air quality modelling, which is really quite complicated, and policy development, which is answering the what-if scenario question for the policymakers trying to decide what to do to improve the situation. This is how we're going to try and digest and map the information and inform the experts who will be working on greenhouse gas and air pollutant inventories. Next slide, please. 3 minutes, okay. I'm going to go by detail, but I'm going to go really quickly because I've got very short of time. We've got a section on each sector, and we go through details, analysing what's different from greenhouse gas inventories, what's needed that's extra, and sometimes where no work is needed because the sources aren't included. Next slide, please. So this is for energy, and again, these are very short bullet points that front up quite long sections about how to do it. So for energy, we're obviously looking at abatement technologies. We've got a data flow of industrial reporting for many cases. Road transport, we need more detail because it depends on how you're driving a vehicle. And we have a number of non-energy related sources that aren't relevant for air pollutants, for greenhouse gases. Next slide, please. We have to deal with biomass in a different way for air pollutants, particularly road transport and domestic and commercial. Next slide, please. And then for the other sectors, we've got a number of technicalities that we have to address to incorporate air pollutant greenhouse gas emissions. Land use change and forestry, there's natural processes that contribute to air pollution loadings that we need to take into account. And waste, it's much more important to understand what's going on with burning wastes in any shape or form than it is about the decomposition of landfill waste. Next slide, please. On health impacts, next slide, please. So this is Chapter 4. I think I explained why we're interested in health particularly, and why we want to have a stronger focus on using this information for health policy making. Next slide, please. We've coming up with methods, links to lots of ways of modeling, approaches to take, to look at local pollutant exposure reduction. We've already seen Nigeria and other countries integrating some information on air pollutants and health into their NDCs. Next slide, please. There's complicated sort of causal flows that we need to take into account, and we've got some advice and guidance on how each of these policy scenarios affect health in different ways. Next slide, please. And this is an example of some more of the complex analysis, the health impact functions that we're including to help build that bridge between coming up with a generic inventory and actually using it to understand health impacts. Next slide, please. The final chapter is on the system. So how do you make sure that you don't just have a snapshot in time, but you can repeat, update, and continuously improve? Next slide, please. And there's a few guidance points here in this chapter about how to build a team. And this is management work, really, rather than specialized climate or air pollutant work, but it's something new coming to everybody and something we need to think about. Next slide, please. So we've got a number of bullet points and sections about more data collection, supporting experts, enhancing the detail, using databases and tools in this guide. Next slide, please. So in summary, I think I've covered how important it is that we integrate this activity, the uses of the output information and really focusing on who the users are and what they get out of this work. In section 5, we talk about how to start this process rolling, some simple steps, particularly looking at the air pollutant emission factors in the EMEP EEA guidebook that we've been very heavily involved in producing. I think, next slide, please. This is the next steps for the publication of the guide. I didn't know whether you wanted to say anything about it, Chris, or I can, we've got a process going on until April, May 22. We're coming up with a draft now. It's still not ready for the outside world to look at. But December to February, we're going to have a peer review. And then in March, we're going to make some revisions based on the peer review and maybe have a few iterations so that we can finalize it in April, May. Next slide, please. That's a whistle-stop tour of the guide. It's been a pleasure. And I'm very happy to answer questions as we go through the session. Thank you very much. Thank you, everybody.
Thank you very much, Justin. I hope I won't be misunderstood when I say that Justin's presentation was perhaps not the most exciting presentation that we have today. He has a very hard job in making a draft guide sound exciting. I'm going to move on. If people have questions here in the room, please put up your hands, let me know. If you have questions for those online, please post them on the chat. The reason that I'm going to move on is because while Justin presented what is included in this guide, how we can link air pollution to our climate change MRV systems, the exciting part of this presentation is that we're going to hear from two countries who have actually taken the steps, the practical steps that Justin talked about, to achieve this in Nigeria and in Colombia. So I'd like to give the floor now to Dr. Bala Bappa, who is the National Coordinator for Short-Lived Climate Pollutants and is also involved in ICAT projects, to talk us through the experience in Nigeria of linking air pollution and climate change together. Dr. Bappa.
Thank you, Chris. Director Hennings, Justin, Johan, distinguished colleagues. Nigeria is both an CCAC country and an ICAT country. So I'm going to share our experiences. CCAC supported Nigeria to develop the National Action Plan to reduce short-lived climate pollutants, and we are currently implementing, while ICAT is supporting Nigeria to develop our MRV systems, which is also ongoing. May I introduce a Federal Permanent Secretary from Nigeria, Dr. Tarfa, who is a climate change expert who coordinated both activities in developing the National Action Plan to reduce short-lived climates and the ICAT MRV system development in Nigeria currently going on. I will take us through what we have been doing in Nigeria as regards the development of the National Action Plan and the implementation of the National Action Plan, and then go ahead to also tell us about what we are doing on the ICAT project. Next slide, please. So the highlights of the presentation will be the overview of the National Action Plan that has been developed and is being implemented, and the integration of the SLCP in the Nigerian NDC revision exercise, which was a process that has been completed and reported to the UNFCCC. Then I will also give us a background of the Nigeria ICAT project, which is supporting our MRV system development. Next slide, please. So as you can see, The CCAC supported Nigeria to develop the National Action Plan. The process started in 2016 and culminated in 2019. And then we developed the National Action Plan and identified 22 mitigation measures which were approved by our Federal Executive Council and is currently under implementation. And during the recent NDC revision exercise, these 22 measures were included in the revised NDC with the support from UNDP, who engaged the Stockholm Environment Institute, who ensured that the 22 mitigation measures were included in our revised NDCs. And then, luckily for us, at the right time, the ICAT came in to support Nigeria to develop the MRV framework to track climate action, especially the NDC implementation. So, and it's currently going on, and the process will be concluded and implemented very soon. Next slide, please. So as for the CCAC project, we signed the PCA agreement in 2015 and appointed a national focal point to coordinate the activities from the government side, and also appointed the national consultants that will conduct the development of the National Action Plan, working with the stakeholders. And we established a National SLCP Coordination Office, appointed the steering committee from the different departments and the Ministry of Environment, and also identify the advisory and task force groups who work with the steering committee and the consultants to develop the National Action Plan. The National Action Plan was developed in consultation with key stakeholders and lead partners, especially the Stockholm Environment Institute, the IUPA, and the UNEP Regional Office for Africa, and the Secretariat itself. Then after the development of the National Action Plan, it was presented and approved by our Federal Executive Council, and they also approved the implementation. Next slide, please. So these are the priority mitigation measures identified in the National Action Plan, and it cuts across all the priority sectors in Nigeria to include transport sector, residential sector, oil and gas, industry, waste management, agriculture, power, and HFCs. As you can see, these are the abatement measures that were identified and approved, and these are the measures that are currently being implemented and also included in our NDC. Next slide, please. So the implementation of the plan, the Federal Executive Council approved that the Ministry of Environment, Ministry of Budget and National Planning, and the Office of the Secretary to the Government will be responsible for implementing the National Action Plan, and they are now implementing it. And the Department of Climate Change and the SNAP team are coordinating the activities of the DEX officers, which we identified in the various MDAs that will be responsible for implementing these measures in their respective ministries, departments, and agencies. Then the Ministry of Finance, Budget, and National Planning has a major responsibility of mainstreaming the action plan into the national development process, which they have done with our new national development national development plan. And the Ministry of Finance, Budget, and National Planning equally is responsible for making budgetary provisions for implementing the measures that were approved. And so the implementation process is currently ongoing, and we normally report the progress of achievements at the end of every year. And this is a process that is going on. Next slide, please. During the recent NDC revision exercise, may I also please recognize one of our colleagues, Barrister Tarfa, Barrister Huzi, who is the NDC coordinator for the country. Barrister Huzi, please recognize you. So the NDC revision exercise was carried out in Nigeria, and most importantly, the UNDP supported the inclusion of SLCPs into the revised NDC, and appointed Stockholm Environment Institute to coordinate the inclusion, and that was successfully done and reported to the UNFCCC. Next slide, please. So from what Justin is saying, you could see the core benefits of the SLCPs and air pollutants from the NDC implementation. And you can see that by implementing the approved mitigation measures, you can see by 2030 we can reduce organic carbon by 65%, black carbon by 65%, particulate matter 2.5 by 42%, and particulate matter 10, 37%, nitrous oxides, methane, carbon monoxide, and carbon dioxide will equally be reduced by the percentages that are mentioned. So implementing the Nigeria's NDC could reduce SSCPs like black carbon methane by 65% and 28% respectively, as quoted by Justin in his presentation, and also substantially reduce other air pollutants, especially the PM2.5 and PM10 and the black carbon. So these are some of the achievements that could be realized by implementing the NDCs. Next slide, please. Okay, so you could see from the presentation that substantial lives will be saved from implementing these measures. As you can see, children, especially women and children, will be saved from by 2030 if maximum, ambition, for the maximum ambition in the implementation of the NDC measures. So that could reduce about maybe 30,000 premature deaths per year from household air pollution. And also there are additional health benefits expected from reductions of the outdoor air pollution. Next slide, please. So ICAT has supported Nigeria and is currently working on developing the MRV systems for the country. And we have gone far in the project, and we signed the PCA agreement. I'm constrained by time, so I have to rush here. We signed the PCA agreement, and it's currently under implementation. And we established the steering committee and appointed consultants, the focal points, and the international consultants, the STEPA and GHGMI, our international consultant working with us to develop the national, overarching MRV systems for the country. And the objective, we are working on 3 sectors, but 5 subsectors. We are working on the oil and gas, transport, and AFOLU. Under transport, we have road transport and other transport, which includes railway, marine, and aviation, while the LULUCF and agriculture, we have crops and livestock. Next slide, please. So the terms of reference of the ICAT project, including carrying out an MRV need and gap analysis, which we have done, and the development of sectoral institutional MRV systems for the NDC priority sectors, which we have also done. Then we are working now and have concluded the report on overarching institutional arrangements and recommendations on the national MRV reporting system, which will be subjected to validation by our peer review and for adoption later in the year. Then we are now working on the development of the NDC indicators. We assess, working on the indicators and tools to be used for tracking the NDCs of the Paris Agreement. Next slide, please. Okay. As I earlier mentioned, the major implementation activities that we have carried out include the need and gap analysis, which we have done and made recommendations, identified the needs and the gaps, and also made recommendations. And then we have developed the robust institutional arrangements And we have completed the report on the overarching institutional arrangement for the country, and work is now going on on policy assessment of policies and measures to develop the NDC indicators, and then there is an ongoing capacity building among relevant stakeholders through trainings and workshops towards transparent tracking of the Paris Agreement, whom we are doing together with the STEPA and GHG MI. So this is what is currently going on. Next slide, please. So, as I said earlier, ICAT supported Nigeria, which we are currently going on, and the final report will be validated very soon before the end of the year. Thank you very much.
Thank you very much, Dr. Bappa. I'm going to move on now, but I think it's very exciting that the ICAT project in Nigeria and the work of the Climate and Clean Air Coalition have been linked together. And I think the statistic that really stood out for me is that implementing Nigeria's NDC could avoid 30,000 premature deaths per year by 2030 because of the reduced air pollution. The link to Justin's presentation is that this guide can provide the basis for making sure that those air pollution benefits are monitored as Nigeria implements its NDC. I'd like to turn over now to Mr. John Henry Mello, the NDC coordinator in the Ministry of Environment of Colombia, to tell us about the work that they have been doing on linking air pollution and climate change. John.
Well, hello everyone. Thank you very much for the invitation. Thank you for including Colombia within this very interesting space. I don't agree with you when you say that the first presentation was not interesting. I really love the topic. So, I'm going to talk a little bit about the experience in Colombia. We are a long-time partner of the CCAC. We are founding members since 2012. We're also part of the ICAT initiative. ICAT was instrumental for us during our NDC update process, providing us with insights about MRV systems. Our NDC has a differential thing among NDCs, and it is that includes specific commitments from cities and regions, and ICAT was instrumental also to consolidate this effort, and we are right now on the process of beginning a second phase that will give us a deeper insight about this, and the CCAC, of course, was instrumental. I'm going to begin, next slide. Thank you. I'm not intending to take too much time. I'm just going to talk about the main highlights that have to do with the topic we're talking about, and it is MRV systems. Integrating in air quality and climate change is not always that easy. First of all, because they're almost always separate groups that have their own dynamics, their own knowledge. They are kind of reluctant to work with each other, and that's the first challenge that we have to face. And that it has been let's say a gradual process, something that has changed in the right direction in the country. We have several milestones. The first of all, that we have our short-lived climate pollutants national mitigation strategy. That what it did was taking from one side policies that were already in place, that were technically, politically, and financially feasible, and collecting them there and adding some additional ones that we identified through the different initiatives of the CCAC. For example, brick kilns, where we are part of the initiative as leaders of the initiative. We also worked with our first inventory of black carbon, which was precisely the first exercise that we've been talking about. It was about phasing and trying to make it compatible, the activity data, the emission factors, that is not always the same for all the cases. For example, in transport, we had some challenges. And, well, at the end, we did it. We have the results up to 2014. We hope, and no, we hope not. We already committed that in the BUR from now on, and then in the BTRs, the black carbon inventories is going to be updated, so we have better information. But we have the first one, and it is going to be the worst compared with the rest of our black carbon inventories, because this one that is coming has way better information and assumptions. Well, from this black carbon inventory, it also included, and I don't want to forget, other air pollutants. So NOx, SOx, and so on. And this was like our first big result, I would think, about this integration and what we are looking for in the Ministry of Environment. Then we began around 2018 to establish this direct relation. Thanks to the exercise and all the lessons learned during the construction of the inventory, we began to link what would happen if I implement some measures that were originally created in terms of GHGs. Many of those, all who have to do with some kind of fuel, have to do also with black carbon, for instance, and there are many others that have to do with other criteria pollutants. So that's what we did. We made this first approach. It was in a time where our measures were not yet consolidated because the commitment of the countries was to deliver, to communicate their NDCs by 2020. But by that time, we began the first steps to understand what was going on and how to link it. So that was very useful and instrumental because when we really did have to update our NDC, we had almost everything ready to assess at the same time both of those things. Next slide, please. In terms of the black carbon inventory, and I received some feedback that I should put the greater values above and so on, so it can be more eye-catching. So sorry, because it is not that eye-catching, but the thing is that in my country, the main source of emissions is for forest and grassland fires. It occurs mainly because of natural cycles as El Niño, La Niña, and so on, but also of course, man-made events and so on. Other sectors, which include mainly cooking in rural areas with wood, as well as manufacturing construction industries, or I would say that the food industry may be one of the most important because the food industry, especially, for example, in sugarcane and so on, uses a really, really old technology in many cases. And closely followed by the transport sector, where we still have an average age in our fleet that is higher than we would like. This was our result, and from that we developed one milestone that we are proud of, and it is that we are one of the 3 countries that have established a specific black carbon reduction target in our NDC. So next one, please. So our NDC establishes several high stones. We are a country that also is trying to push for more ambition. I am part of the negotiations delegation in terms of in the topic of ambition and so on, and we always try to push this topic. They're trying. Okay, so as a part of that and trying to be, to have some coherence, our actions, our commitments are at the same level. So we committed to a 51 reduction in GHG emissions by 2030 compared to a business as usual scenario. It has been done thanks to the work of many organizations and technical teams, including the ICAT project, to add up each one of the initiatives that have been proposed by the entities that are directly responsible for their implementation. You can hear? Okay, and in parallel, taking all the lessons learned that we did with our first black carbon inventory, taking the lessons learned with this first approach towards the mitigation emissions, we did in parallel an estimation of how much could we reduce as a co-benefit in terms of black carbon thanks to the implementation of our official NDC measures, and we added 3 more. And thanks to that, we finally had this commitment that is 40%. Next slide, please. Our commitment at the end is to reduce by 40%. This is a commitment in the NDC, 40% reduction in black carbon by 2030 compared to our inventory data in 2014. That excludes forest fires and grassland fires, not because we don't want to do anything, but because as it is mostly a natural-driven force that is unpredictable, it would have been responsible to set a goal on that. And next one, please. And well, these are the 3 additional measures that have to do with diesel engines and agricultural burning. Next, please. So what's next? Well, we have to work on the measures that we have committed. So we are going to replace 1 million cook stoves for more efficient stoves. We're going to work in the transition of technology of brake kilns. We're going to work in agriculture where it is relevant, for example, in sugar mills, as I said. And we are going to work in the topic that brings us together, that is how to, first of all, assess the co-benefits in terms of health, thanks to the implementation of our NDC. Just yesterday, with the WHO, the Stockholm Environmental Institute, we presented the results, thousands of deaths avoided, up to 1 million illnesses cases avoided, thanks to the NDC, and these results are going to be greater after 2030 because all of us are going to be older and more vulnerable to bad quality of the air. And also the mainstreaming of the black carbon within Renare. This is something that we are working right now with the help of the CCAC. Renare, of course, I say Renare, but nobody knows. This is the National Registry of Emission Reductions. So what we're doing is having a track of the, can you listen? I cannot listen to myself, but that's okay. Having a track of the reductions, because when you are tracking the NDC, it is not enough with doing an inventory after inventory, because you cannot keep track of the very specific actions, like one specific sector in one specific place. You are not going to be able to look at it in an inventory, so we need to have a reduction registry. That's Renare. That's a system that was one of its kind that was launched a couple years ago, and we are right now working to include black carbon within that. So Renare is a system that any user that is going to register a reduction can use. So any industry with some data that they can input in terms of activity data and emission factors and so on, can report what is going to be the reduction in terms of CO2. Now we are trying to adapt it, so the emission factors can be set in such a way that we can also keep track of the black carbon reductions with a bottom-up perspective. So that's what we are working right now, and thank you very much for the invitation.
Thank you very much, John. Very impressive. I don't see any questions in the chat, but for those online, if you have any questions, please put them in the chat. And if anybody has any questions here, please raise your hand, and you're very welcome to ask Justin, Henning, John, or Bala anything about their presentations, the guide, linking air pollution and climate change. To get things started, I would like to bring back in, oh, sorry.
Thank you very much. I'm Ethne from the Institute of Air Quality Management, and I'm really pleased to see this guide that's coming out. We recently surveyed our members, and 83% said that they wanted to see greater integration between air quality policy and climate change policy. So that was just a comment on that, so I'm really pleased to see that. I'm really keen to learn more about how we could get involved in the kind of peer review process, how that's going to work, and how you're kind of going to reach out to stakeholders on that. Thank you.
Thank you very much. Do you want me to take that? Yeah. Thank you very much. We hope that by the end of November we will have a first draft guide, and then we will be beginning the peer review process in December. As part of that, we'll be specifically reaching out to the networks of the Climate and Clean Air Coalition and of ICAT country partners to ask them to review it. But we would like and encourage as many people as possible to get involved in the review of the guide so that we can improve it as much as possible. So if we can get your contact details, we will make sure when we send out that call for review that we include you and your colleagues and anybody else here who is interested. And as Justin said, that review process will run from December to February, so you don't need to spend your Christmas reading our guide. You will have time early in the new year, and we will be running it as a formal peer review process. So you will provide your comments, and we'll make sure that we respond to them, and you can see how we've integrated them into the version of the guide that is ultimately published. Does that answer your question? Does anybody else have any questions? I don't... Johan?
I was just wondering if John Henry and Bala could say, to what extent has the knowledge of the air pollution impacts actually driven the ambition on the climate side?
Yeah, we can hear.
Well, I'm not going to take out my face mask. Can you listen? Okay. Um, I think that in many places sometimes the health argument may be more powerful when you link it with the financial impact also in terms of loss of productivity, loss of the expenses in the public health system and so on. So when you combine those two, you have a powerful argument, I'm not going to say a powerful argument, but argument that is heard by more people. So we have tried as we could to make this part of the discussion. It has not been easy to raise the ambition to an extent as we have done, especially because it is an unconditional goal. But I think that this has been part, but has the potential to be a much stronger argument. I think that we have to communicate this in a proper way. Just yesterday, as we had this WHO presentation, one of my main questions was how can we take this into some kind of campaign within the Breathe Life campaign or so on, so we can make this possible. And there was one quote from the researcher who presented there, and he said the NDC is also a very powerful public health policy, and I think that this has to be the main message over there.
We've got 2 questions, and I'd like to come back to Henning for a final close. So we go to you first, and then yourself.
Hi, everybody. I would like to ask a question, Henry, about this, for example, index of the quality of air, the pollution of the air. It's even don't consider the glyphosate emissions that have in the border of the Colombia, because especially in Ecuador we have some scientists and even doctors that study the impact of the glyphosate in the airway and even in the respiration. So I don't know if in this study you consider that in this analysis.
We don't consider it because glyphosate is not emitted within the sectors that we review usually when you make a commitment in climate change. So I know that that's an issue, but it's not something that the NDC have to deal with.
Okay. Thank you.
Yeah.
Thank you very much. I'm from the Health Ministry in Madagascar. Thank you very much. The thematic is very, very interesting for us. I just want to know if there is a methodology to calculate health benefit with monitoring of quality of air pollution. If there is, we want to have it. Thank you.
Yes, I think these are some of the things we're going to try and tackle in chapter 4 of the guide. So we will be documenting the high level concepts and approaches that exist already. And there's a lot of detail to doing this and lots of different ways and approaches depending on your situation. We will be highlighting a range of different approaches that you can use to do that.
We'll talk to you after the session as well, because we're rapidly running out of time, and I'd like to give the final word to Henning, because I was very unfair in giving him such a short time at the start. But air pollution is only one aspect of sustainable development, and I know that ICAT has a lot of topic guides. So in closing, I think it would be useful for you to tell everybody, how do you see this guide fitting in with the other range of guidance that ICAT provides on linking to broader sustainable development goals?
Yeah, thank you very much. And a big thank you to Dr. Balla and John Melo and Justin for excellent presentations. Really happy to see this come together here. And of course, this is presentation of a draft which will come out in the first half of next year, and I'm very much looking forward. And I can pick up the question from Madagascar, because Madagascar is scheduled to become an ICAT country, so we're looking forward to having you on board at some stage next year as well. So maybe this work is ready for that to be applied then in Madagascar. And to answer your question very simply, we have a very non-mathematic formula which says GHG plus SD equals TC. So we have discovered that, I mean, we have this set of guides to assess the GHG impacts of policies, various sectors, energy, transport, agriculture, forestry, and so on. And then we added to that a cross-cutting guide to look at sustainable development impacts, both positive and negative impacts. And we have a guide to assess the transformational change potential of policies. What we discovered is that basically when you want to move to transformational change, countries have to be aware of the sustainable development impacts. And I mentioned that air pollution is extremely prominent. Of course, it's not the only one, and politically it might not be the most prominent one, but it is an important one, and we therefore want to have this guide to be able for countries to better be aware of it and manage that interaction with, between climate and air pollution. What we, of course, are also looking at very much is economic impacts. Employment, job creation, potential of climate policies is one of the critical factors. So one reaction to the COVID crisis was to create a tool to allow countries to screen the potential of climate action to have short-term economic recovery contribution. And that, of course, looks at macroeconomics more than anything else. But it is one of those tools that countries can access through the ICAT webpage. Another tool that picks up the air pollution benefits is called TRACE, which focuses on the transport sector, but then also looks at other impacts, such as impacts on congestion, which of course have huge economic costs in countries, and it is one of the tools that was applied in Nigeria and will be integrated into the work as they roll out the NDC implementation. So those are just two examples, but I think overall it is really a big menu of assessments that countries can do to advance on their climate actions and policies. And what encourages me a lot is that we have more and more countries that have woken up to these interactions and those linkages, because they have now started to take ownership of climate action in their countries by formulating NDCs that have really some link to the realities in the countries. And that's only possible if you have a sound databases. So that's exactly where ICAT is trying to support countries, and it's really great to see then such engaged and active countries like Colombia or Nigeria and many others to work with. So with that, many thanks from my sides again to SEI and ETHA for this work here, and I look forward to it being completed. Thank you.
Thank you very much. And to avoid annoying the moderator of the next session, I'm going to leave it there. Thank you. Hi, everybody. Joining in person and online. We're just going to be 1 minute and then we will get started. Thank you very much. Hello, hello, everybody. Hello. Hello.
No, just she's doing something. Let's wait.
Hello?
Hello. Hello. Hello.
To open is the cycle, huh? The cycle to open it.
Hello. Dakina, can you tell me if you can still hear me? Hello? 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 I can. It's good now. Okay, I'm going to get started. Hello, everybody, and welcome to this WHO Pavilion event by the Stockholm Environment Institute and Climate and Clean Air Coalition. My name is Chris Malley. I'm a researcher at SEI and the University of York. I would like to welcome everybody to this event called Opportunities to Achieve Multiple Benefits for Climate Change, Air Pollution, and Sustainable Development in Africa. And a particular welcome to those who are joining online. Africa is one of the most vulnerable continents to climate change and also suffers a large health burden from air pollution. And to put that in perspective, Africa has a unique set of challenges related to air pollution. Number one, 64% of the air pollution health impacts that occur in Africa occur from household air pollution. 2 out of every 3 premature deaths from air pollution in Africa are for household air pollution. Globally, that's 1 in 3. So we've got a different source of air pollution in Africa compared to other regions of the world. The second important distinction or unique challenge of air pollution in Africa is that it disproportionately affects children. In other areas of the world, the elderly are the most affected, but in Africa, 56% of all infant deaths less than 5 years old occur in Africa. 56% of the global premature deaths of infants occur in Africa, compared to 16% of the adult premature deaths globally from air pollution. What we're going to hear about today are a series of presentations that are looking at how we can reduce the health burden of air pollution and at the same time mitigate climate change and achieve other sustainable development goals in Africa. We're going to hear about 2 ways in which we're looking at these challenges. The first is through a Climate and Clean Air Coalition assessment that is going to look across the continent at how air pollution and climate change can be mitigated. And after that, we're going to look at 3 country case studies where there is national planning on integrated air pollution and climate change mitigation in Kenya, in Cote d'Ivoire, and in Morocco. But I want to start with this assessment. Before I pass over to Professor Andriana Mbandi from Southeastern Kenya University to give us an overview of this assessment, I'm very pleased that we're joined today by a representative from the Climate and Clean Air Coalition who have funded this assessment. And I'd like to ask Nathan Borgford Parnell from the CCAC to give some short remarks about the importance of these regional assessments and why the CCAC assessment of air pollution and climate change mitigation in Africa is important. Nathan.
Thank you very much, Chris. Thank you for the invitation to be here. Very excited to speak on this topic. So, as he said, my name is Nathan Borgford Parnell. I'm the Science Affairs Coordinator of the Climate and Clean Air Coalition. I have been the coordinator of many of our regional assessments. For those of you who do not know, the CCAC was formed in 2012 from a political movement generated from an assessment of air quality and climate, an integrated assessment of air quality and climate conducted by the UN Environment Program and the World Meteorological Program that was published in 2011. What that assessment did was it put together air quality, air pollution and climate, assessed them together as an integrated issue from a one atmosphere perspective, and identified a priority list of 16 measures focusing on managing and mitigating short-lived climate pollutants, which, if implemented globally, could cut the rate of warming in the next couple of decades in half, save more than 250,000 lives every single year by 2030 because of the reduction in fine particulate matter air pollution, and also substantially increase agricultural production by reducing tropospheric ozone exposure. Those 16 measures, they were global, truly provided meaningful contributions not only to air pollution and climate, but sustainable development, since air pollution management and climate mitigation are sustainable development goals. But our mantra really has been from that moment that we break down the barriers that artificially silo these communities to identify multiple benefits, synergistic win-win solutions. However, we knew that 2011 study that was global, we needed to downscale these studies to find solutions that were more bespoke, more meaningful for specific regions. We've conducted 2 such regional assessments so far and published them. One in 2018 of the Latin American Caribbean region, and another in 2019, most recently published in the Asia Pacific region. And I want to say that in the Asia Pacific region, we evolved through practice our methodology for conducting these kinds of assessments. Typically what we do is we integrate air quality and climate. We look at all of the various measures that could be implemented that would have an impact on air pollutants and co-emitted greenhouse gas emissions. And then we look for those measures that maximize the total climate benefit while also providing an air quality public health benefit. But in Asia Pacific, through consultations with our partners in the CCAC, we determined that really it was actually the air pollution element, not the climate element, that was the major political driving force in the region. So we changed our methodology to actually prioritize air quality mitigation and benefits with a inherent climate benefit. And what we identified were 25 solutions in that region, which if solutions that many of us have heard of before: renewable energy, electrification and cars, mitigating methane from agriculture and waste sources and oil and gas, and many more. But what we found was, by implementing these 25 measures, the region, the Asia Pacific region, would experience 1 billion people by 2030 living at what was formerly the WHO's most strict ambient air quality guideline standards, 10 parts per million PM 2.5. While simultaneously, just for mitigation in the region, avoiding 1/3 of a degree Celsius of warming. So it was a very transformative moment for us that we could say with great confidence that the countries in the region could act purely from an internally focused and a public health relevant perspective. They could act for the public health of their citizens and gift to the world as a co-benefit an enormous avoided warming in a very short period of time. Off of the back of that, we turned to the next major region that we wanted to address, which was Africa. And in Africa, through a very long and robust consultative process, we determined that that the best framing, the most politically relevant framing for the region, was to come from a sustainable development lens. Now, obviously, climate and air pollution, those are both sustainable development objectives, but we wanted to see if we could evolve this and take it a little bit further, keep it within the methodology that founded our coalition, and within the evolution that we have experienced over the last decade of these regional assessments, but really ground the results in the analysis analysis in language and looking for metrics and results that are truly meaningful for the continent of Africa. And we're right in the middle of it. We're moving forward quite rapidly, and I'm always happy to see the progress that's occurring in Africa. And I'm really looking forward to Andriana's presentation on where we're going from here. So thank you very much.
Thank you very much, Nathan. And we're now going to go over to Professor Andriana Mbandi from Southeastern Kenya University to tell us and to give us an overview of the assessment. This is very exciting because I haven't done this before. Andriana, I hope you can hear us, and please feel free to share your screen. The floor is yours.
Good evening from Nairobi. I am sharing my screen. I hope everyone can see my screen.
Yes.
Great. So thank you, Chris, for the introduction, and Nathan for that really robust overview of the assessments in general and introducing the Africa assessment. So I'd like to give you a presentation on integrated assessment of air pollution and climate change in Africa, looking at the period between 2019 and 2021 and beyond. To do so, I'd like to start off by having an observation that looks at the assessment and why, and then answer the question, why an African assessment of air pollution and climate change? Then give you an introduction of the assessment scope, give you a snapshot of the organizational structure, give you some of the milestones that you have accomplished in the assessment, present to you the modeling approach, give you a taste of some of the results from the assessment, and then introduce to you the next steps. So observation, air pollution and climate change are major challenges facing the continent, and these are challenges that are enforcing each other. Air pollution and climate change issues cannot be separated from development. High urbanization in Africa is producing air pollution. This is linked to transportation, land degradation, and waste management. Domestic energy for cooking, for example, we use a lot of charcoal and firewood, use of biomass. It is still predominant, both actually in the urban and rural settings, and it is predominant even in the foreseeable future. So the question, why an African assessment of air pollution and climate change? Nathan has already introduced some of the motivation of having regional assessments. But looking specifically at Africa, the African Union Agenda 2063 describes a vision of the Africa we want, but does not really offer guidance how we are going to actually achieve this vision, which is the Africa that we want. The Africa assessment aims to examine the challenges, the implications, the trade-offs of a range of alternative development pathways that can be plausibly taken to achieve the goals set out in Agenda 2063. More specifically, the assessment aims to examine how an ambitious development agenda for Africa can proceed at the same time as reducing air pollution, but as well as improving our health and well-being, limiting the impacts on local ecosystems, and also helping to avoid contribution towards global climate change and regional climate changes. So it also provides an appropriate and timely response to informed planning by governments and other stakeholders. The assessment also explores modeling. It actually models various options for enhanced synergies and avoided trade-offs. But what the modeling is not, is that it will not determine which path is best, but it should help to inform and facilitate discussions around this topic. So the first motivation for why an African assessment is to look at the human lives threatened. If you look at this study that was just recently concluded in 2021, you can see that the case of the communicable diseases and non-communicable diseases, there's an upward trend for non-communicable diseases in Africa. And partial reason for this is the increasing incidence of disease, non-communicable diseases that come from different environmental threats. Specifically, the most dominant one is air pollution. Now, you can see that chart goes on until 2019. A good question would be what would happen post-COVID? So looking at the period of 2020 and 2021, perhaps that trend for communicable disease would have changed, but the non-communicable disease, I would argue that trend continues going upwards. Now, if we look specifically at human lives, number of premature deaths that's happening in Africa, it is actually estimated about 1.1 million deaths a year. are occurring in Africa. That, as Chris introduced, the biggest burden is in household air pollution, as well as ambient air pollution. If you look at the trends of ambient air pollution from fine particulate matter, that has actually been on the upward trend, unlike the bigger burden, which is household air pollution, which has been declining for a number of years now. And if we look at the economic loss due to air pollution in Africa, we should be alarmed, because if you look at sub-Saharan Africa, about 4%, 3.8% to be specific, of GDP is lost due to exposure to air pollution. That can count as welfare losses. Other continents, other parts of the world, some of this is higher, South Asia, but actually the good news in Africa, we can make a case to act before the costs get even more substantial. But in addition to human health and the cost of the loss of human health, it is the unique ecosystems in Africa that are actually beginning to get threatened or are threatened to extinction. So if you look at, for example, the extinction, we look at the drylands areas of Southern Africa, fynbos plants, it's estimated 2,000 plant species in dryland areas could become extinct within 100 years. Such unique plants and biomes such as fynbos, in fact, we could lose up to 45%. What about areas in Africa that are already dry to begin with? Water declining resources, water resources are declining. Suitability for crops that have grown in these areas for a long time, that have adapted to that kind of extreme situation, are already declining in terms of yield. And the future means that Africa will need more water. So our water demand will exceed the supply. And then it will be becoming, portions of Africa will be becoming too hot and dry for traditional crops that we have always relied on. If we look at the high mountain regions of Kenya, for example, some of us grew seeing the top cap of Mount Kenya covered in snow. Now, if you look at those East African glaciers, both on Mount Kilimanjaro, our neighbors, and Mount Kenya, up to 80% of the mass that you see at the top of the mountain could be lost by 2100. Now, this should really concern us, because some of these are really beautiful landscapes of Africa that we all take pride in. If you look at places where our islands in Africa, there's huge absorptions of carbon dioxide, which causes acidification. And actually, we're beginning to lose marine life. And the unique tropical coral reefs also beginning to disappear, up to 70 or 90%. So considering all this background and motivation, we embarked on the assessment, and the scope of the assessment is, we started off by ensuring that it's an open and inclusive process for African scientists, practitioners, and policymakers, and it's linking to the international experience. We also took the sectorial approach of exploring potential for transformational change in key sectors such as energy and agriculture. But in conducting the assessment as well, we have to reflect the unique situation for energy in Africa, acknowledging that biomass will continue to be used for the foreseeable future unless some serious interventions take place. But also, we acknowledge in Africa, agricultural sector is fundamental to people's well-being and livelihoods across the continent. So if we have that consideration, we then put together an organizational structure to enable us to conduct this assessment, and as Nathan presented, to ensure that it's embedded, it's uniquely embedded in the African processes. To do so, we assembled this group of key stakeholders to work with. At the core of that organizational structure is the wider coordination group, which consists of 3 co-chairs, a core coordination group that oversees everyday activities around the assessment, a modeling coordination group that is looking at the modeling framework. That entire group works together with the policy part of the process, which is working with the African Union Commission, African Ministerial Conference of Environment, and regional economic blocs, including SADC, East African Community, ECOWAS, and the Arab Maghreb Union. We also engage at the national level with countries by soliciting for nominations through the different Ministry of Environments, and to that we have focal points from different countries. Advising and guiding the assessment is the International Advisory Group that is consisting of various institutions also nominated. But to write this assessment, to put all that together into a report, is the coordinating lead authors and contributing authors. So we've had some few milestones, but we still have some ways to go. So at the very onset of the assessment, we sent out an appeal for contributors to the assessment, and we had over 100 applications for reviewers, authors, and modelers. Now that was the beginning of creating a community together. From that, we have had 87 authors from over 17 countries, and these attended the first author meeting. And this included very specifically early career professionals. Now that community continues to expand and continues to conduct the work in the assessment. We also created a robust modeling group, which actually developed the modeling framework, creating different scenarios, coming to an agreement about the different scenarios through modeling seminars. Important in this process was that it was an iterative consultative process, that we actually assembled the different key stakeholders that were involved in the modeling group, and we understood how we should build the framework for the modeling. But as I mentioned before, we also linked quite closely to policy through global, regional, national policy frameworks such as the SDGs, the Paris Agreement, the UNEA Assemblies, Agenda 2063, the African Ministerial Conference of Environment, and the regional air quality agreements in Africa, etc. We also have a commitment and an active and robust international advisory group that is also including African Union Commission, United Nations Environment Programme, FAO, WHO, IEA, etc. So this whole group works together and is coordinated through the co-coordination team.
3 minutes, Andriana.
Thank you. So the modeling approach is using the Low Emissions Analysis Platform, LEAP, that actually quantifies emissions, looks at how they're transported and how exposure then comes, how human beings are exposed to the pollution and what happens in terms of health. But we also look at the greenhouse gases and short-lived climate pollutants and how that impacts on health. But we also add to that how crop yield is impacted by the different emissions. We have 3 scenarios. And of those 3 scenarios, we have the baseline. Where is Africa heading in terms of the current policies and trends, short-lived climate pollutants and air pollutants abatement measures, and the transformative pathways, which address climate, air pollution, SDGs, and Agenda 2063. Now, various African countries have already been revising their NDCs that include short-lived climate pollutants, including black carbon inventories, air pollutants, and greenhouse gases. There are a number of those countries, and I hope they're in attendance to be able to answer any questions you may have. Other countries are also, as I mentioned, revising their NDCs across Africa. So to give you a taste of the results is to show you this chart, which largely tells us that, in fact, that food demand in Africa, if we look at the baseline and the total demand for food across Africa, it will nearly double if you look from 2014 to about 2050. Now, what is that telling us? That yes, the nutritional value in Africa will be largely still met through cereals and pulses, but as Africa grows more economically stronger, the trends actually start to reverse, where the diet might actually start to consist more of beef and dairies. Of course, that has huge implications, including implications to SDG Agenda 2, which is towards ensuring zero hunger. So to conclude, Chris, is to say that we have the next steps for the assessment. As Nathan also said, we are still in the process of the assessment, and is to invite you all that are joining us remotely and in person in Glasgow to participate through the assessment by contacting us through that email at the bottom. Thank you very much.
Thank you very much, Dr. Ambandi. That was great. And I was going to ask you, if people are here and are interested in participating in the assessment process, what they should do. So it's fantastic that you included that at the end of your presentation. We're going to minimize our emissions as we move through the presentations, and we're going to stay in Kenya. Andriana's presented the African assessment process that will identify strategies across Africa to minimize air pollution and its health impacts and to mitigate climate change. We're now going to look at 3 countries who are putting these practices into action in their planning. We're going to start in Kenya, where we will learn about Kenya's national short-lived climate pollutant planning process. And I'm very pleased to be able to hand over to my SEI colleague, Dr. Anderson Kabila, program leader at SEI's office, SEI Africa, based in Nairobi. Anderson, you have 10 minutes. Anderson, can you hear us?
Yes, thank you very much, Chris. Can you hear me now?
Very well. Please go ahead.
Okay, let me share my screen. One second here. Just give me a sec here, please. Okay. I hope you can see my screen now.
We can see your screen, yes.
Okay, thank you. Yes, so good evening, everyone. My name is Anderson Kabila. I'm based here in Nairobi at the Stockholm Environment Institute. So I will be talking about a project on supporting national action and planning for short-lived climate pollutants in Kenya. So it has been predicted that global temperatures will actually increase by 1 degree above pre-industrial levels, and under business as usual scenario, this will go to about 3 degrees by 2100. So why Africa actually contributes less than 4% of greenhouse gases? There is a need to actually cut down on the air pollution and short-lived climate pollutants because they actually, contribute, to direct impacts in terms of annual premature deaths at about 49,000 in Africa, as well as loss of crop yield. For example, for wheat, that goes to about 21%, topping about 300,000 tons per year. So there is actually a need, for African governments to put in some investments in curbing short-lived climate pollutants as well as air pollutants.
Anderson, we don't see the slides advancing. We just see PowerPoint and the title slide. So I don't know if you're able to put it into presentation mode.
I have done that.
Anderson, you need to reactivate your slide at the very top. It's saying it's been deactivated. So if you do that and then stop sharing and reshare, then it should be able to move.
Okay.
Okay.
Is it moving now?
It's pending, but I think it might be. Just hold on.
Okay, let me stop sharing and share again.
All right.
Is it moving now?
No, we just see the title slide in PowerPoint. Are you able to click on the slides down the left-hand side and advance them that way?
Okay, I think I'll just advance this way. It's
That's,
okay now?
That's working, yes.
Okay. So let me just start from here. So as I said earlier, global temperatures are predicted to increase by 1 degree above pre-industrial levels. And this is estimated to increase to 3 degrees by the year 2100. So despite the fact that African countries contribute less than 4% of the total greenhouse gas emission, there's a need to actually cut down on short-lived climate pollutants as well as air pollutants because of the impact that they pose on the health and environment. For example, in Africa, there is almost like premature death of about 49,000 yearly, as well as crop loss, for example, for wheat, leading to about 21%, that accounting for about 300,000 tons a year. So that shows that there is actually a need for African governments to invest in the reducing air pollutants and short-lived climate pollutants as a whole. So the major short-lived climate pollutants that we are currently looking at are the black carbon that have a local impact, as well as methane that can last in the atmosphere for about 12 years, having mainly global impact. We're also looking at the tropospheric ozone that lasts for weeks with a major global and regional impacts, as well as hydrofluorocarbons that last for about 15 years, having some sort of global impact. And there are also, long-lived climate pollutants, which of course we are not looking into in this project. So we have to adapt, an integrated approach because air pollutants, short-lived and air pollutants, have the same sources, of which we know the major ones are transport, energy, industry, agriculture, and waste. They are all, have like common pollutants, of which these sources have common pollutants, some of which are like short-lived climate pollutants as well as air pollutants, and also taking into consideration greenhouse gases, which we are not considering in this project. There's also, the need to minimize multiple benefits in terms of, taking into consideration health benefits as well as environmental benefits as well. And the information that will generate from the modeling will provide data to actually inform effective decision making, as well as planning in terms of implementation. So we've actually done similar projects across the world in North America, South America, Africa, Asia, and Southeast Asia. So this is not the first time we are doing such a project, and we are now trying to take that experience and see how we could leverage that in Kenya. These are some of the countries that we've actually implemented similar projects in, talking about Togo, Bangladesh, Nigeria, as well as other countries. Then going forward to the process, I would like to present what was done in Nigeria, and starting with the interventions right at the base, where we first of all have to start with planning in terms of integrating all the different stakeholders that are involved in the project, and this constitutes the major sources of pollutants. For example, the transport sector, the energy sector, and the industry. Then we now move, after having done that, we then move to the qualitative assessment, whereby we actually use the LEAP tool that Dr. Mbandi made mention before to do the modeling. Then after that, we have to develop some sort of implementation plans and pathways that shows some mitigation scenarios in curbing, short-lived climate pollutants. And after that, we now present the results, to the high-level stakeholders in terms of the policymakers for their, review and approval. Then, after review and approval, then there's now the stage of implementation. So at the intervention stage, that's what was done. And at the output phase, we have the institutions that were responsible for the, the process, the different ministries in collaboration with SCI and other stakeholders. And most of these institutions, we had to like actually engage them in co-developing, the scenarios, and that will actually be used, to develop the action plans. And at the end, the outcomes we had were the action plans that were developed, implementation pathways, and also, the whole plan that was actually submitted to the government of Nigeria.
3 minutes, Anderson.
Okay. So these are some of the examples of in terms of measures that were implemented in Nigeria to curb some of the short-lived climate pollutants. I'll not go into details. And here are some of the stakeholders that were involved, of which we are doing the same process of engaging these similar stakeholders in Kenya. Then moving forward to the activities here in Kenya, we actually have to set up the project, raise awareness with all the national stakeholders by launching some sort of a stakeholder engagement online platform where we actually launched the project. Then after that, we now move to developing the model as well as implementation plans, which is currently ongoing. And once those plans have been developed, we'll now look for ways to actually mainstream them into national processes, as well as producing a roadmap for implementation. So this, we're actually using the LEAP tool to do such, to do the analysis, and this is the process whereby we have to, do the base year, baseline scenarios, mitigation scenarios in collaboration with all the stakeholders. We've actually done a lot of trainings in Kenya for all the different sectors different sectors that are actually involved in the analysis. And what was done previously, we had some results in terms of greenhouse gas mitigation. So these are some of the results that we had, excluding forestry. And you can see that here, agriculture is the major source of greenhouse gas emissions in Kenya. And here it's also about some of the energy demand in terms of greenhouse gases. Here we have the most greenhouse gas energy source is coal, as you can see from the brown quadrant on this figure. And in terms of this particular project that we did previously, we were looking at the manufacturing industry as well as the energy and transport industries. And these are the mitigation actions that were used to actually reduce, these emissions. And these are some of the results that we had in terms of mitigating greenhouse gas emissions with respect to the baseline scenario. And sorry about that. What just happened here? Yeah, so basically, those are the main findings that we had in previous analysis that we did in terms of greenhouse gas emissions, and we're looking forward to replicating the same method for these short-lived climate pollutants in Kenya. Thank you for your attention, and sorry for that for the interruption. Back to you, Chris.
Thank you very much, Anderson. I hope you can hear the claps in the room. We're going to move from Kenya now by the most efficient route to Cote d'Ivoire, who have a long history in the Climate and Clean Air Coalition of linking air pollution and climate change mitigation together. So I'm happy to turn it over to Dr. Benjamin Breda, the CCAC SNAP Initiative Coordinator for Cote d'Ivoire. You have 10 minutes.
Thank you, Chris. That's a 6-hour flight, direct flight from Kenya to Abidjan. I would like to start by thanking SEI and the CCAC and also WHO for giving us the opportunity to share the experience from Cote d'Ivoire and talking about all the practical experience and benefit that could be derived from this integrated approach to plan climate change. Do we have this slide? Okay, thank you. Um, Cote d'Ivoire was one of the early joiners of the coalition, and the narrative from this coalition speak to the country right from the beginning, because we had a hard time to make the case of integrated climate change into local planning. And once the coalition was launched, we thought we've seen right away from the narrative and what could be done through this coalition, that this was one of the opportunity to really push forward climate change planning at the national level. Next, please. So the country has been receiving a lot of support since 2016 through the coalition to start this integrated assessment through the SNAP initiatives. And it helped us develop the first black carbon assessment, SLCP assessment at the national level, looking at two major SLCP directly emitted in the atmosphere, black carbon and methane. And the plan that was developed was approved in 2019, and it has included in that plan assessment of key policies and measures at the national level. There were 5 main sectors that were covered under this plan. You had household energy, transport sector, waste. We also had oil and gas. And so, next, please. So through this plan, we were looking at 16 measures, 8 measures targeting black carbon, and we also had 8 measures on methane. And what we were able to highlight through this plan was the huge potential that was there at the national level by implementing those measures to really cut the emissions. It was estimated that 60%, up to 80% of the BC could be reduced, the black carbon emissions, and we could also reduce up to 50% of the methane emissions by implementing those measures. So that, and including the benefit that could be also derived from the health impact, on the impact that we could have on reducing premature death. That gives us the reason to expand this analysis, to see how this analysis can really benefit for a broader planning process, including climate change. So with further support from other institutions, such as the NDC partnership, but also UNEP and SCI, we were able to undertake a much more robust and inclusive analysis to inform the revision, the revision of the NDC that was undertaken recently. Next, please. So that revision of NDC was in line with what was planned for the implementation of this first version of the plan, and which has 3 main areas of intervention. And one of the key areas of intervention here after adopting the plan was the mainstreaming of this plan into other plans such as air quality and climate change plan. And based on that experience, we were having the case or the argument to now really look at what could be done for the climate change planning. So the NDC process was one of the good opportunity to test this. And next, please. So through the NDC revision process, we then move from 16 measures that were analyzed to up to 37 measures. 37 measures across more than 12 sectors. And the analysis was also taking into account other constraints related to the overlap between plans, but also lack of information, and also some modeling constraints. Next, please. We were also able to look at the different pathway depending on the measure that we were considering for the NDCs. For example, here you see on the graph out what we call the category 1 analysis. The category 1 measures will impact the emissions, and we were also able to consider what we call here additional measures that will be more ambitious measure for the NDCs. Next, please. And so this finally helped us to build the new commitment for Côte d'Ivoire. And you see on this slide here that Côte d'Ivoire has been able to put forward 2 sets of commitments. The first one is an unconditional commitment to reduce 30% of its GHG emission by 2030, and also a conditional commitment to reach net zero emission between 2030 and 2050. And this was all possible by the analysis and the experience that we gained through the SNAP. And to conclude, maybe I will just give some few takeaway message. Next, please. So what is important here to notice for this analysis is that at the end of this process, in addition to the SSCP that could be reduced, like 58% of black carbon and 30% of methane, there's also a huge impact on health, on the reduction of premature death. It's about more than 7,000 premature deaths that will be reduced by implementing those measures. Next, please. And finally, I will hand, next. Okay. No, that was the previous one. Okay. Thank you. So I just wanted to stress here, to hand like 3 key points important for undertaking this type of integrated analysis. The first one is building on existing analysis, existing data. By doing this process, we were able to take into account all the assessment that were done, including national communication, biennial update report, and integrate all of them into a much more coherent analysis. And the second point is also the importance of the platform that we use, the LEAP IBC platform. That's something also important. And I think the third and last point is the way this analysis was built from the start, having an integrated approach right from the start with the SNAP really helped in transitioning into a much more robust and complete set of analyses that include at the same time climate objectives, but also health objectives, and to also improve the analysis as new data is coming in the process. So that was the key message for the experience from Côte d'Ivoire. Thank you.
Thank you very much, Ben. Do you know how long a flight from Abidjan to Morocco is?
4 hours.
4 hours. Okay, so we're now going from Cote d'Ivoire to Morocco, and our final presenter who is going to talk about the identifying priorities for short-lived climate pollutant mitigation in Morocco to achieve climate change and air pollution benefits. Dr. Abdelali Dakina, who is the National Short-Lived Climate Pollutant Coordinator. Monsieur Dakina, you have 10 minutes.
Thank you, Chris, for the invitation, and I'm pleased to be with you in this important side event in the WHO pavilion. So I will share my screen. Do you see my screen?
Yes, if you can put it in. Yes, we can see your screen.
Yeah, thank you very much. So, as you mentioned, I will talk about the Moroccan situation regarding climate change and air pollution. But let me give some macro indicators regarding Morocco. Morocco is as you mentioned, in the north of Africa, just 14 kilometers from Europe. And the area is around 711,000 square kilometers. The GDP is around 113 billion US dollar. Population is around 36 million. And the energy dependence are 97.5 in 2009 and moved right now to 90%. As a big effort regarding energy efficiency and renewable energy development in Morocco. Those statistics are coming from the Department of Planning and Statistics. Our commitment regarding renewable energy in the NDC is around 52% by 2030, and right now we have more than 38% as capacity installed right now, and we contribute by less than 0.2 in regarding greenhouse gas in internationally, and we commit ourselves to reduce by 45.5% by 2030 our greenhouse gas. But we have a high awareness and at the high level of the state, but the question can we put why we are this growing interest to climate issue and how it does look our context. You know, we have some favorable context right now, and with this high ambition and political support and the strong involvement of all stakeholders, and with a clear strategic framework and regulatory framework, and also with our active working with at the regional level like in Africa. But we face, in the other hand, also big challenges regarding our vulnerability regarding to climate change and air pollutant, and some challenges also to governance and to mobilization of international support. But let me give some numbers or some percentage regarding our revised NDC. The objective, as I have said before, is 45.5%, and in which we have 18.3% as in conditional target, with 34 in conditional measure, and with the mobilization of more than 17 billion US dollar. For the conditional target, we have 27%, and with 27 conditional measure, and for more than 21 billion US dollar, for a total of 39 billion dollar is needed to achieve this ambition. As you see there, you have as for the business as usual, the red line, and for the inconditional is the black one. And if we achieve the all measure and the conditional and inconditional, right now I think we will decrease our emission by, as I've said, more than 45%. In the other hand, regarding air pollution, we have also a big program regarding that. And this program aims to consolidate the effort made and the involvement of different stakeholders in order to reduce the impact of air pollution by 2030. It's based on 4 pillars to strengthen the network of measuring in order to measure all pollutant. And for the new one station, we measure also the PM 2.5 and the black carbon. So the second pillar is focusing on the strengthen the reduction of emission of air pollution in the transport and industry sector. And the third is to strengthen the regulatory framework for air pollution. And the last one is to strengthen also all communication, awareness, and sensibilization of all stake population. What the SNAP, as we have done it between cooperation between the Department of Sustainable Development, UNEP, and CCAC, and other stakeholders and other colleagues, we have focused on many sectors like residential, electricity production, transport, industry, HFC, and modeling the energy, direct energy emission and non-energy emission from certain sectors. But before we have a great work and a very, very interesting work made with cooperation with SEI and with you, Chris, especially. I thank you for your support. And we have doing the benchmark of some CCAC members and collecting data required by sector, by activity, and by process. And for all those activities, the consultation are continue with different stakeholders by sharing the approach and the procedure, and by the way, also enhancing the capacity of stakeholders. And we have prepared the first inventory of SLCP now in Morocco, and it should be updated regularly for the future. And we have developed also a list of mitigation measures with the integration between the measure developed for the NDC and especially for the SLCP2. So this inventory made by the LEAP IBC show that those three main contributors of the different emission are the energy demand, the transformation, and non-energy sectors. So for the SLCP, and as we have modeling in the analysis, as you know, in this yellow one, the methane represent more than 98%, and the other HFC and other gases also regularly. We have make this modeling from 2040 as the year basis to 2040 as for our modeling. So
2 minutes, Monsieur Dequina.
Yeah, the other gas, thank you. The other gases, polluted gases, are carbon monoxide, nitro, and so and so. So as you know, we have the focused on PM10 and PM2.5 regarding their impact on health and population. The PM2.5 are approximately around 17 microgram per cubic meter, and it should move to 18 microgram by nanometer. So Why we have focused on PM 2.5? Because they accumulate or are composed by a big form of different fine particles, and also by the particles whose are the precursor of SO2, NOx, and others. So the different measure made with different station in different cities in Morocco gives a similar number of PM 2.5 like we have with the MBC, with the LIP IBC, and the two one in the right are the value that modeled by the Ministry of Health and the World Bank. So different measure or different analysis on population and disease commonly studied are ischemic heart, stroke, low respiratory, and so. So with this, we have some measured the mortality for 2.5 PM 2.5 in different Moroccan cities, and you see there ischemic heart and stroke and the lung cancer are mainly present in different cities. And with this simulation, we face around 7,000 deaths per year attributed to air pollution. And if we made the different measures that we have identified, I think we can save around 200,000 human losses by 2030. Proposed measures
1 minute.
are proposed measures are 16 specific measures and 35 action measures from the NDC. And then we have, as you have said, I have said before, we have developed those measures regarding these three blocks through the demand in different sectors, transformation and energy and non-energy. And if I give some result regarding methane in the transport sectors, you see there, and we have different measures already adopted. And I think Morocco move fast regarding climate change and air pollutant, but it should be to do so with the different countries in this regard. And for black carbon, if you see there, for example, the introduction of Euro 6, it was decided since 2015 to enter into force the next year in Morocco. So we have those measures that have been modeled, and for different cases. For the energy sector, for example, we have, as I have said, we have different measures regarding renewable energy development, energy efficiency, combined cycle, using PV systems in urban area and in different sectors. So we focus. We try to. We have as planned for renewable energy, for example, around 10 gigawatt by 2030. So thank you very much for your attention.
Thank you very much, Mr. Dakina, and thank you to all our presenters. Unfortunately, we're out of time, so don't have any time for questions and answers. But as Dr. Mbandi said, if people are interested in being involved in the Africa assessment, then please contact us or the Climate and Clean Air Coalition. Thank you very much for your attention. Thank you.
too late after the time. It's already 10:30.
Yeah.
Any one of us has her on WhatsApp or something? Rivati?
No.
No. Okay. Louise, I'll let you share your screen. I'll go off camera.
Okay. Oh, okay.
Oh, they said you can start. Okay.
So we can start in just now.
Yes. So I wait for Louise to share her screen, and then I'll hit the button start the webinar as soon as she's shared her screen that shows the title of the webinar to everyone. So Louise, we can see your screen, but it's not in. Yes. Okay, I'll launch the webinar now. So Sebastian, please wait just a minute or so for everyone to join before you start the introduction. Thank you.
Okay.
Recording in progress.
So good afternoon to everyone. I'm Sébastien Denis, Director of Environmental and Occupational Health Department at Santé Publique France, which is the French National Institute for Public Health. And so I just propose that we wait again 1 minute more, that all the participants can join to the session. And so welcome to everyone. So I think we can get starting now. So once again, I welcome everyone, both virtual and in person, at the WHO Health Pavilion in Glasgow. And I would like also, of course, thank WHO and COP26 organizers for the opportunity to have this side event at the COP26 Health Pavilion in Glasgow. So this topic sensation, which is entitled Untapped Potential of National Public Health Institutes as Key Climate Actors, has the following objectives. It is to show the existing and potential key role of NPHEs in climate adaptation and mitigation. And the main purpose is to launch the YANFI roadmap for action on health and climate change that will be presented to you later on this session. And this session was co-organized by YANFI, the National Public Health, the National Association, International Association for Public Health Institute, Santé Publique France, and Health Security Agency. So some few housekeeping information because before we go to the introduction of the webinar, so please feel free to comment in the chat and ask questions in the question and answer box all throughout the session. And so I would like kindly remind you that the meeting is being recorded and the recording and slides will be made available on the YANFI website and email to participants. So just to introduce the session, I would like to give the floor first to Professor Duncan Selby, who is president of the YANFI Association, and to Professor Geneviève Chen, Chief Executive of Santé Publique France, that will give us a few words of introduction. So Professor Selby, please. Thank you.
Thank you, Sebastian, and hello everyone. And it's hugely, it was a delight to be here and to have this opportunity today, which we're doing in conjunction with Santé Publique France and with the UK Health Security Agency, but under the banner of IANFI, which Sebastian has introduced, the International Association of National Public Health Institutes. And this is 95 countries in membership, 110 institutions, and we're all part of government in our countries, and we all have responsibilities for protecting and improving the health of the people. And there's no higher concern than climate change. And this session is about showcasing the practical ways, the concrete ways in which national public health institutes are already involved in adaptation and mitigation for climate change, but also there's so much more we can do. Early in 2021, 15 of our institutes in every corner of the world got together to look at what we're doing now in climate change and responding to climate change around the world, and to prepare what we've called a roadmap about how we can go further and do more. And we're hoping to inspire more involvement of national public health institutes in this work through this roadmap, because we believe that national public health institutes can be key actors in climate change, and we very much want to play our part. I'm going to hand over to Geneviève, who will speak about some of the examples, and then we'll get on to the program as a whole. Geneviève, over to you.
Thank you very much, Duncan. Ladies and gentlemen, and dear colleagues, I'm also really delighted to meet you even through this video. In this session. So many of you have joined from very far reaches of the globe, where you are the lights of your nation for public health. We all share the growing recognition that climate change, loss of biodiversity, and the destruction of nature are major threats to global public health. The far-reaching consequences of the COVID-19 pandemic also support the needs of a stronger integrated vision of climate, biodiversity, and health. As Duncan mentioned, secure and healthier environments are the greatest challenge of the 21st century. And I would like, with all humility, to share with you how Santé Publique France is thinking about it as a very active member of EANFI. The founding event of this awareness for Santé Publique France is the experiences of a very strong heat wave, and goes back to 2003 in France. The excess mortality was nearly 15,000 people during the first 3 weeks of August that year. Since then, we implemented a sophisticated surveillance system together with the National Weather Forecast Agency, Météo France. Now, surveillance is also integrated with prevention by informing everyone at the right time about the best behaviors, and also by bringing concrete solutions to reduce exposure to extreme heat. Yet the number of heat waves has increased in France, and although no one is comparable to 2003, the human toll remains too large. There are also many lifestyles that are known to be unhealthy, such as sedentarity or unhealthy food diets, leading to air pollution or lack of access to nature. It is our responsibility as national public health institutes to mobilize essential public health functions to act for healthier environments to mitigate or reduce the impact of climate change. For example, for extreme weather events or air pollution, we need to monitor them to measure the impact on health and promote more healthy environments. Like other institutes, at Santé Publique France, we base the implementation of essential public health functions on the best available scientific data. For example, for the modeling and anticipation of the dynamic of epidemics of vector-borne disease at a regional level. For example, for the economic valuation of the impacts of air pollution on health. Therefore, we need all sciences to be strongly supported and attractive to the best researchers, willing to make a difference on the value chain up to innovation for a healthy environment. We not only need to measure the problems, but also promote and implement concrete solutions known as efficacious. Like other institutes, at Santé Publique France, we also base our actions on a constant dialogue with representatives from all sectors, as well as local and national decision makers. For example, by developing tools to quantify the health benefits of climate policies in the field of air pollution and urban planning. Therefore, we collectively must go beyond think globally, act locally. We need to think and act at the best possible level to be efficient, because everyone can contribute at her or his level to collectively think and act. Today, from the Health Pavilion of WHO and through YANFI and with our UK colleagues, National Public Health Institutes worldwide are now uniting forces to strengthen public health in climate change mitigation and adaptation. The YANFI Working Group is a first step of international collaboration that builds up on already existing actions at the national level. It is the start of a momentum where national public health institutes are actively showing that they are doing their share, they are sharing experience and good practice and keeping track of progress on public health using a common dashboard. At Santé Publique France, we are committed to strengthen all these common activities, and we need you all to achieve this collectively. On the 8th of April 2022, we will organize in collaboration with YANFI the next event on climate change and public health. I invite you to join us and discuss together the first achievements and the ways forward. But for the moment, we are not being surprised nor discouraged by the resistance of the spirits we are facing or going to face. We need to accept it and collectively move forward, since we cannot turn heads or close eyes if we want to contribute to open the door of a better future. Can we achieve that goal? I share with you my thoughts. We cannot avoid it. It can only be delayed or hastened, that's all. So as National Public Health Institutes, let's think and act at all possible relevant levels to accelerate the way to our common interest and our common destiny with the planet. Thank you very much and enjoy the round table.
Thank you very much, Duncan and Geneviève, for these very good introduction words and very enthusiastic and devoted to actions. So, and now I would like to give the floor to Dr. Revati Falki. I think we have the link with WHO Health Pavilion. I'm not sure, but
yes,
we just try, Revati.
Yes,
yeah, hello, how are you?
Hi.
And so, Revati, you are Head of Climate Change Analysis Unit at UKHSA, and so you will provide us with the presentation of the roadmap, and you have 8 to 10 minutes to do this presentation. Thank you in advance.
Yeah, thank you very much, and thank you IANFI for including UKHSA into these conversations and also giving us the opportunity to contribute to the roadmap, which is really, as the previous speaker said, it is a joint vision that we would like to implement going forward together with other national public health institutions. And I think that we've heard enough in the last week or days. We've heard a lot about climate change being being also a health emergency, and all that it's the greatest threat. We've read this 100 times. I would like to turn the argument into saying that this is also our greatest opportunity. And we have seen that, of course, there is recognition that this is a challenge, but most of the momentum is to move to what can we do about it. And I think one of the things that comes out of this COP is, of course, to keep the 1.5-degree ambition alive. And there is every interest of the national public health institutions to rally behind this ambition so that we can then be better equipped and for protecting the health, and which is our main mandate, protecting the health of population. So every half degree is a concern for public health people. And I think that as we emerge from the COVID-19 pandemic, things are clear. We have spoken a lot about health systems resilience. We have spoken about community resilience and everything. But this is the opportunity, because most of the conversations that are being worked about resetting business as usual, this is our opportunity to do it. this is our opportunity to take a step back and really implement health in all policies, all climate policies, and climate in all health policies. This is nothing new. We have heard and spoken about it for decades, but this is our opportunity to reset and find those leverage points in policy and practice where we can join the siloed working of the climate community and the health community. So I do see the emerging challenges from plans that are being rewritten to some extent after the COVID-19 pandemic. And of course, we also, I think the health community appreciates a lot the multiple benefits that we can have from climate action. And this is really the main argument why every climate action is a health intervention. So everything that we do for climate change will be beneficial. And of course, we have to think carefully about the disbenefits and all of those things. But the larger picture is that everything that we do for climate change should be good for health and the other way around. And next slide, please. And I think we have appreciated what the role of national public health institutions can be. But the main thing that I would like to say is that we are in a unique position where we are generating evidence, we are processing evidence, collating it, and we are making it available not only to the policymakers but also to the communities. Through the advice that we are generating for health protection. So we are in that unique position that we, in this entire knowledge ecosystem, we have the ability to mobilize knowledge in both directions. In the direction of the people, where action at scale can be taken, and in the direction of policy, where all the main leverage points are for scaling up action, and which is exactly what we've been talking about for the last whole week. So of course, the three key functions that, as you see on the screen, is of course the first one is that national public health institutions are responsible for monitoring the health impacts of climate change, but also monitoring the acceleration of them, and not just what the impacts are felt at the population level, but also where are we with responses. I think that is the key conversation that we need to have, that yes, we have to large extent we know what the health impacts are. We may not know all the details, but we know enough. And we know enough of what can be done about it, that you can start monitoring and accelerate that monitoring as well, and strengthen national public health institutions to be able to do that in a comprehensive way. Of course, apart from understanding the impacts, national public health institutions are also frontline responders. Many of the national public health institutions are responding to the extreme weather events of climate change, nutritional impacts, and all the other health impacts that we see from climate change. So whatever evidence that we are processing and generating, we are also using ourselves to design and implement interventions for climate change and health. And of course, that also applies to the advocacy component of it and behavior change component of it, where health protection advice is essentially guided by the evidence that is available to national public health institutions, and how can we operationalize the changes that we do. So in that sense, we are sitting in between the clinical and the curative health systems component and the community health systems. So together, these three systems are essentially looking at health protection improvement and the well-being of the populations that we deal with. Now, some of the work that the climate change group within the IANFI has done, a survey that we recently implemented, we found out that the full potential of the national public health institutions is not yet reached. So yes, there's a lot of effort ongoing, but we should be reaching full potential to be able to make that difference. We realized from the survey that few of us are identifying ourselves as key climate actors. We do still externalize the climate action, and I think we need to internalize that. There is involvement of national public health institutions in the NAPS and the adaptation communications, but that can also be improved. It's still not, again, as I said, reached potential. And of course, resources as well. So there are inadequate resources within national public health institutions to be able to deliver the level and the scale of interventions, but also the improvement in our understanding of the impacts, and that needs to change. So in some sense, this is a lost opportunity that we would like to kind of course correct as we go ahead into the decade for action until 2030. Next slide, please. So the roadmap of the IANFI basically identifies 5 priority areas for action, which will guide the work of the working group going forward and hopefully inspire national public health institutions to collectively implement and scale up these actions. The first is, of course, to advocate for effective climate research, policy, and action. And this applies, of course, to mitigation and adaptation both. And by advocacy, I also mean for raising our voice, joining the voice of the other health professionals in demanding climate action for health. The second is, of course, to enhance the capacity and the competence of colleagues in national public health institutions and facilitate peer-to-peer exchange, knowledge mobilization, not just from organization to organization, but from communities to communities. And this will be achieved, hopefully, by sharing of case studies, supporting each other with the methods that are there. Quite many national public health institutions are quite advanced with their risk assessments or scaling up adaptation. So learning from each other really and making that information available to national public health institutions globally. Complementary collaborative action, not just at the global level, but also at the regional and the local levels. And working just not within the health sector, but also the health determining sectors, because again, we are in that unique position to bring everybody around the table to scale up action on climate change. Number 4 is, of course, lead by example. So we've heard a lot about mitigation in the curative side of the health systems, but I think that conversation needs to be had also in the public health service delivery component of the health system. So lead by example by doing our own carbon footprints, but also advocating for scaling up adaptation action alongside maintenance of mitigation action within the public health service delivery. And then the 5th and the last one is, of course, to monitor progress. So what progress do national public health institutions make from now, say, in the next 5 years on their role as advocates for climate action, or also their involvement in the national adaptation programs or the health NAPs and so on and so forth. So making sure that we document and share with each other examples of what action has been taken. Next slide, please. Yeah, so I'm very pleased to say that the roadmap and the position paper is available in 5 languages. So please spread the word and share it as widely as possible. Next slide, please. And that's the link, and we are also, of course, it's available to you on the social media to share. Please spread the word. We would really appreciate as widely as this can be sent out too. And then, of course, none of this would have been achieved without our colleagues, the members of this Health and Climate Working Group, names of whom you see on the screen. I would like to thank each one of them, because without that, the roadmap would not have seen the light of the day. And thank you, IANFI, for stepping forward and getting this done. Thank you.
Thank you very much, Revati, for this very nice overview of the roadmap that was linked into the discussion box of the Zoom tool, so everybody can access to it. And as Revati said, do not hesitate to share this roadmap, because it's really important that the information is well known by everybody, and that you can share that in your networks. So now, we have some questions, but what I propose is that we keep questions for the end of the session, so that we can give the floor to 3 panelists that we invited to this session. And I would like to introduce you to Dr. Juan Rivera, who is Director General of the National Public Health Institute in Mexico. Then Dr. Alonen, who is Research Program Director from the Finnish Institutes for Health and Welfare, and Dr. Ochu, who is Director of Prevention Programs and Knowledge Management from Nigeria. So please, if you could switch on your camera, and then I would ask you for 2 questions. So the first question, so we'll start with Dr. Rivera, if you agree. What are for you the main challenges faced by your institute in responding and preventing the health impacts of climate change? And you have 3 minutes to answer.
Thank you very much, Sebastian. I'm very pleased to be part of this panel. The National Public Health Institute in Mexico is committed to be an important climate actor in Mexico, Latin America, and globally. And one of the key challenges, and that was the question, challenges in responding and preventing the health impacts of the degradation of our planetary systems, including climate change, is that the interlinks between public health and the degradation of the natural planetary systems that are leading to climate change and biodiversity and other consequences are not always understood among public health professionals and relevant stakeholders. I have recently announced to our community that we are launching next week a planetary health program at the Institute. And the first step in the creation of a program is making sure that all the members of our community, investigators, students, and staff, and our key partners are aware of those interlinks between climate change and health. Our planetary health program will address the health of human beings and the state of the natural systems on which they depend. We will focus on how to understand the relationships between global environmental challenges and human health and well-being, and it will work on research to generate evidence-based policies to promote health, well-being, and development while preserving the environment. The program will bring together investigators from three main centers: environmental health, dietary and nutrition, infectious diseases, to strengthen existing research and advocacy projects, as well as creating new ones on the following topics: local and global effects of air pollution, healthy and sustainable food systems, impacts of climate change on infectious diseases, on social vulnerability, on food production, and on catastrophic events, hurricanes, floodings, fires, and monitoring trends in these topics. In addition, the program will incorporate the Mexican School of Public Health, which is part of our institute, with the aim of modifying our graduate training programs in public health and epidemiology to incorporate topics related to the interlinks between health equity and the degradation of natural systems in all our programs. Moreover, for many years, we have had a green program to reduce the Institute carbon footprint. And this program that is called ECO-INSP will be reinvigorated and will be part of the planetary health program. Our institute, the second challenge, and I think that I will stop there because it's 3 minutes.
Thank you very much, Dr. Rivera. So, and we've seen the very good, ambitious changes of Mexico. And the same question to Dr. Alonen from Finnish Institute for Health and Welfare.
Yes,
in 3 minutes
thank
as
you.
well. I know it's very challenging, but
I can be short. Greetings from Helsinki, and thank you for inviting me to this event. It's a pleasure to be here. It's raining here in Helsinki now, not snowing as we would hope to, and that's a sign of the climate change as well. I think here in Finland, the health and well-being effects of climate change have been quite modest so far, and that is one of the main challenges. Motivating people to these changes, motivating institutions to start acting. Because if these effects are not directly impacting yourself, or they are not very concrete to you in practice, then it might be still difficult to believe that they can be very severe. So I would say that in our context, we still need more of these examples, like last summer's a month-long heat wave period here in Finland, when people actually saw how the climate change is affecting health. And motivating people and still spreading the word about these health effects is our main challenge. Thank you.
thank you very much, Dr. Alonen, for this very concise answer to this very ambitious question. And now I'll give the floor to Dr. Oshu for the same question with the same time. 3 minutes.
Thank you very much, Sebastian, and hi, everyone. It's my pleasure to be part of this panel. Nigeria Center for Disease Control is Nigeria's National Public Health Institute with the mandate to lead in the detection, prevention, and control of infectious disease outbreak of public health importance. The key challenge we have had as an organization has been our exclusion, so to say, in policy making around climate change. So the poor and very weak information sharing systems across sectors, not being able to link climate data with epidemiological data. And this is what we are working towards achieving currently as the NPHR. Secondly, there's been this poor stakeholder engagement and multi-sectoral collaboration in the development of climate adaptation and mitigation policies and guidelines. So this is one key gap that we have had as an NPHI. We've also had inadequate political awareness and commitment, and I believe COP26 has done a lot in improving that awareness and bringing out commitment across different governments and different countries, Nigeria inclusive. We've also had generally low awareness and sensitization on the health impact of climate change, with poor human and technological capacity for real-time assessment and monitoring of carbon footprint. In the Institute, we have moved gradually from paper-based operations to digitization, as well as shifting from the use of fossil fuel-driven generators to now begin to use solar energy in doing most of the work we do, especially in our laboratories. So, but being able to measure the carbon footprint, we do not yet have that capacity, and hopefully with the peer-to-peer sharing and exchange that we are proposing in this IAMFI roadmap, we hope to be able to build that capacity. Inadequate funding is another key challenge. Funding on climate change mitigation activities for the NPHI. Of course, poor funding for research on the public health impact of climate change is another challenge that we face as a National Public Health Institute. Thank you.
Thank you very much, Dr. Ochoa. And so I would like to spend now some time on the second questions, because as Geneviève, Duncan, and Revati said, the time is for action from these ambitious observations. So what would be one example of key climate action led by your institute? So, and I propose that we start again by Dr. Rivera from Mexico.
Thank you.
In 3 minutes as well.
Thank you very much, Sebastian. So one of the actions that we are leading in Mexico, our institute, is the transformation of our food system. As we know, the food system globally is responsible of a great deal of the greenhouse gas emissions and global warming and other aspects of natural earth system degradation. And in Mexico, we have exactly the same situation. And I was part of the Eat Lancet Commission, and we developed there, we proposed a dietary, a healthy and sustainable diet that has to be adapted to the local conditions of each country, with the idea of having a demand for a type of diet that will not impose that burden to the environment. So at the Institute, we have been working on the development of local estimates of the environmental impact of the production of different foods in Mexico. We have created the Mexican Healthy Diet, which considers our food culture and the environmental impact of the food groups. And we have compared the cost of the current diet consumed by Mexicans with the new Healthy Mexican Diet. And we have concluded that in the case of Mexico, the healthy diet is 22% less expensive than the current diet. This means that the cost in Mexico will not be a barrier for adopting the healthy diet. Moreover, our traditional diet complies very much with the recommended healthy diet. Our institute is also leading the development of the new Mexican dietary guidelines, which will consider not only health, which is being considered up to date, but we are also including the sustainability of the environment so that we can contribute to avoiding to reducing the degradation of our planet, including climate change. The guidelines will be published next year and have the approval of the Ministry of Health, the Ministry of Agricultural, and the Ministry of Education. That's one example of an action in Mexico. Thank you.
Thank you very much, Dr. Rivera, because I think that this example is very appropriate in the frame of the climate change mitigation and adaptation issues. And now I would like to ask the same question to Dr. Alonen about
Yes.
one example of action.
Yes, at Finnish Institute for Health and Welfare, there has been research on the health and well-being effects of climate change ongoing for some time. And partly based on that evidence, last year we prepared and were in a major part of preparing climate change adaptation plan for Ministry of Social Affairs and Health in Finland for years 2021 to 2031. There were several experts from our institute contributing to this plan, and together with also experts from Finnish Occupational Institute, we were able to include several aspects of health and well-being into this plan. As examples, the health and social welfare section includes non-communicable diseases, communicable diseases, nutrition and health, occupational health and well-being, as well as social impacts. Then there is also a section about the services that include healthcare, social welfare, and occupational healthcare. We also touch upon security of supply, cross-sectoral impacts, and knock-on effects. And the plan includes over 40 objectives on the mentioned themes and over 90 recommendations for action. And the plan can be used by different organizations, but also by the public and researchers. We also recognized some gaps in evidence where more research is needed. After launching this plan, we have presented it in several events, and another event that is coming is for practical nurses and nurses who are still studying, and we are going to have an event together organized with the Finnish Science Center, Heureka. So we are trying to implement this plan widely now. And so far the plan has been warmly welcomed by the end users. They have been waiting for it. And I'm happy to tell you that the English translation of this plan will be available rather soon, I hope during this month. Thank you.
Thank you very much, Dr. Alonen, for also these very important examples that you've taken about, for instance, education of nurses. And I think it's also a very important way to act. And so now, Dr. Ochu, about the same question about one example of key climate action led by your institute in 3 minutes, please. Thank you.
So the Nigeria Center for Disease Control leads in disease surveillance, and we are working closely with the Nigeria Meteorological Agency to link data from climate change with disease outbreak. We have an integrated disease surveillance and response system, and currently we are using digitized surveillance tool for real-time disease surveillance and reporting. So our ability to link climate change data with epidemiological data of these diseases will go a long way to help us in our risk communication and community engagement activities, as well as in our advocacy for strong political action against climate change. We have a robust multi-stakeholder, multi-sectoral engagement platforms through the incident management system that allows us to engage critical stakeholders that will be very, very relevant in driving communication around climate change action. So we use these robust platforms that bring together ministries, departments, agencies, and civil society groups, and even the non-governmental organizations, as well as the academia and our development partners and the private sector in our preparedness and response activities against infectious diseases of public health importance. We believe that being able to merge this data on climate change with the epidemiological data currently, that this will be a very strong advocacy tool. We've had spikes in Lassa fever outbreak that are linked with practices, farming practices of bush burning that are deleterious to the climate. We've also had outbreak of cholera linked to flooding, but we are working now closely with NIMED to be able to generate data that will be an evidence of how these things link together. So this is one of the key actions that we're taking as a National Public Health Institute. Thank you.
Thank you very much, Dr. Ochu, for this very clear example of key action in Nigeria. And and thank you to all three of you for very concise answers, and we are perfect on time. So now we'll have time for question and answers. So you have a box, a dedicated box in the Zoom tool for those people who are attending by video conference, but I think that we have one colleague with Dr. Liu from CDC China who would like to take the floor and to make some comments about the roadmap and the different answers that were issued to the two questions. So Dr. Liu, I can see your name. So please, you can switch on your camera and you can have 2 or 3 minutes.
Okay, thank you. I'm sorry for the camera problem.
No problem.
Doesn't work. Okay, so I think this is a very good roadmap for the public health institutes to adapt to the climate change and to mitigate climate change. And I would like to share my experience in China, CDC, and we are now trying to establish a strategic plan for the health adaptation by 2035. It will be available soon, maybe at the end of this year. And we try to establish the long-term plan for the health adaptation with the stress on the public health surveillance, planning, and monitoring and action. And with this plan, we try to make the risk assessment caused by the climate change in China. And I would like to know if there's any other national public health institutes, they have the similar plan for the long-term adaptation or mitigation for health. Thank you.
Thank you very much, Dr. Liu, to give this example that gives us the opportunity to know what China plans to do in terms of climate change actions. And I think that around this table, we have a very good representativeness of different countries all over the world. So that's also very important to see that each national public health institute that are engaged into this action and into the good way and to follow the roadmap. So now maybe we can take some questions from on-site attendees at the WHO pavilion, and I would also invite you to ask questions for people who are attending remotely on the question and answer box. And if questions are targeted to a specific speaker or panelist, then this speaker or panelist can answer directly in the question and answer box as well. So is there anybody on site who would like to ask a question? And in this case, I would suggest that Revati, if you agree, you could maybe
I'll hand over the microphone if there are,
okay. Thank you very much.
Any questions from the room. Any comments? Okay, so nothing in the room. Over to you.
Okay, okay, thank you, Revati. So maybe we can take a first question for you, Revati, which was written in the question and answer box. What are the biggest evidence gaps in the association between climate change and health? So I don't know if it's easy, but
Well, I think there's no simple answer to that.
accurate. Yeah.
Um, but I think that I think in a couple of sessions in this pavilion we have discussed that some topics are better addressed than the others. And of course, the clear ones that probably have been neglected is mental health. We still don't understand enough of how mental health is affected. And then the additional layer of climate anxiety. So I think these are the two things that come to my mind. And then, of course, there are a lot of gaps in our understanding of adaptation action. So there are regional variations, subnational variations in how well adaptation action has been documented, and evaluated case studies of evaluation of adaptation action, I think, are still missing from high impact areas. Health systems, again, not because it's close to my heart, but I don't think that we completely understand the impacts of climate change on health systems across the world. And then the issues about resilience within them. So we do talk about health systems resilience quite a lot, but I don't think we completely understand how operationalization of resilience can be achieved at scale. And then, of course, the usual suspects. We know. I wouldn't say enough, but we know a lot. I mean, I have to be very careful in how I say this, but we know about mitigation, but we don't know enough about how mitigation and adaptation can be joined up. And then the last point would be also, I can go on and on about this, but I think the last one will also be that it's the same communities which are vulnerable to multiple impacts of climate change. And I don't think that we have yet understood completely the overlapping and cascading risks that climate change can trigger in high vulnerable communities. And I'll stop there, and I'm sure there will be other thoughts from other colleagues.
Yeah, thank you very much, Revati. Is there any questions from on site now, or should we take another question?
Yes, there's one question on site.
Okay, please go ahead.
Hi, thank you very much. I had a question about
Please, could you present yourself, maybe?
Sorry, yeah, Pauline Chilwig from the London School of Hygiene and Tropical Medicine. I had a question. The examples that were given by the various speakers were very interesting and showed how they work together with like other sectors in other than health. But we know that there are also quite a lot of areas where we're not entirely sure where there are the co-harms or there are externalities. And would it also be within the remit of national public health institutions to kind of seek more often these cross-departmental or cross-institutional discussions to find these and to kind of prevent that co-harms for health are happening across all kinds of different sectors, including, of course, the climate change examples that we've heard about already.
Yeah, thank you very, very much for this very important issue. I don't know if one of our panelists would like to answer to this remark. Dr. Alonen, please go ahead.
Thank you. Yes, I think this is a very important issue, and we should be advocates also on this, combining the different sectors to collaborate, and also indicating the health benefits for the other sectors, I think, is one of the issues that might get them working towards the common goals. And identifying the co-benefits and the co-harms, I think that is part of our job as well.
Yeah, and I think this is very crucial also in terms of mitigation issues. Maybe Dr. DeMarco or Chu, you want to add something about this issue?
Yes.
Yes.
I think that the question just posed, the last question, is very important because, for example, in our institute, we bring together a multidisciplinary group of scholars from different disciplines and backgrounds because we really need a multidisciplinary and systemic approach for this topic. However, there are many other disciplines that are lacking it in our institute. And I think that we now have realized that we should take advantage of the many networks with several institutions in Mexico, Latin America, and globally. And I would like to strengthen that we should take advantage of IANFI's new initiative aimed at strengthening this, the National Public Health Institutes as climate actors, because there is a lot of diversity also and richness among the IANFI institutions. So I think that is something very, very important that we should take advantage of.
Thank you, Dr. Rivera. And Dr. Ochu, on this point, maybe very quickly, please.
Yes, thank you very much. I think the importance of multi-stakeholder engagement in communicating risk on climate change and its impact on health cannot be overemphasized. And one key stakeholder that is usually omitted and which we have discovered is key to communicating health issues is community sensitizers, community-based organizations, as well as community gatekeepers, because the ability to engage the community in our health interventions is very, very key. We need these people that have ability to reach the communities and drive home the importance of behavioral change in mitigating against the effect of climate change on health. We need to engage them, and having that kind of stakeholder engagement platform, like working in technical working groups or working in using the incident management structure that brings together multiple stakeholders is very, very important in engagement of all the relevant sectors in communicating the health impact of climate change. So I think it is very, very important that as National Public Health Institute, we improve on these platforms and bring in all the relevant stakeholders to be able to drive home the importance of climate action. Thank you.
Thank you. And indeed, in the roadmap, it is really focused on this point as well, as we are totally legitimate to interact with the different stakeholders. And so thank you very much.
Sebastian, there's one question in the room. There's one question.
I had one question for you also, Ravati. So, but take the question there. Yes. Hi.
Hi, I'm Markalee Alexander from the Journal of Climate Change and Health. And one question I have is, while multidisciplinary communication is so important, my question is, what is the best thing we can do to get health professionals to all communicate with each other? Because I still feel like many people are doing many things in different places, but we don't really know what we're all doing.
Thank you very much for your question. Who wants to take it? Is there a volunteer?
Sebastian, maybe I can make a start, and if colleagues can add to it. I think
Go ahead.
Can't agree more that we've said this even in the last week in the narrative, that the narrative is that doctors and nurses, health professionals, need to come for join hands for climate change and mitigation and adaptation. I would go a step further and say that public health people have been doing it for some time now. And I think that joining up of those voices, and I completely agree with you that it hasn't happened. At the national level, I can say that, one role that national public health institutions can probably play is to reach out to the how do you call it, the Royal Colleges, for example, in the UK, the Academies of Sciences, for example, to reach out to them and kind of try to find a collaborative way to do it. And the other thing is also that a lot of agencies are now signing up the GCHA pledge for Voice for Health Professionals, and I think that will also bring together these voices in some extent. But it's beginning. I think we are at the start of getting that voice raised and heard, and then we are kind of not there yet in joining it up, and more needs to be done. I agree with you. Thank
Yeah, thank you very much, Ravati. And I think we have a quite similar questions about the consideration of public health in the political debate on mitigation and adaptation. So, and as I know that you participate to a lot of sessions during the COP26, I would like to address you this question. What is your opinion on how the health issue is addressed in this COP26, and if there will be something relevant in the final statement about public health and this political debate on mitigation and attenuation? Could you say something about that, Ravati, according to your experience from this COP26?
Again, I can try. I think that it's positive, I would say, that yes, this is the first time that health has received the attention that it should have received for the last 25 COPs. So I would say that yes, it's positive. I would not say we are there yet, because we are talking about putting health front and central in all climate mitigation and adaptation action. It's happening, but it's happening not fast enough. And I think one key message that comes out for me going out of this COP is that the recognition that health needs to be at the table when the negotiations are happening. And we can only say that, from here on, we make a bigger effort to get to the center and make sure that health is part of the conversations that we go ahead. But yeah, positive, I would say, from my perspective, but not enough as well in the same breath.
So, but thank you very much for this mid-optimistic message, but that's a good way that I think we need to see the things. So thank you very much, Ravati. Is there another question in the room, Ravati?
I don't see, no.
Okay, so maybe a question, once again, a question from the chat box on the implementing interventions from the scientific perspective often assumes benefits to marginalized and indigenous communities. How involved and co-produced are these interventions, and who is taking them up? Are we increasing inequalities? So I think this is also an important issue about social inequalities that was maybe mentioned by Dr. Chu, or I don't know if you want to.
Yes, I think getting the voices of these people that are marginalized, so to say, heard, and getting them involved in policy and decision-making processes will help in mitigating and narrowing the gaps that are already existing. The problems we've had is excluding them in decision-making. And this is also where civil society comes in to play a very significant role in bridging that gap between policymakers and the beneficiaries of our health interventions. So that inclusiveness is one of the key things that we have seen that drives a lot of the inequalities we see, even in health in our communities. So getting these people involved and having a platform and a system that regularly engages all the sectors, including especially those at the community level, is key to addressing some of these inequalities. And this is what we must all do very deliberately in setting up groups and systems that work.
Thank you very much, Dr. Acho, for these last words, because I'm afraid we already have to stop the session because it's 5:29 or in France. Sorry, 4:29, I guess. Yes.
Sorry, I would like to make one statement. I forgot to mention an important thing.
Sure.
And
You have
apologies.
10 seconds, Ravati.
10 seconds. I would say that yesterday a very good announcement came out, which I don't know how I forgot, that 50 countries have now signed up for the 52. Yeah, 52 countries. That's correct, because yesterday evening 2 more countries signed up for the COP26 health program, which includes commitments on climate resilient and sustainable health systems. So I think that is a big win for the health community, and that also says there's a lot more to do, but this is a start. So yeah, thank you.
Yes, thank you. It was indeed very important that you mentioned that, Revati. Duncan, you would like to say some final words to conclude?
Oh, just what an
In 3
important moment.
seconds.
That's such an important moment and fabulous to have everybody on the call. It is a genuine global concern. We have to work together in the ways that have been described this evening.
Yeah, thank you very much.
And thank you, Sebastian, for your moderation.
And thank you for all the participants. And I think that now we are collectively embarked due to this roadmap, and we have also the responsibility to declinate it at the national level. So hopefully we will manage to do some nice things and to push public health in this subject of climate change. Thank you very much to all of you, and I wish you a good night. Bye-bye.
Thank you. Bye-bye.
Thank you.
Bye,
Bye-bye.
everyone.
Bye-bye.
Thanks, bye.
Hello and welcome. Can you hear? Yep. Hello and welcome to this session on climate change and health. Really a big welcome to you all. This is a session jointly run by the Royal College of Psychiatrists, the Royal College of Paediatrics and Child Health, and the Royal College of Physicians. I'm Adrian James, I'm the President of the Royal College of Psychiatrists, and I'm delighted to be chairing this session. We've got 4 great speakers, 2 here, 1 recorded and 1 live from Bosnia. So it's going to be a really interesting session and time for questions at the end. I'm really proud that our college has taken a real stance on climate change. It's one of my 4 presidential priorities. We've declared a climate and ecological emergency. We've said that we're going to reduce our emissions by 2040 to net zero carbon, and yes, we are measuring them. Somebody said yesterday, if you're not measuring but you're saying, you're probably not doing and you're probably lying. So I did check and we are measuring. We've also concentrated on social prescribing and on prevention. Prevention obviously is the ultimate eco-friendly thing to do, and it's obviously good for our patients and good for our health systems. There's no health system in the world that isn't creaking at the seams. And we've also said that we were going to work in partnership with lots of other organisations. Great to have Rachel here from the Centre for Sustainable Healthcare. And yesterday we worked very closely with Climate Cares. So there are lots of people working in this space, and we really do need to work more closely together. So let's go on to our first speaker. I'm absolutely delighted to introduce Dr. Rosie Spooner. She's a paediatrician and deputy chair of the Climate Change Working Group at RCPCH. She's an education fellow at the Centre for Sustainable Healthcare and teacher at the innovative Sustainable Quality Improvement Education Project. So, Rosie, over to you.
Thank you very much. And hello, everyone, and thank you very much for inviting me to speak on behalf of children and young people today. I'm really sorry that there are no children and young people on this panel to speak for themselves, but I joined them out on the streets on the Fridays for the Future March last week, and there was 10,000 people out there talking about why this is an important issue to them. So I think we have a really important role in bringing that out for all of us to think about. So first of all, I just want to say that children are uniquely vulnerable to the effects of climate change because of their maturing bodies, their cognitive and physical physiology, and also because their dependency on caregivers. So all of those risks mean that environmental hazards have an increased effect on child health. And already those are inequalities existing around the world, both globally and within countries, that mean that children, if you're born in a particular part of the world, your chance of having a healthy future are tens of times less than if you're born in a richer part of the world. Now, climate change acts as an amplifier to those inequalities. What we see is that children who are in the most deprived areas of the world with the least contribution to climate change are going to be feeling the effects of that climate change at amplitudes more than those people in countries such as ours. However, even within our country, it's no mistake that Ella kissing Deborah was from where she was and was of a minority group, and that was part of the reason why she was so exposed to air pollution and why she died. So I suppose the message here is that public health is really important to child health, and that we as clinicians have a role in trying to think about how we can address that, and we can turn that around by thinking about inequality not as an amplifier, or climate change could be an amplifier to the inequalities, but actually we could use it as an equalizer. So some of the co-benefits of trying to address climate change as a health issue can actually bring around changes that are really positive for child health. So I'm going to start talking about those at both an individual level, so what you as an individual in your personal life and then in your professional life might be. So personally, we probably are quite familiar with some of those changes that we can make on a personal level, but quite soon you realise that probably the average carbon footprint of a doctor in the UK might be somewhere between 8 and 12 tonnes per annum, but actually that's quite limited in terms of, say you reduce that by 4 tons, you're not going to really contribute to the issue here unless you start going outside of that role and thinking about your role as a physician. And in your role as a physician, what I would encourage you to do is find the carbon hotspot area of your practice. So say you're in a certain specialty, look at where the biggest impact might be. So in pediatrics, what we know is respiratory care is usually our carbon hotspot because of the way that the inhalers we use have a high impact through the hydrofluorocarbons involved in the inhaler. So what can we do to address that? We can't just take away those medicines. That would be obviously damaging to child health. But if we use prevention, we can make massive impacts on the, we can both prevent ill health by making sure that children are informed about the triggers for them, so making sure they know about air pollution. We can empower them to use their inhalers correctly. We can think about how we can reduce their exposure, so making sure we're talking at every opportunity to think about what is causing those things, so if they're smoking in the household, etc. And then we can try and switch to the lowest environmentally damaging inhalers that we can. So those are principles that you can use in clinical practice. At a health system level, we can think about what we as a voice as clinicians or health professionals can do. So I personally went to my chief exec in my trust and said, look, what are you doing? What is our plan? And sometimes trusts already do have a plan. They didn't at that time in 2019 have an active plan, but they agreed to declare a climate emergency, set up a task force, and found money to pay for someone to try to fulfill that role. And in doing that, they were actually awarded 13.7 million from the Public Sector Decarbonisation Fund. So I think my message for those people who are in management is actually some of these benefits that we can feel by trying to adjust and change to a more sustainable healthcare system can have financial gain for you as well as health gain. So there's a really good message there that it means that we could be, improving the services that we're delivering. And then finally, at a policy level, we have a role as health professionals to speak up, to speak out, and ask. We only present about 5% of the country's carbon emissions, but also globally about 5%. But we have a role to talk about what is happening outside of that sector. We need to talk about fossil fuels. We need to talk about reducing those fossil fuels so that everyone can try to live in a much cleaner and healthier environment.
Okay, well, thanks very much, Rosie. That's fantastic. So it is an inequality issue. It's a poverty issue. There are things that you can do. You can look at your own practice. You can look at those carbon hotspots. You can be active, proactive, approach your organisation, find out what they're doing and make sure that they're doing it. It can work for them as well as working for the planet. So thanks so much, Rosie. So let's now move on to Stephen Holgate. Stephen is a consultant physician and RCP special advisor on air pollution and the UK RI and Met Office Clean Air Champion. Stephen will explain how this is exacerbating health inequalities with the poorest and most vulnerable, often living or working in the most polluted environments. So we've got a recorded session from Stephen, so hopefully that will come on the screen now.
My name is Stephen Holgate, and I'm going to talk about air pollution and human health. Everyone has a right to breathe clean air. Indeed, they have as much right to breathe clean air as they do to drink clean water. And this was clearly recognised back in 2018 when air pollution was suddenly appreciated to be causing as much damage to human health as passive and active cigarette smoking, as can be seen in this pie chart. And the World Health Organization is now pushing ahead with trying to clean up the air by setting guidelines that I'll be talking about a little later on. So what are we talking about here? We're talking about gaseous pollutants, but in particular, particulate pollutants, really small particles, less than 10 or less than 2.5 micrometer in mass median diameter. And these microparticles, when breathed in, enter the lung, pass through the lung into the circulation, where they can cause damage to multiple organs. In the bottom right-hand side of this picture, you can also see that the particles can exist in even smaller sizes called ultrafine particles, or P0.1. and these largely behave like a gas. The important thing about these air pollution particles is that on their surface, they can contain a variety of chemical substances, metal oxides, semi-volatile chemicals, and all sorts of other materials that can be picked up from the atmosphere before they're breathed in. So these are the particles that cause the damage to human health. And this was clearly recognized by the European Commission back in 2021, because obviously it's these particles that are beginning to shorten the lives of European citizens by accelerating the progress of non-communicable diseases. And in this bar, you can see that the declaration here that air pollutant particles causes millions of premature deaths across the world, as is the current situation. But it's not just any old particle that does this. As we can see in this slide, it is particles derived from fossil fuels in particular that are the real problem. And these are the highly toxic particles that we largely get from our urban environments from the burning of fossil fuels, largely by the internal combustion engine. They're not the only pollutant particles, of course. Forest fires and other toxic particles emitted from industry can cause quite a lot of damage as well. But most of the attention now is being focused on fossil fuel related particulate and gaseous pollutants. Now, if we look at the actual epidemiology that links air pollution to adverse health, we can see that in these very large studies involving multiple millions of people, this being one conducted in the Medicare population in the US, that the all-cause mortality reflected on the vertical axis as hazard ratio, here for PM2.5 and for ozone, the line passes through 1. This is a logarithmic scale. Therefore, this means that if it was a linear scale, the line would pass through 0. That basically means there is no safe level of air pollution at whatever level is generated in the atmosphere. So this really is one of the most important things we've now got to come to terms with. There is no level of air pollution that is safe. Moreover, as seen in this and many other studies now, most of the people who suffer the effects of air pollution the worst are those that are living in racial minorities, the underprivileged, and those that are living in poor parts of our communities. And they, of course, have other health risks that are driving non-communicable diseases as well. And air pollution just feeds in to all of those, accelerating the progress of their disease. And by their disease, I mean diseases in multiple organs, as shown in this diagram. When the air pollutants penetrate the lung and get into the circulation, they go to every organ of the body. And here they accelerate the aging process, whether it's the brain, the lung, the heart, or any other organ. And that's why the non-communicable diseases are accelerated when exposed to air pollutants at the levels I've just spoken about. And a terrible example of the effect of air pollution in human health came with the announcement last December that air pollution was a major contributory factor for the death of a 9-year-old child shown in this picture, Ella Kissy Deborah. And indeed, the coroner of the South London Coroner's Court at that time thought that this was such a serious situation that the air she was breathing in that part of London was obviously affecting her asthma very severely, and that this would obviously have implications for other people and other cases. So the WHO have now looked at all the new epidemiology that's available, and as a result of this have even reduced the threshold at which we should be acting for air pollutants. And in this table, you can see for PM2.5 on the left and NO2 that were previously set in 2005 at 10 micrograms per meter cubed and 40 micrograms per meter cubed respectively, have been lowered further to 5 and 10. Here in the United Kingdom, we actually are operating at a level of PM2.5 of 20 micrograms per meter cubed. So what's being recommended now is a reduction down to 5, which is obviously far, far lower than we're currently being exposed to as a population. And of course, when I say exposure, I mean exposure across the life course. On the left-hand side, you can see a diagram of a 24-hour recording of particulate exposure of an individual. And you can see that at different times during the day, the individual is exposed to different levels of pollutants and indeed to different mixtures of pollutants. This, of course, takes place not only outside, where we've got the internal combustion engine contributing to the pollutants, but also indoors. And here again, the inequality issue starts to come to the surface with poor housing and having housing close to roads and close to the areas where there are outdoor air pollutants, as well as poorly constructed buildings which are overcrowded, all leads to increased exposure. And in this middle diagram, you can see in a particular property here, a single house, we're looking at the nitrogen dioxide outside, which is in brown, and inside, which is in grey. And you can see there's a reasonable reflection of the outdoor air pollution inside. This is quite important because this is telling us that inside our own homes, our offices, the transport we move around in, we are being exposed to outdoor air pollution all the time. And this, of course, in an indoor space gets mixed with the indoor pollutants that are being emitted from the chemicals we are using in these environments. And of course, it's everybody that is affected by this, particularly young children whose organs are still developing. And indeed, air pollutants have now been shown to influence the development of organs in the developing baby in pregnant women. So it's very important that we now try and get to grips with this and realize that air pollution needs to be controlled and controlled properly. And one of the great things about all of this is that some of the targets now being set at COP26 for improving our carbon limits are the same targets which obviously are contributing to air pollution. The important thing about the health effects, however, is that the air pollution reduction would give immediate effects if the pollutants were reduced. So therefore, reducing some of the particulate and the gaseous pollutants contributing to the climate change issues we're all talking about at present would have a huge benefit on human health by cleaning up the air in parallel. But what we don't want to do is to have climate change targets that are going in the opposite direction to cleaning up the air. And one example of this would be sealing our homes, not allowing the indoor pollutants to escape outside and not having adequate ventilation of our homes. So if we really now start appreciating the importance of air pollution on human health, people will change their behavior, but they'll only do this if they see the behavior is easy, rewarding, empowering, and normal. The COP26 meeting is obviously shining a light on what we now need to do to help our Earth recover from the damage that we've all done to it over the many centuries of burning fossil fuels. And obviously cleaning up the air is one of those great steps that we can take that will make all the difference. Thank you very much. My name is Stephen Holgate, and I'm going to talk about air pollution and human health.
Contribution, actually, I'm sure we could all have listened to that twice, actually. It was so interesting, but also so harrowing. So inequality is really at the heart of all of this. Climate change directly causing physical illness. I would make a prediction that there is no illness, mental or physical, that won't be significantly affected by climate change. The evidence is emerging all the time. And no safe level of air pollution. That message is really very clear. So thank you, Stephen, for that. Let's move to our next speaker here now with us. Absolutely delighted to introduce Lisa Page. Lisa is a liaison psychiatrist and senior lecturer in medical education and psychiatry. She's also our college's Associate Registrar for Sustainability, as well as the co-chair of the RC Psych Planetary Health and Sustainability Committee. Lisa, over to you, and thank you for all you've done for the college. Really tremendously grateful to you.
Thank you, Adrian. That's a very kind introduction. I'm actually going to stand because I need to have a little look at my slides over the shoulder. I'm not sure all of you can see them, so apologies if you can't see them very well, and I'm probably now in the way as well. So. Okay, so I'm going to talk about so next slide, please. I'm going to talk about the mental health implications of climate change. We have been hearing about the physical health implications quite a bit. Well, I personally have here at COP, which is really great to hear. And I'm going to try and open your eyes a little bit to the mental health implications. Now, you may think that, or I think many people think about eco-distress, eco-anxiety, and think that is what we're talking about. And actually, it's not really what I'm talking about. I will touch on it at the end, but really I'm going to talk about much wider impacts on mental health that I think need to be recognised and talked about. And we can think of these in through two routes, the direct impacts and the indirect impacts. And I'll take these in turn. So next slide, please. So when we think about the direct impacts on mental health, we're talking a lot about how extreme weather events, such as, let's say, storms, so hurricanes, cyclones, extreme events that happen and then have really very significant impacts on mental health. And we know that. We've got good quality evidence from across the world that reflects that. We've already been hearing about air pollution and its impacts across the life course, and that includes on mental disorders, neurodevelopmental and other disorders, and the evidence there is definitely accruing and strengthening all the time. We've also got to think about things like droughts, which perhaps there's less evidence for, less research done on, but we know that 19% of the land mass of the world was affected by drought in 2020, so it's a growing problem, and increasing evidence around how that impacts on people's well-being and also actually can precipitate mental disorder. And we've got wildfires. Lots about that in the news, and lots of evidence about how devastating that is for people particularly when they're directly affected by it and lose their homes. But I'm going to talk a little bit more about floods and heat, because that's probably where most of the evidence, well, the strongest evidence certainly in the UK and Europe is. Floods, we know there's going to be more of them. They're going to be more, and they're going to be more of them, they're going to be worse, okay? And good evidence from around the world, but especially perhaps from the UK, around the impacts that has on people's mental health. So a recent systematic review that was published a couple of years ago, or last year, showed that around, if you're flooded, then around 30% of people will develop PTSD, and probably around 20% of people will develop either depression or anxiety, and that's much higher than baseline levels, obviously. And worryingly, many of those problems persist over time, so it's not just a short-lived effect. We see chronic impacts of that. I'm going to move on to heat and unpack that a little bit more. So can I have the next slide, please? So I think it's well recognised that heat has negative impacts on health when that heat goes above a certain threshold. And those thresholds will vary depending on where in the world you are. Now this slide, again, it's another UK slide. So this is data that comes from the Office for National Statistics, and it's looking at data from summer 2020. And what it's showing, and you probably, apologies to those in the audience, you probably can't see this very well, you need to be a little bit nearer probably, is that it's tracking what was happening to temperatures across the summer, and that's shown in the amber and brown lines. And what the grey boxes are showing, the shaded areas, that is showing where there are heatwave events. So in 2020, there were 3 discrete heatwave events across the summer, as defined by the Met Office. And what you see is that all-cause mortality goes up in those heatwave periods, and that is true when you this is, in other words, there is excess mortality during those heatwave events. And ONS calculated that there were over 2,500 excess deaths in summer 2020 just in England. Okay. And that's mostly in the over 65s. But actually also we know from other evidence that it's not just the frail elderly, it is also people with major mental illness, so examples being dementia, severe and enduring illnesses like psychosis, and people with substance misuse problems. So it particularly affects people, the sorts of people that we see in our services in psychiatry and mental health services. So that's kind of all-cause mortality. Next slide, please. But actually, the evidence goes further than that. So there is now good systematic review evidence of increase in suicide when you see above a certain temperature threshold. Now those thresholds will vary where you are in the world, but this data is coming from across the world. So we've got evidence from low and middle income countries as well as higher income countries such as Australia, the UK and North America. And one study which was published in Nature Climate Change a couple of years ago, data from 2018, estimated that if we did nothing and if we didn't manage to make any to mitigate climate change at all from our current trajectory, then they predicted that there would be an additional, I'm going to want to get the number right here, 22,000 excess suicides in United States of America and Mexico between 2018 and 2050. So that's a very, very significant number. So, which brings it into the ballpark of other social drivers of suicide, such as unemployment. So, yes, the effect is small, but across large populations it's significant, and that's what we need to remember here. So suicide, we know also there's emerging data that we get increased visits to emergency departments for mental health reasons and increased admissions to mental health facilities during periods of hot weather. And again, that comes from across the world. And I've already spoken about the increased mortality. But actually, so that's kind of stuff that we might think about as psychiatrists. But actually, if you look at general population, there's also evidence that it impacts negatively on emotional well-being. So emotional well-being reduces during times of unaccustomed hot weather. There's increases in negative emotion, and that's something that Lancet Countdown, for example, is now tracking is one of its indicators. So that's an overview of heat, very briefly. Can I have the next slide, please? We're now going to move on to the indirect effects, which I think actually are probably more significant, although less easy to measure in mental health terms and perhaps less easy to bring together and present to you in a coherent in a coherent way. But actually, I think it would occur to all of you if we think about the sorts of changes that we're seeing in our world, why they're going to impact negatively on mental health outcomes. So land use change, when people are no longer able to live on land that they've lived on for generations and perhaps their families lived on, and they're having to change how they support themselves and their families. That leads to that leads to mental health problems for people. Migration is a big topic, and there's lots written about it in relation to climate change. And I suppose just to sort of say that from a mental health point of view, forced migration, particularly migration that might involve unexpected migration or migration after conflict, really has very significant and very serious effects on mental health, and those effects can be to the degree of leading to higher incidence of psychosis, for example, in migrated populations. Additionally, we know that urbanicity is also linked to increases in psychosis. So these are very significant mental health changes. It's not just short-term and transient. We've also got changing patterns of infectious disease, which are linked. So changes to malaria patterns, dengue patterns, all will impact on mental health, not only for those affected, but for the health services and for the people around those that get infectious disease. And we've recently had pretty dire predictions about increases in conflict as a result of climate change, and probably can't think of any other human activity that leads to more mental disorder than conflict. So I think that speaks for itself. And finally, we get to sort of eco-distress and eco-anxiety, and hopefully I've sort of shown you why I've left it to the end, because actually there's a lot more to say about the mental health impacts of climate change than just eco-distress and eco-anxiety, upsetting though they are to experience, and I might say as sane as they are to experience. So can I have the next slide, please? So quickly going to just talk about a few mental health solutions. I think actually Rosie's talked about these in much more eloquently, so I won't say too much, but just from a sort of psychiatrist, mental health services point of view. Next point, please. So yeah, we can advocate as mental health workers, we can talk about this stuff. I think we can talk with confidence about what we do know about mental disorder, what we know about the solutions as well in terms of treatment. We would like to see a much greater emphasis on prevention of mental disorder across the board. And of course, one way of preventing the sorts of mental health problems I've been discussing would be if we could mitigate climate change effectively. Co-production, something we're very keen on, so involving the people that actually use our services in the design of those services makes for better services and leaner services. We would like to see a low carbon healthcare, and we've got a part to play in that in psychiatry just as much as any other part of medicine. We would like to see more social prescribing as an adjunct and an add-on to the sorts of treatments that we already have, and we would like to see that much more available for our patients. And we would also like to see a greater emphasis on nature-based interventions, so building the evidence for that and actually being able to deploy those interventions where necessary and where appropriate. Okay, next slide, please. That is my last slide, so I'm going to come to an end, and I'm going to say thank you very much for listening, and I'm going to hand back to Adrian.
Great. Well, thanks so much, Lisa. A real sort of whistle-stop tour, really, of everything to do with mental health and climate change. So I was totting them up as you were going along: anxiety, depression, PTSD, suicide, psychosis, and the important influence of forced migration and conflict in relation to mental disorder. So this is a real mental health issue. So thank you, Lisa. I'm sure we'll come back to those later on. So now I'm very much hoping that we can go over to Lynn Jones. Lynn is a child and adolescent psychiatrist and whose work has taken her to Haiti, Bangladesh and the Philippines. And we're hoping we're going to go live now to a refugee camp in Bosnia where Lynn is currently working. So I know Lynn has been on the line earlier on, so I hope that she's there with us. So Lynn, over to you. Well, that's absolutely fantastic, Lynn. I don't know how much you can see of us. We can now see you.
I can see you, all three of you, and I hope you can see my screen. Can you see my screen?
We can, so thank you so much for joining us.
You don't need to see me. And to be clear, I'm not actually in a refugee camp. I'm in a very nice UNICEF office who have very kindly given me a space to do the recording. And I'm working in the Mother and Child Family Centre for the amazing welcome that Bosnians are giving to refugees on the borders. I'll come to that in a minute, because actually, I hope what I'm going to say will amplify the wonderful speeches we've had earlier. I've spent most of my professional life establishing mental health programs in places like this. It's a refugee camp on the Somali border. And I thought some of my specific clinical experiences would help you understand the mental health dimensions of being a refugee or being displaced. It might also be a way of looking into our own possible futures, and I'm already having the glitch I feared. I'm sorry, the slides, for reasons I don't, it's advancing, good. I'm sure this audience does not need reminding that for millions of people, climate change is not a future threat, but a current catastrophe. I think that's been brought home. UNHCR says this is the defining crisis of our time. Climate fuel disasters were the #1 driver of internal displacement in the last decade. I should, by the way, say that I don't like the word climate change. I think it's totally inadequate. These disasters are the result of climate breakdown and ecological collapse, and I prefer the term planetary crisis to encompass both. So, as our previous speaker said, we can expect more of this. It's already driving millions from home. Last year, for example, 2020, even though most of us were locked down, Central America suffered the worst Atlantic hurricane season ever recorded, which displaced more than 500,000. And thank you, Adrian, and thank you, the Royal College of Psychiatrists, for the wonderful position statement. I was proud to be a little, one of the readers and text workers, and a lot of the things on this list have already been covered by previous speakers. So I want to just concentrate on two that I thought I would bring to life through clinical experience. Let's start with food insecurity, because unlike when I was a medical student, I used to get these graphs saying, oh yes, world hunger is decreasing. But in the last few years, world hunger has been steadily increasing, and it's going to get worse. It's already dreadful in Madagascar and has been for the last 4 years, and that is a climate-induced famine. So this is brought home to me in a very powerful way when I worked in Chad with the Darfur crisis. But before I talk in specifically about this case, let me give you a quick reminder, those of you who aren't medics or doctors, I don't know who's listening, but the developing brain needs adequate nutrition, maternal love, play and stimulation. And if any of these are absent, there's likely to be lifelong damage and an enormous loss of human potential. And when I arrived at this refugee camp in Chad, and let's be clear, this was also a climate-exacerbated conflict, and it's still going on to this day, and 3 million people have been displaced and more than 500,000 killed. I met this extraordinary woman, Tabitha. I say extraordinary because she was really struggling, but she was surviving. She was confused. She was very depressed. And she was brought to me, and her baby was brought separately because she had basically abandoned her baby. She told me because the baby was dying and there was nothing she could do. So I managed to persuade both of them to get in our vehicle, and we took them to the therapeutic feeding center, which was really good at doing what therapeutic feeding centers did in those days, which was put, the right nutrients in the baby. What they didn't do so much of was any of the other stuff that we now know babies' brains need. And what struck me, and we were all really learning about this problem then, was the silence. The mothers had their babies in their arms, but they weren't playing with them, they weren't talking to them, they were low in mood, and there was no stimulation. Now, this led me into a kind of programming that I'm continuing to this day and doing in the mother and baby corner here in Bosnia, which is play and stimulation along with education on nutrition where it's needed. But this isn't the solution. We're going to have much worse problems than I saw in Chad if we don't address the drought and hunger that is being created right now by climate change. And let me come to the other thing. Anybody who's read anything I've written says, I know that PTSD and traumatic stress and acute stress problems are a major issue after conflict. I have witnessed them. And you've had the statistics in the previous talk. But what doesn't get talked about as a direct effect of conflict and disaster is grief and loss. It is the most important mental health effect. It's not a disorder. This little boy in this picture lost both his parents in Hurricane Haiyan because they couldn't swim and he could. And this was just one of a series of catastrophic hurricanes that's increased in frequency. He feels so strongly connected to them, he comes down to the grave every day to clean it. And you can see the destroyed school, destroyed community in the background. The pain caused by these kind of losses is completely normal. But recovery from grief comes from being able to properly mourn and properly get proper support from a surrounding community. The problem is, how do you mourn if you can't hold a funeral because your house has been destroyed? Or all the neighbors are also mourning because they feel they can't come round because they're dealing with their own grief, so you don't have that community connection. And what if there's no body because it was lost at sea, or buried in a mass grave, or abandoned in flight? These are the problems of grief and loss that I don't see discussed, but I can assure you are major issues. As are the losses that occur even when no one dies. And this is a kind of cumulative list I make in every disaster I work in, but the core elements remain the same. People tell you not that people have died, but they've lost their family, friends. Landscape is a big issue. Food is a big issue. But these internal losses of connection, security, identity, feeling in control, the future, and dignity, they are profound. And I think what this child said to me in Greece in 2016 sums up the indignity of the migrant crisis. The dog lives in a home. How come we live in tents? But I want to talk about two things I just see not really being discussed. And they're not mental disorders. They're not in ICD-11, DSM-5, as far as I know, although denial is something that we all understand since Freud. But to me, they are mental health issues, and they are going to kill us. Now, I'm not talking about denying that there's a planetary crisis. I think that reality is beginning to creep through. Rather, it's denial of the fundamental changes that are required to address in our way of life if we're going to address that crisis. It might explain why the first draft, as I understand, of COP26 decision text fails to mention fossil fuels, and why we have warnings of apocalyptic collapse. I'm glad to hear them if we don't change our ways. But at the same time, we're getting subsidies for short-haul flights. And by the way, as this little graph, which you can get from The Guardian, helpfully illustrates, flying from Rome to the UK emits more carbon dioxide than my Ethiopian mother-in-law emits in 1 year. If we carry on as we are, she is the one who is going to be forced to leave her home. And that's the other problem I want to bring up. Another mental health issue, which actually our previous speaker, I'm so glad she talked about violence and heat. But even without heat, we have a growing loss of empathy, a growing hostility to others. As Adrian said, right now I'm working with young children in Bosnia who have spent most of their lives on the move, 3, 4, 5 years, fleeing a conflict absolutely not of their making. They are on the borders of one of the richest parts of the world, the European Union, yet this is what they face. Migrants are not coming to steal from us. We are the thieves. First, we stole people and resources to build our industrialized economies, and now we steal life itself by exporting pollution and waste. I'm going to end with this amazing quote from the wonderful Somali-born poet, Wasim Shire. You have to understand, no one puts their children in a boat unless the water is safer than the land. If we continue on our current course, the land will be unsafe for us all. Thank you very much.
Well, Lynn, thank you so much for that really powerful talk and those very powerful messages, and putting really the food insecurity, hunger, drought and poverty right at the centre of all of this. And those who are the least powerful in all of this are the people who, unfortunately, are the people who actually pay the biggest price in relation to climate change. So we're now going to move on to some questions, and we've got some questions that were prepared in advance. And we've obviously got the three of our speakers who will be able to take part in that. So the first question that we've had from Maria Elena Campos Ingram to all our speakers is, what is the one takeaway message from today's meeting, this meeting, and what would be your one call to action that people actually in the audience here or listening at home or later on, that they can take into their day-to-day lives, both their personal lives but also their healthcare lives as well? So one takeaway message and one action that you think. I don't know, Rosie, do you want to start?
Okay, so I think the most important takeaway message, I mean, the harrowing stories that we've been hearing, it's very overwhelming, isn't it, to kind of take that on and realise just how serious the crisis we're in is now is the time to act. Now is the time to use your voice. Now you need to go out and talk about this issue with the people that maybe you're not in a position to be able to be powerful about the decisions you make, but you can influence people who are powerful and you can take this message to them. And as a clinician, you should be thinking about who in your hospital trust, who can be doing that in your hospitals anywhere around the world. What is their plan and how are they adapting to this reality? Because this isn't going to go away, and we need to be thinking about that and taking that message to them and trying to both mitigate and adapt to low carbon resilient healthcare systems for the future so that we can live in a world where children have a future.
Okay, thanks. Lisa.
So I think it's a question that hopefully everyone's thinking about, having heard the presentations, and it's probably for you to take a view yourselves. But I would agree, I think, with Rosie about talking about this and feeling that you can talk about this in different parts of your life. So it's not just about what you might talk about with a like-minded friend, but you're able to just start joining the dots for people in your life who maybe don't otherwise see that. And that can be at work if you're a health professional. If you are a health professional, then yes, you've got individual actions you can take. You're a clinician, so think about carbon hotspots in your own services and what you can do about that. But also you're somewhat of a leader, and you're a very trusted leader being a health professional. So use that voice. If you're in research, think about whether you can do research that is useful for what we need to know for the future to manage to adapt, if we can manage to adapt, as well as to the problems that we've seen. And don't forget to, to get political about it, I think. So where, who can you pressurize? Who's in your world that you can pressurize? Who can you write to? Who can you contact? Who can you email? Who can you phone? And I think everyone needs to think for themselves who's in their orbit that they can contact and advocate in this about these issues.
Thanks, Lisa. And Lynn.
I agree with both the previous speakers, and particularly, I'm sorry, it may be uncomfortable for some, get political. By that, I mean quite simply, whoever and wherever your political representative it is, find them, talk to them, write to them. If you're a health professional, you get listened to, and give them a health message. And the key health message I would like you to get across is that fossil fuels are a pollutant. The BBC had Arnold Schwarzenegger talking movingly about how he actually got California to declare that greenhouse gases were pollution. We've had that wonderful talk on air pollution. When I gave a talk in Belize on how air pollution is killing us and fossil fuels and diesel, which everybody is using, produces air pollution, it really cut through. And I think that's the message we can take. We can't go on digging this stuff out of the ground, not just, it's killing us. And that's the message I hope you'll get across. Thank you.
Okay, for our next question, Lynn, I'm going to come straight back to you, so if you can stay on. So, and this is from Annie Mitchell, clinical and community psychologist with Extinction Rebellion Psychologists. So where and how do you think that healthcare professionals and other experts and citizens can best come together to make change happen? And what is our shared vision of success? I think we've touched a little bit on this, but how can we all come together and bring about the biggest change?
Oh, we do need to come together. And hello, Annie, and I'm in Extinction Rebellion, Doctors for Extinction Rebellion as well. And I hope as many people as possible will take action. I think, first of all, come together within whatever community you work in. If you're in a hospital, get the hospital together. I was very happy that my own trust had a day on sustainability a few years back now. We got wonderful college people who are sustainability down. Get together in groups where you feel comfortable. You may not want to be on the streets, but you can give a talk. Get a group together. And when you've got groups together, we need to get the groups together, as it were, and connect with one another. So it doesn't need to just be the activists on the street. I'm really glad that there's Psych Declares that connects with the college. We need to build, and it's easy with social media. I'm sitting here in Bosnia. We need to really connect these networks and then send powerful joint messages to our politicians. I think there is no substitute for a loud political voice and asking for meetings at a higher level. I mean, there are lots of lobbyists from fossil fuel here. I'm so glad the college is here and the health professionals are here talking jointly about the message. I'm not on the ground, but I would be networking like mad if I was saying, how can we continue this? How can we get together all these different groups? And let's have a big conference globally. It can be on Zoom, on how health professionals pull together on the climate planetary crisis and tackle our respective political leaderships. Let's do it.
Okay, let's do it indeed. Well, I'll put that on my list to go away and sort out. Lisa, what's on your list? Where do you, how do you think we can come together and bring about change?
I think it's about working in networks, isn't it? Which we're seeing happen, and whatever your professional body is, what are they doing, and beyond that, what networks are they working with, and if they aren't, then why aren't they? And up and up and up, and I think that's the only way to go. And it's certainly seemed to me here that the United Health voice is quite powerful, and I think will increasingly get listened to and if we can, if it's seen as a coherent voice asking for the same things, then I think there's no doubt it will get listened to.
Okay, great. Rosie.
Well, I don't think I've got much to add from what the other speakers have said, apart from what I think a measure of success would be, which is I think we can measure success when health is central to everything we're doing. And at the moment, it isn't, the irony is not lost on me that we are sitting across from Saudi Arabia's pavilion, and, health is not central to these discussions at COP. Health is a peripheral issue, and when health becomes a central issue to the way that we are thinking about the future, then we are meeting success. Children's future at the moment is not at the centre of this. Money is at the centre of this, and the capitalist system is at the centre of this, and we are not thinking about the human cost, and our inaction is going to be paid in children's lives, and that's really, really fundamentally not acceptable to me or to any paediatrician I know. So let's get up and let's make change and make health voice powerfully heard.
So for those of you who are not here, and we're on the World Health Organization stand, and there are hundreds and hundreds, probably thousands of stands, and this is a tiny little stand. I expected the World Health Organization to have a huge stand, and somebody said to me at the beginning that they thought that the size of your stand was inversely proportional to your actual commitment to doing something about it. But anyway, I don't think there's any science around that, but actually I think they do have a point. Let's move on to a different question, and it's from Catherine. Do you think there could be value in school leavers participating in planetary health service before entering into further education or employment? I think Rosie's got to come to you first.
Well, I certainly think that there could be value in empowering young people to find a way of taking action to deal with some of the problems that we're facing. One of the things that I feel a lot of people are angry about, and I often teach undergraduate medical students, and one of the things I've noticed is that often they're quite despondent and they're quite angry and they don't feel that people are taking action. So I think finding a way that people could contribute meaningfully is a really empowering way of helping them to see solutions to some of the issues that we're facing. I'm not really into mandating that to anybody, so I think that would be an optional thing for people to think about, but I certainly think that there would be a value in action, because one of the things that we feel so powerless about is that this is something way beyond our ability to influence, and it's happening to us.
Okay, great. Thanks, Lisa.
Yes, it's not a suggestion I've heard before. I think we do know that for many young people there's a lot of fear and a lot of anxiety, and to some young people living in developed contexts, there's some guilt as well. And you know, we know that taking positive steps, taking action, even small actions, can be really helpful for helping manage those sorts of difficult emotions. I suppose I'd be reluctant to put more emphasis on action that young people need to take when it's older people in power who really need to take the action. So I suppose that would be my only sort of pushback on it.
So you think it's people like me at the end of their career who we should be taking a year out and getting more active? Maybe that should be. We'll take that one back as well. Lynn, what do you think?
Well, it offers an opportunity for nature connectedness and planetary connectedness. And I don't know about mandating, but I think the opportunity and providing the opportunity to do planetary service, whether it's for an older generation or a younger generation like BSO, but with a nature saving the planet focus, would be amazing. And I think many young people who don't have the means or finances to do that sort of thing would love to be given the opportunity. I'm involved in nature connectedness projects, both in schools in the UK, but also with refugee children. And I see the brilliant things you can do if you just get people out into nature. It's not a new idea, it's not mine. So if this is another way of actually enhancing that side of it, I'm all for it, as well as the fact that the more of us who can take care of the world we live in, the better.
Okay, now to our very last question, and it's from Stuart. How can we make healthcare delivery much more communal and inclusive rather than so focused on treating the individual? Make health of the person and the planet a real collective priority. And Lynn, I'm going to come to you first.
Well, in a sense, it's what I'm trying. I so agree. I mean, I've got much more involved in trying to do preventive, nature connected. I'm working two things here. One is a camera workshop with children, and one of the things I've done in the UK is nature photography where we get children to go out and focus and take pictures of things they love and then talk about them. And that, it's not my original idea, that connects them more deeply to the environment and they feel much better and their mental health improves. And I wish we could do, that's a tiny drop in the ocean. The more forest schools, the more collective, socially engaging, nature connected work we could do, the better it will be for our health, the planet's health. And I think it's good for every age group. And I think the evidence is beginning to be there. So take a preventive focus, take a nature focus, take a socially and nature connected focus as well. And let's shift away from individualized medicine. And obviously we can't, but let's put that in and let's mandate it and let's make it part of a doctor's training agenda.
Okay, so yeah, let's get it on the curriculum. We're certainly doing that at the college in relation to the college curriculum. So Lisa.
Yes, so thumbs up to nature, I think. That sounds a good idea. I think the only other thing I'd say is going back to that point about using the voice and experiences of people who use your services to help develop them. I think that can help in that direction that Stuart's asking about.
Rosie.
Yeah, I really think that making sure that whatever services we're designing have the voice of the users involved in, and that can be quite difficult when you're designing services when you're looking at sort of neonatal services, because obviously the people can't speak. But what we do know is that if you design services which do have nature in them, that has multiple benefits, and almost all neonatologists, I don't know how many are watching this, will definitely realise that we so often have neonatal units which have no green space surrounding them. Even if it's outside the window, there's no access for parents to be able to go into a green space and just connect to nature. And for months they are inside these neonatal units, completely removed from anything natural, and that has psychological effects which affect their ability to bond with the children. So I think we need to make sure that services are both working within the communities that they're being built, but also work with the natural systems that we have in place.
Okay, that's great. Well, we've come to the end of our session. I'm just going to turn to each of our speakers. First of all, say thank you to all of you for your contributions and, more importantly, the work that you're doing. But just one final point that each of you want to make to our audience. So, Lynn, what's the last point that you really want to get across? I think, Lynn, we can't hear you.
Me?
Yeah, we can now. We can, yep, with a...
It's not hopeless. And there's nothing more empowering than like being at a meeting like this, getting feedback from you, hearing my colleagues speak, feeling I'm part of a network of people who care about the things I care about and want to act. And collectively, there's nothing we can't achieve. They may not be getting it right in COP. We can make them get it right. We've still got time. Don't let's be tricked or duped. Let's deal with this planetary crisis denial disorder that I've invented, and let's get the truth out there and let's show them what's needed, and let's do it together. Thanks very much.
Thanks so much, Lynn. Lisa.
I think just let's all keep working in this space. Let's all keep doing what we can do. That will vary for each of us, so we're all coming at it from different angles, different backgrounds, different professions, different groupings. But keep working and keep going, and if you need to pause because it's getting too overwhelming, do that, but then come back and keep going, and you know, and it's not an option to stop. I don't think. You just have to keep at it.
Great. Finally, Rosie.
Just that there are huge co-benefits here, that we have the ability to make healthy futures which are also low carbon, and those two things don't need to be mutually exclusive. So combining those things and working together, and I'm really pleased to be, you know, with other members of other colleges here, because it is, you're not alone. You've got a whole group of people around you who care about this issue, and actually that's really powerful. All the thousands of people are here. We can make a difference, and don't be disheartened.
Great. Well, a bit of optimism there to finish on. So thank you so much to our speakers. Thank you so much to you, the audience, for coming, those watching at home or later on. Thank you to those who've asked questions. Most importantly, thanks for all that you're doing in this area. I think what I've heard is that we need to really stick together on this. I think there is a growing community that is demanding change, and we are a very powerful group, and we've got to make sure we get those messages out there. So thank you so much, and safe journey back to wherever you're going. Thank you.
weather's been very good. I only one day with a little rain. That's it. It's been very nice here, but and a lot of interesting things and meeting people. You know, a lot of it is after the session's over, talking to people, and that's what we miss when we do it things virtually. But you know, there's pluses and minuses of both. Anyway, all right, I'm going to log off here somehow. Stop video. Okay, bye.
I managed to put the background. I managed to put the background, but it's in reverse according to my. Is that for you guys as well? I mean, it doesn't matter, I guess. But.
I think the moment somebody talks, then you see the person, no?
Recording stopped.
I think I see this big slide and then John, but not no one of the others. Perhaps because I made my screen a bit smaller.
Gara's probably right. It's probably voice activated. So does that work? Can you see me now? I don't know. Who knows?
Yeah, but when I talk, do you see me?
Yeah, I can see you. I can see you now when you're talking.
Okay.
Yeah. We just can't see each other. We can't see ourselves.
Yeah. That's why Alberto said that there's no need to turn our camera off because it automatically does it.
Yeah.
Yeah. Also, the vision that we have on the panel is different to the other participants. Actually, we are already with above 40 participants joining. So maybe it's if we can connect with Jennifer. Yes, so we are online. We're just waiting for the connection with the main room.
Testing. This is Matthew. Hello. Calling the virtual participants.
Matthew, we can hear you. It's John Wright here.
Hi, John.
Hi, Matthew.
Hi,
we can't see you, but we can hear you.
Yeah, Matthew, you sound very well, I must say.
You can't see the raddled, exhausted state that is me. Are we on video or is it just sound?
Oh, I lost you. Mine go off?
I think you also should be on video, no?
Okay. I don't know. Are you there?
Yes, we can see the pavilion, so
Okay.
maybe we can actually start.
Okay.
Is George there to start?
We're working, but now they're not. Oh, channel. Maybe I'm on the wrong channel. Wait a minute. Channel 0. There it is. Sorry, I bumped it, I guess. Yeah.
Okay, ready to go live when you folks are. Thanks.
Okay, so now it's working.
George, organize people there. Let's get going.
Yeah, well, people are trickling in. I don't know,
You need to sit down, George. We don't see you.
Oh, really? Oh, yeah. So, okay. So I have to.
We see Matthew very well, and George next to him, sitting there.
Oh, okay. Yeah, that's good. I didn't know that. I don't see what. Yeah, I don't see what you say. Okay. That's good. All right. Good to know. Maybe let me see if I can. Oops, did I turn this off? If I can wear the mask or not.
No, don't worry about the mask.
Don't wear it, is the thing? I don't know, it sends a bad signal. What if I move over a seat? Is that?
But no, we don't see you. At the moment, the camera is on to you.
Just
okay.
on the two of us?
Yeah.
Oh, okay. Oop, did I just bump it again? I keep bumping this.
Yeah.
All right. All right.
Let's get going.
Is the time? No, it's 6:17. We start at 6:30.
6:15.
No.
17? Okay.
Yes.
All right. So we're online now?
Yep.
Okay. Welcome to everyone here and online. My name is George Thurston. I'm a professor of environmental medicine at the New York University School of Medicine. And, you know, here at COP26, there is a lot of excitement about new ambitions that people are announcing. And so there's excitement, but there's also concern. And the concern is the how, right? I think people agree that how are we going to do these and make these ambitions happen? And that's what this session is about. You know, it's been said that while the climate crisis is the greatest environmental threat of the 21st century, that climate action to deal with it is the greatest public health opportunity of the 21st century. If we do it right, we can get lots of health benefits. And so that's what we're going to be talking about here, how cities where I've heard like 40% of the climate emissions are from the built environment, for example, and that's mostly in the city, right? So cities have a big role to play. And so today, Dr. John Wright will be the moderator of this discussion of how do we move forward? How do we make ambition into reality? John?
Thank you, George. So we're hurtling towards the cliff edge of the agreement for COP26, and everybody's nervous but excited. And as always with conferences, the organizers have saved the best till the end. And this panel, we've got a great selection of panelists and speakers for you. So tempting that I gather Barack Obama flew in just a couple of days ago to join us. My name is John Wright. I'm an epidemiologist and a doctor. And my research over the last 20 years has really converted me to the view that our cities are more important for our health than our hospitals. And what is good for human health is good for planetary health. And I'm joined by some leading experts in the field who are going to share their wisdom and expertise. We're going to have conversations. We've got an opportunity to do some Q&As. So if you want to add some Q&As, and do just click and ask who you want to ask the question to. The session is being recorded, and everything's muted, I think. Is that right? Oh yes, for technical reasons, microphones are deactivated and the chat is deactivated. So raised hands will not be attended. So Q&As, please, if you want to ask a question. And if we have time, we'll come to those at the end. But I'm going to move swiftly on to our first panelist, the famous Mark Nieuwenhuysen, world famous epidemiologist and professor at the IS Global Health Institute in Barcelona. Good evening, Mark.
Hello, good evening, John. How are you doing?
So tell me, Mark, this is all about cities. So before we move on to the health consequences of cities, why are we focusing on cities rather than, say, towns and villages?
I think, towns and villages are to some extent also important, but most of the people nowadays actually live in cities and they're actually growing. Cities are a big attraction for people to be there because of jobs and cultural events, etc. And that's why we're talking about cities, because they can take a very important role in climate action.
Okay, so let's start with health then. So this is your field. Why do cities harm our health?
Well, first of all, I mean, cities are also pretty good. People love to live in cities. We have access to healthcare. We have jobs. I mean, very important. But there are some aspects that are not as good. I mean, first of all, cities are characterized by its density. People are much closer together. I mean, cities, I think, in general, take up about 3-4% of the planet's space. They're very dense. People on top of each other, and that also. Because we need to get around, generates a lot of mobility, and unfortunately, a lot of the mobility is motorized private traffic. And that's what we see in many cities happen. And even if it's often not the primary mode of transport, cars seem to be dominating our cities. This partly results in much higher air pollution levels in cities. We know that cities are hotspots of air pollution. Air pollution causes around 400,000 deaths in Europe. We recently did a study and we saw that 200,000 deaths each year in around 1,000 major cities in Europe are caused by air pollution. Now, the air pollution doesn't only come from cars, but of course there are other sources like heating and some industry, some ports, etc. But the motorized traffic plays an important role. That's also responsible for noise. We see that there are many cities that are pretty noisy. This is also related to some health effects, including, for example, cardiovascular disease and mortality. The other thing is what we're seeing is that many cities are suffering of heat island effects, particularly in the south. I mean, in a city like Barcelona, where I live, the city center is about 4 or 5 degrees hotter than surrounding areas, because of the great amount of concrete and in particular also asphalt that is in the city.
Okay, so Mark, so we've got this sort of air pollution, noise and heat, or the exposures that are bad for our health. What consequences on health are they? How do they harm us?
So as what I said, we see that increased premature mortality in the cities, particularly due to the air pollution levels, to the noise levels, to the heat island effects, the extreme heat, but also lack of green space and a lack of physical activity, what we see sometimes. But it's of course not only premature mortality, but it also affects cardiovascular disease, respiratory disease. We see also effects on the brain in particular from what we see from air pollution nowadays, that it's got detrimental effects on the brain function, both for children and for the elderly. On the other side, green space is good for the brain. But then also we see, for example, childhood asthma. Many kids get asthma, and we think that about 1/3 of the childhood asthma is actually caused by traffic-related air pollution.
Okay, so how do we create healthier cities then? What's the solution?
I mean, there are many different policies that you could implement of what you should be doing. And first of all, it's a matter of raising awareness, that people are aware that the current urban and transport planning practices have an adverse impact on health. Secondly, I think what we're seeing in many cities is they try to reduce private car use and move to much more active and public transportation, what results in lower air pollution levels, for example, and less noise. We see also new micromobility occurring, like electric patinettes, for example, that may or may not be healthier in a way. They're also associated with many accidents. We see also cleaner car use, like electric cars being introduced. I think myself, I'm not very much in favor of electric cars in cities. I mean, I think outside cities is okay, but inside cities, we should be more focusing on active and public transportation. Other measures, what we see is introducing more cycling lanes to get people to cycle more, introducing low emission zones, to reduce the air pollution emissions within the city, and of course increasing green space. What I particularly like is, for example, the new kind of rule of thumb is the 330-300 rule for green space, and that we should be having green space, that people should be seeing at least 3 trees from the window. They should live in a neighborhood with 30% green space and have a major green space within 300 meters of their home.
Sorry, let's go through that again, Mark. 3 trees from your window.
3 trees from your window, 30% of the land cover in your neighborhood should be green space.
Yeah.
And you should have a major green space of at least 0.5 hectares within 300 meters of your house.
Wow, I wonder how many places have that. Right, Mark, we're going to move on because you've run out of time, I'm afraid. But we'll come back to you at the end if that's okay. So I'm going to move on to Christian. Have we got Christian on the screen?
Hello, hello.
Christian Brand. Good evening, Christian. And Christian's an associate professor from Transport Studies, University of Oxford. And he's going to tell us a little bit about how transport in particular affects our carbon emissions. So Christian, tell us a little bit about how much transport contributes to CO2 emissions.
Hello, yeah, welcome everyone. So in cities, I think more than 70% of global final energy use is in cities, and of that share, that's quite a big share, and that's likely to increase, particularly in sort of developing nations.
Sorry, 70%. Is that so? That's direct and indirect.
Cities, yeah. Global final energy use. So it's a little bit less if you also include agriculture and other stuff. But this is sort of final energy use.
And that includes all the concrete and the coal burning power stations.
It depends. It depends a little bit. Sometimes it includes aviation. Sometimes it doesn't. The estimates are between 60 and 80%, and it's not that straightforward. There's different scopes of emissions, like scope 1, 2, and 3. I don't want to go into detail there, but it's. I think the most robust figure I've seen is about 70%. And if you then look at just transport within this, it's about a third of that is for transport within cities. It's higher elsewhere. It's about 66% higher in rural areas. So cities are actually quite good in a sense that private car journeys are already lower than in rural areas and suburban areas. It's still a big problem though, although some people say that private car journeys while they represent about half of all trips made in major cities, that might go down by 2030 due to things happening within demographics, younger people not taking up the car as much as we used to, and so on. But maybe we come back to that a little bit later.
And how much is from car use and how much is from other transport sources then, Christian?
Yeah, so we usually take an approach of sort of on a life cycle basis, especially with electric vehicles. Now you have to look at the whole life cycle of the vehicle. And there, if you compare, for example, cycling, acoustic cycling, just a normal push bike, e-biking, electric car, and a normal fossil fuel or internal combustion engine car, then cycling is about 30 times lower for each trip than driving a fossil fuel car, and about 10 times lower than driving an electric one. And if you have this sort of ratio from bike, e-bike, electric car, and fossil fuel car, it's about 1 to 3 to 10 to 30. So 1 to 3 to 10 to 30 is quite nice to remember. So in a sense, biking and e-biking are a lot less carbon per mile traveled. So this is just for 1 kilometer travel. But if you look also at on a daily basis, what do people do on a daily basis? It's we're pretty much, or most of us are pretty multimodal. Yeah, we use different modes of transport over the course of a day. And in one of the major studies here in European cities, we found that if you are a biker, in a sense, that you do use your bike at least once a day, you have a much lower carbon footprint of all travel over a course of a day. And that's true whether you look at that cross-sectionally, at the population at one time point in time, or longitudinal if people do change from one to the other.
So what stops urban transport planning in its efforts to reduce car use?
So the whole thing's not rocket science. I mean, as we all know, I think as Mark also pointed out, we know how to do this. We do have to go further and faster in sort of redesigning our cities, and to start really with the reducing the need to travel and move goods, then shift to the lowest possible carbon and healthy mode of travel. That's walking, cycling, and public transport, in particular electric public transport. And then, yes, if you do have to travel by car in a city, make it an electric vehicle, but not the other way around. So at COP, of course, we're here in the blue zone, especially. It's all about electric vehicles, and the main exhibit was a Formula One racing car, electric. That's not really what we need in cities, right? So
no, it's a bit of a distraction. Everybody's attention is on electric vehicles, isn't it? Are they?
Yeah.
Is our attention being displaced?
No, we need electric vehicles, but I think attention. There's a bit of a danger, and we've been sort of arguing, if you just focus on this one thing, you don't invest in all the other options that are actually much more important in cities, and there's a danger. So that's why I've been arguing that actually this focus on electric vehicles sort of inhibits our progress, really. While, of course, if you're techno optimist, then electric vehicles is the panacea, and that's not the case. And everybody's saying this, from the International Energy Agency down to national governments. It's almost virtually impossible, or very, very expensive, to get to near zero carbon over the next 30 years, but just focus on electric vehicles. And the main reason is because this transformation takes just so long. So you have to sort of, in a sense, a curve that starts slowly to go down, but what we really need to do is like a ski slope that's very, very steep, like a black route rather than a blue route that's gently going down.
And that steep slope, what's involved in that steep slope then, Christian?
You really have to do curbing traffic, shift modes, share vehicles, and downsize and electrify the vehicle fleet, almost in that order. And well, we've done a study here in the UK on this, and what we found is you can do a lot in terms of avoiding the need to travel. But to do this consistently, you have to sort of think, if you, for example, fly less internationally, we might spend more holidays within the country, which increases other emissions, right? So there's if you look at sort of the futures that we're looking at, you have to be holistic and consistent. But if you just through mode shift and avoiding travel, you can reduce energy demand and the emissions associated with that by about half. The other half comes from electrification. And for some of the more difficult to decarbonize sectors, like long distance freight, yes, some sort of green hydrogen and other technological options.
Okay, Christian, thank you very much. So it's complex. We needed to shift our transport modes of travel, and electrification is part of that solution, but there are also unintended consequences. Thank you. I'll come back to you also, Christian, at the end, but I'm going to introduce Gara Villalba, who's a chemical engineer, she just told me in the introduction, from the University of Barcelona. Gara, are you there?
Yes, hi, good evening, John, and good evening, everybody.
So tell me a little bit about your job, because it sounded quite fascinating, actually. An industrial ecologist and urban agriculturalist. I haven't come across many of those before. So tell us what you do as part of that.
Yeah, sure. That's a great question. Thank you. I love to share what I do. The past couple of years, I've really concentrated my work in trying to get the message and the studies that we need to validate the need to show everyone that we need to integrate nature and make our cities greener for many reasons. And I would really like to highlight three, which is where most of my work is involved. One is to gain food sovereignty by promoting urban and peri-urban agriculture. So the laws of priority for urban agriculture in urban land use planning is a global trend. And even here in Barcelona, it's just in the past few decades, we've gone from being able to supply about 20% of the fresh produce that we need to just about 2 to 3%. And this is due to loss of land for more profitable uses, including transport and some of the other things that we're trying to revert back from. And another reason for this, for promoting urban and peri-urban agriculture, is because it really helps us have a more circular use of a lot of the resources that we have in our city. Most importantly, amongst these are nutrients. So we can recover phosphates and nitrogen from solid waste and wastewater. And so we can have a circular use of these nutrients to promote our own food production in urban and peri-urban areas. So that is one of the...
Sorry, Gareth. So our food systems are, we're importing food into cities from far away.
Yes.
And they have their own life cycles within where it's being produced, and cities are becoming isolated from that. So how do we establish, because there aren't many places to grow stuff in cities. How do we reverse that?
Of course, it also depends on the geography, the climate of the city, but we're finding many creative ways to increment the food production that we have in cities. And there's peri-urban agriculture, there's hydroponics in green roofs, urban agriculture in green roofs, in even throughout the city. And a lot of these systems are great in that, as I mentioned before, we can use nutrients that we can recover from the cities, but also we have to be careful that we're not substituting one problem or solving one problem and causing another. So we have to do all of this and without incrementing the material footprint or the energy footprint in other ways. So for example, we would need more water to do this. So we need to make sure that these food production systems are being irrigated with rainwater harvesting techniques. And so, we need to make sure that we optimize resources in cities, and because we're avoiding some of the food imports by producing our own, that we're not incrementing our own footprint here in the city.
And most of us think in terms of green space in cities of our parks, and in Glasgow COP26 we have a fantastic Victorian heritage of parks that our ancestors built for us because they realized that we needed lungs in our cities. But do we still build parks in cities anymore, or is it impossible?
No, it's not impossible. Most cities have in their urban agendas incrementing green, but certainly space is very limited in cities. So maybe there isn't that much room for a lot of more green urban parks, but there are other ways that we can increment green in cities. I mentioned before green roofs. In the city of Barcelona, for example, the new urban master plan is hoping to implement 720 kilometers of green corridors. And so these are going to be replacing lanes of traffic, roads, in many ways, and it's a way to make the city more cohesive and promote this active mobility of people. And so these are not parks per se, but they are greening cities and putting trees where cars were before. And so I think that we need to be very creative in cities in order to integrate the nature in the space that we have left. And I also really want to put emphasis on the interaction of the city with the peri-urban area, because that really opens up a lot of opportunity for circularity of resources, especially in terms of local food production.
And are we rediscovering old habits of growing our own foods that we used to do years ago?
Yes, as a matter of fact, even the COVID pandemic brought that to light, in that we have certainly gone towards designing cities that, we think we're islands and we have everything imported and don't produce much of the things that we need, that we metabolize, that we need to grow in our cities. And we see a lot of people being very motivated to start producing their own vegetables, to start producing their own food. There's definitely a big wave of this in many, many cities. And I think it's very important that we start getting a little bit of food sovereignty, a little bit of self-sufficiency in some of our basic resources. Okay,
Gara, and as Mark pointed out, that greenery, that nature is good for our health, it's good for our minds. So there's something very sort of inbuilt into our evolution that we need that green space. So more of it. Thank you very much.
Thank you.
Okay, our next panelist is Audrey de Nazelle, who's Senior Lecturer and Deputy Director of the Centre for Environmental Policy in Imperial College. And Gara, we're going to have to substitute you, I'm afraid, if we can get Audrey up on the screen.
Oh, good to see you now. See everyone.
Good to see you, Audrey. Tell us about the preparedness of cities for the change that we need. We've heard about the health consequences of the need to be more important, to be healthier, the challenges about transport and the carbon emissions, this bringing back nature to cities. Are cities ready for this?
So, ready or not, they need to make it happen. I always think of my babies going and playing hide and seek. They're ready or not, here I come. Well, I think that it needs to happen. So we don't have a choice, and I think we need to do everything we can to make it happen. So some cities are starting to implement things, and that's great news. But I think we all have a role to play to actually go from lots of good talks to actually action. And the problem I find is that several of us have already commented on, we tend to focus a bit too much on very much technological solutions. And that's what's slightly worrisome. I think when it comes to cities, of course, for example, electric vehicles have a role to play, but a lot of the discourse around policymaking to address climate change and address air pollution is around getting people to get rid of their petrol vehicle and buy instead an electric vehicle.
Oh, yeah, too right. So that's the nub of this issue, isn't it? There's about changing individual behaviors is much harder than some new technical solution that we can do. How do we change behaviors?
So I think first we need to change the behaviors of our politicians. I think that's the leading factor here is convincing politicians to take bold action. And I think that's the first. We can try to promote walking, cycling, and show all the benefits of on our personal health to walk and bike, for example, or take public transportation. But as long as we don't have safe places to walk, bike, take public transportation, particularly for cycling, of course, people are just not going to do it because they will feel unsafe. So we need to get politicians to take that bold action. And I think what's preventing that from happening is first, lack of leadership and lack of political will. Of course, politicians have multiple people to talk to. There's lots of competing interests that they need to respond to. They face a lot of lobbies, and they face very short electoral cycles. So they are often hesitant about doing things that will be controversial. And as you said, changing behaviors is necessarily going to be controversial because it's not always an easy thing to do. So the first thing I think we need to do is convince politicians that the best way is not just purely to focus on electric vehicles and low vehicle fleets. And of course, as Christian has said, and as I think maybe Mark has also said, it is part of the solution. But when you entirely focus your investments on just that, it means it's an opportunity cost of not investing on something else. And it's also a danger of lock-in into a system that in the long run is not beneficial for us all. So once we've all bought our electric vehicles and we have all the infrastructure, and I saw that today, the big announcement from the UK government is all the new design of the electric charging, and that was their big announcement for the day. And when I think that my taxpayer money has gone into the design of an electric charge for vehicles, when what we need is a new design of cities. That's what's really needed, is getting new designs of cities, new land uses, new city planning, so that we get people to live in compact cities, that people live close to each other, and that there's really safe public transportation, walking and cycling infrastructure. And okay, I think
Audrey, can I just ask you? So one of the issues here, which we haven't really touched on, we're quite a European panel, I notice, is about inequalities globally, but also inequalities within cities. So when you look at cities, those who are most exposed to the risk factors that Mark mentioned, the noise and the air pollution, and the lack of green space of those living in poorer inner city areas, so tend to be hardest hit. They tend to not be the people buying electric vehicles as well. It's all the middle classes buying electrical vehicles. So there's inequalities in terms of impact in our European cities, but also internationally. When you look at cities like Lagos or Karachi or Nairobi, how do they start tackling this issue?
Yeah, so I think you point exactly to something that's really important in terms of how we create change. Is I think we really need to create alliances and demonstrate that what is good for climate change, what is good for our health, is also good for inequalities, is also good for traffic injuries, and we need to demonstrate to show the evidence that all of these things are linked. And when you choose one policy over another, you have repercussions, unintended consequences, synergies and co-benefits versus others. So I think when it comes to our role, for example, as researchers, we need to be able to develop that evidence that's a complex evidence that shows how the system works and shows also how people make decisions and how politicians make decisions. I think that's really, of course, I'm speaking from the perspective of a researcher, what it is that we can contribute. And but mostly what we can contribute is actually to talk, to collaborate with all stakeholders, all decision makers, from policymakers, from members of the public, from industry, NGOs, so that we together come up with the right evidence that's appropriate for the location where we're at, because you're completely right. Depending on where you are, the solutions are going to be different. So it's collaborating locally with the variety of stakeholders. That's how we understand what are the triggers, what are the leverage points, what are the types of data or how to tell a story that's going to make an impact to not only change politicians and their view of how and their view of how to tackle climate change and have further co-benefits, particularly for health, and also how to engage citizens so they put more pressure on politicians. So I think having this combined, this collaborative approach, this co-production approach is how we frame it, I think, and when it comes to research. Also combined with systems thinking, so we create the linkages. I think that's the future for creating alliances, breaking the silos. Decision making in cities tend to operate through certain specific departments. So the air pollution people are going to target reaching the air pollution standards. People who are in charge of traffic.
Thanks, Audrey. Thank you very much. And that's a good point about the co-production, because actually, we need public pressure on this, and we've seen that very much from our young people around climate change, and that we need to really tap into that and show the harm. Okay, Audrey, thank you very much. Right, we're moving on to Maria Jose Roco, who's an architect from the Polis Network in Brussels. So tell us about the Polis Network. We've still got Audrey here. Audrey, tell us about the Polis Network.
Hello.
Maria Jose, welcome
okay,
to you,
I
and
appear.
a good evening
Okay.
to you. Tell us a little bit about the network and what it does.
Okay, good evening, everyone. So, well, the Polis Network is a network of cities and regions, European cities and regions, working together towards transport innovation and transport sustainability. So we are over 90 members already, and we do different things. On the one hand, we represent the voice of cities and regions towards the European institutions, but we participate in a high number of European projects related to urban mobility on different aspects. And we also work on peer-to-peer exchange, so facilitating knowledge transfer between cities. And we have different pillars. We look at traffic efficiency, at environment and health, at governance, at access, etc. And under each of these pillars, we have several working groups, and there is the place where cities gather and they can exchange knowledge, they can share best practices and learn from each other on topics that are important for them.
So, Maria Jose, when I used to travel around European cities in the old days before the pandemic, and you do notice a fair bit of difference between active transport, say, for example, in Copenhagen or Amsterdam and my own city of Bradford or Glasgow, where we're having COP26. Well, how do you spread good practice? Do you see that in your network?
Yes, of course, we have front runners in active travel. That's really high, very good model share of active travel. And this is for a number of reasons. It has to do with, of course, infrastructure. Firstly, having safe infrastructure is very important to convince people to take the bicycle in this case, for example. So infrastructure is key, but there are other aspects related to behavior change and how can people decide to take this mode of transport. And it is related as well to policies that can help this happen. So it really needs political commitment. It needs also monitoring of the different measures that are in place to show how they are successful. It needs communication as well. It's very important how to communicate the benefits that it can bring for the city and for the citizens. So there's a wide array of things that cities can do, and it's true that different cities are on different levels in this regard.
Okay, thank you. So let's talk about the pandemic, because it has changed cities, hasn't it? Remarkably, I remember in the first week of lockdown in March last year, cycling into the hospital, which I do every day, and the roads were empty. No air pollution, no traffic to run me over. It was the most wonderful commute I've ever had. But things have changed, obviously, since then. Tell us about how COVID-19 has changed our behaviors, changed our cities.
So, well, of course, as you mentioned, we saw a dramatic decrease in traffic levels, 70, 80, or even 90% in many cities, and how, of course, during the lockdown, of course, the pollution levels dropped. Also, traffic-related accidents dropped, not at the same rate. And we saw also that public transport was hit very hard, and it still is recovering slowly, but not yet has reached the pre-pandemic levels. But one of the positive things, as you mentioned, was the rise in active travel, how people had this chance to experience the city with more space, without pollution, and how this had the potential as well, even though travel habits are very difficult to change, to make this change behavior. So we've seen this is one of the most positive. We've also seen how cities have been deploying infrastructure for cycling, giving more space to people, reallocating space for pedestrians and cyclists. This was a kind of revelation for many people of how unbalanced the distribution of space is in cities. And something worth mentioning is that cities that already had their sustainable mobility plans in place could fast track them and were more successful in implementing this kind of sustainable mobility measures. Also, it was a time for experimentation as well. Measures could be put in place, but they could also be trialed and adapted if necessary. So it was a really very interesting period, and we have to learn a lot about it.
And that legacy, how sustainable do you think it is? Winter's coming, everybody stopped cycling, I've noticed. Are we going to, and everybody's back in the cars rather than public transport because they're scared of catching COVID. Is it a sustainable legacy, those positive benefits?
Well, so our mobility systems are not sustainable, and that's what we are seeing, that once the restrictions were lifted, we have again a high number of private vehicle ridership, and we can see this is because we really need to change, to have a systemic change in our mobility systems. On the other hand, it's true that many cities that implemented these kind of measures, according to the ECF, around 2,000 kilometers were announced, of which 1,500 were actually implemented. This encouraged many cities to actually fast track their plans, and we've seen how cities like Berlin, like Brussels, Milan, Rome, Barcelona, many have really advanced a lot in their cycling agendas, have actually expanded as well the cycling network, not only but the cycling network, but also closing streets to traffic, implementing other urban vehicle access regulations, slowing or limiting the traffic, the speed traffic limits. So we've seen this all over in many cities in Europe. So there's for sure a legacy, and I think the most important legacy is also what we have learned, that it's important that cities can share knowledge in times of crisis like the ones we've experienced, but we may also experience more in the future. The importance of public transport that kept things moving throughout the pandemic, and that we have to make sure that public transport continues to be the backbone of urban mobility, and the importance of having diverse mobility ecosystems, because these are more resilient. So these are some of the lessons learned.
Fantastic. Thank you very much, Maria Jose. I think that's a very optimistic note to pass on to Matthew. We're going to get Matthew Baldwin in the frame if we can.
Can
Matthew,
you see me?
So Matthew is the Deputy Director General for the European Commission's Transport and Mobility. And he's in the room.
I'm there. I'm here.
So good.
And what you lot online can't see is a lovely audience who are sitting patiently here watching you.
Audience.
I'd like to suggest, because it's getting late here, that we have the audience come up and give you all a wave online, because you probably can't see them, can you?
Well, let's talk to you first, and then we'll do that at the end. We'll have a stage.
I'm all for a bit of audience participation, me.
Yeah, but no spectator injuries, hopefully. So Matthew, you're a policymaker. So let's. I'm going to ask you about that in a minute. But tell me, you're leading this 100 climate neutral cities project for the EU. Tell us a little bit about that.
Well, I'm an old bureaucrat, John, and it's the most exciting thing I've done in my 30 years of bureaucracy. And I've got my mask stuck in my earpiece now, so it's going to be a very distinguished look. It is an extraordinary project, and let me first say how much I'm struggling for things to say, because I agree with every single thing that the panelists have already said. Really inspirationally good stuff, and thank you all very, very much. What we're going to try to do with the 100 Climate Neutral Cities project is essentially bring all that to life. We've got to, all these words flying around the center here, talking about levels of ambition and commitments and pledges, we've actually got to start doing it. The European Green Deal will not come to life spontaneously on its own. It's got to be implemented. We are the micro to the carbon pricing policies which will be essential within the EU to drive the opposition to climate change. So what we will do later this month is release a call for expression of interest to the cities of the European Union. We're looking for cities of more than 50,000 people to come forward.
So Matthew, how many cities are there in Europe? How many cities over 50,000?
Oh, that's a very awkward question. I don't know off the top of my head. I think there are about 1,000 cities of more than 100,000. So it's a big pool of cities. Yeah. And sorry, just to finish the point, we want the mayor to express his or her strong ambition to go climate neutral by 2030. That's a very exacting task. We will then choose 100 cities. We have a wonderful consortium made up of 35 leading climate organizations, such as the EIT Climate Kick, such as ECLAI, such as Eurocities, and we'll work with the cities. We'll try to channel the finance to them. They will try to produce what we're calling climate city contracts and related investment plans. And we then need to bring the big bucks, and it is big bucks, about €1 billion for an average city of 100,000 to go climate neutral. Bring those big bucks to bear to bring the concrete changes into place that we need, whether it's in mobility, whether it's in energy efficiency, whether it's in energy generation or the circular economy. So no pressure, but that's what we're up to.
Wood rather than concrete, I hope, Matthew. So tell me, my worry when you say that, it sounds fantastic actually, but my worry is that it'll be the level playing field won't be there in terms of we'll have big industrial European cities that are just going to find it too difficult to become climate neutral. And those who are smaller and sort of touristy places, who have light industry or tech industry, who are going to find it easier. How are you going to make sure that that's fair across those 1,000 cities?
Well, you'd be surprised at the cities that are talking privately to me about their interests. It's not just the usual suspects, the Copenhagens, the Finnish cities. We've got some very interesting cities that are coming forward. Yes, it's more challenging doing it the larger the city. You have issues of organizational complexity. And by the way, we're coming out of the EU's Horizon Europe project. It is about innovation, innovations of governance, innovations of organizations. And if you like, the bigger cities have got the capabilities and the capacities, a lot of the knowledge. Some of the smaller cities struggle because you don't have the levels of expertise to really capture and come up with the policies to drive down your climate, your greenhouse gas emissions. So we want a mission that looks like the European Union, as Bill Clinton once said of his cabinet. So we want cities from each member state, and I'm determined to do that. I've spoken today to the mayors of Prague, of Budapest, of Marseille, And all of these cities in their different ways have strong interest, and I very much hope they're going to come on board. I hope you can hear the bagpipes in the background, by the way. We've not got bagpipes.
No, we can't. But I'm just wondering whether if we could reverse Brexit, can we get a shout as well, Matthew?
Well, legally speaking, we will enable all cities to participate from countries that have done association agreements with Horizon Europe. And I understand that a number of those association negotiations are still ongoing. I believe that's still the case for the UK, but that's the position. And once you're associated with Horizon Europe, you can join Horizon Europe programs.
Good. So that sounds really exciting, Matthew. Thank you. Tell me a little bit about you're not an old bureaucrat.
I really am, John. You can't see me closer.
A youngish bureaucrat. Tell us about the challenges of policy change when it comes to climate and carbon emissions and transport. Do you find in your career, is the time right for these changes now? I mean, presumably 20 years ago, nobody was listening. Have you seen that change over time?
Yes. I mean, it is extraordinary, the period we're living in. We have had the ambition to be a climate neutral continent by 2050 for some time, and we've been talking about what emission reductions to go for. And frankly speaking, I thought the COVID epidemic would knock us off course. But President Ursula von der Leyen, in September 2020, in her State of the Union speech, did not back off. She had every opportunity to say, well, look, it's really tough right now with the economies. We have to step back. She didn't. She said, we're going ahead with the 55% reduction because we can do it. We've done these studies. That is a viable thing for us to deliver. And that's what we're now pursuing with what we're calling the Fit for 55 package, an unprecedentedly wide set of legislative measures, which is now on the table of the Council and the Parliament as we bring these things forward. And so I have every confidence in the European Union, backed by a binding EU climate law, which has every member state committed already up front to that 55% reduction. It's a question of how we do it, not whether we do it. I see skepticism in the audience, but trust me. But just in that context, John, can I pick up a point that Audrey made about behavior change? And it is absolutely imperative that we, at different levels of the EU, whether it's at the European level or the national level or the local level, get the systemic offer right. The guy that drives his car from Antwerp into Brussels every day, and it is usually a guy, and it is usually on his own, and it's a white guy in his car, isn't a bad guy. It is that we have collectively offered him a system which gives him a great reduction in terms of taxation from having a company car. We have generally poor public transport, and I'm not singling Belgium out, but that's generally the case. And then free parking when he gets to the city, and no road tolls. So the system that we offer people will drive the behavior change that we know is necessary. And that's what we need to do, not just in terms of our European policy change, and believe you me, that is coming, but we also have to drive it at every level. And again, back to my project, you can build that bottom up with a city. What are the city's needs? Are there problems in getting to climate neutrality involving mobility? We can address that. Are there problems involved in the refurbishment of buildings? I think we're onto a winner here because we have a project which we can assemble like a Lego kit, which is a great favorite here in Glasgow, to deliver these things in practice.
Okay. Matthew, that's fantastic. Thanks very much. Right, we've given everybody sort of 7-8 minutes to contribute. I'm going to take a couple of Q&As from the panel to the panel, if that's okay. And then I'm going to give everybody a quick fairy godmother wish of what you would like to see, a single thing that you'd like to see in the next 10 years. So let's just start off with the Q&As. There's been a huge shift in people moving out of cities, very true. What will a city of 2040, I'm going to bring that back to everybody at the end, actually, if that's okay. Mark Sansom, 50 years, research and scientific community have performed a tremendous job, but at a practice level, good examples are rare, indeed they are. Let's go to Matthew, actually, since you're still on there, Matthew. How do we engage practice better and bring public health and planning closer to deliver radical transformation?
Well, back to the points that my colleagues on this panel were making so well earlier on about how we can bring the health benefits into this equation, how we can make climate neutral cities also healthy cities. We underestimate enormously how much health matters. Mark talked about air pollution and noise. Noise, the forgotten thing. Air pollution kills 500,000 people a year in the European Union. You know, the road safety aspects are forgotten. That costs us between 200 and 300 billion euros a year in terms of external costs. And last but not least, if we are smart about it, we don't just address the external costs, we address the external benefits that we can bring. Let me give you an example of that. If we
Briefly, Matthew.
Yeah, sorry, very briefly. If we just look at the mobility aspects of what we get from bike lanes, we will chronically underinvest in bike lanes. If we look at the broader health aspects, we will do much more. And the really exciting thing for me is right here in Scotland, the health authority is now investing in bike lanes because they can see the overall benefits of that will bring to the population. So think broadly about health, and that will also set us on the right path.
Good. Thank you very much. Nice answer. Right, we've got another question about in order to reduce negative externalities around the globe, what about green sustainable public procurement? We don't hear enough about that. Gara, that sounds like your neck of the woods. Have you got an answer for that?
Let's see, here the negative externalities. The negative externalities, I don't quite sure if I understand the question. Is it the negative externalities that...
Oh, I think it's more about public procurement of green, sustainable, of how we stop buying stuff that's bad for the world. Okay, I'm going to move on then. Gara, sorry, I'm putting you on the spot. Mark, let's go back to our glamorous leader, Mark. How about you? What about green public procurement?
I think it's always very important, but what I would like to mention actually is there's some really nice initiatives that's coming back to the question of Mark Sampson. I think where we see changes in our cities. I mean, if I look at my city of Barcelona, for example, we're introducing new urban models like the superblocks. These superblocks, I mean, slowly but steadily, they've been introduced to reduce the air pollution, reduce noise, introduce more green space and make people more active. So I think there are things happening. Another one that I see here in Barcelona is the Plaza Glorias, what was before a big roundabout for cars getting into the city. They tore it down, they made a tunnel, and now we've got a nice park on top of it. Furthermore, we're increasing the cycling lanes. In 2015, 120 kilometers of cycling lanes. This goes up to 273 kilometers of cycling lanes in 2023. So I see some of these practices that we've been saying these are good actually being introduced, I think. And that's for me quite encouraging. I mean, other things what I see is the 15-minute city in Paris, the car-free neighborhood in Vauban and Freiburg. I think these are great examples that we should follow.
Okay, thanks, Mark. So, but for all these good examples, we do have the duplicity of our political leaders. For example, Martina talks about how a new business from Ohio is planning a pipeline underwater to Scotland for gas. Is that right? For fracking. Oh, that would be very disappointing. Anyway, I'm not sure if we can answer that question, but yeah, be careful who you who you believe, I think, or be careful about the politicians anyway, because we're busy doing more, drilling more oil in the North Sea while we're doing COP26. Okay, we've got 5 minutes left, and what I'd like to go back is to. Okay, Martina, you've got the report. Thank you very much. Put that in the Q&A if you can, a link, and we'll have a look at that and get our anger up. So we've got 5 minutes left. I'd like to just get let's end up on a positive note as COP26 heads towards an end. And I'm going to be the fairy godmother, and I'm going to give all our panelists one wish of what they would like to see in 10 years' time. Okay, so let's start with Mark. Mark, one thing for cities that you'd like to see?
Tear up the asphalt and plant more trees and provide more space for people to be active.
Good, that's a nice one. Okay, Christian, if we can switch quickly enough to you, we'll get you back in the picture.
Yeah, so one wish, I think it would be, rather than to our sort of to COP and our leaders really is rather than saying it's business as usual and technology will save the day. I think our leaders really need to be upfront with people on what each of us needs to do, can do, and provide the right investment and infrastructure to enable us to do it. So I think this can be done fairly quickly. It just
I like the idea of truth.
Yeah.
I like that idea of truth in our leaders. That's a good wish.
Yeah, I mean, investment goes in the wrong direction at the moment. I think it needs to go. I mean, in the UK we have a road building program, and the US now with the infrastructure program is investing billions and billions into new roads and airports. That's just the right way to do it. So if we can change that, that would be my biggest wish.
Honest politicians. That's gonna. I think you've already won my vote. Right, Gaura, what about you? Let's get you on the screen so we can see you.
Yes, hi, great, thanks. Well, I think mine might be even a little bit more ambitious. I would really love to see a shift in paradigm in the way we think, so that food is not an afterthought of last thing I just throw in the microwave, but we're really aware of the need for producing our own food, and it becomes an integral part of our life, just as important as our job, as important as being with our family, is producing our own food and doing it in a sustainable way. So I would like to see a lot more food production in cities.
Sustainable urban food production. That's a great thing. I'm going to follow that up with you, Gaura. I'd really like to hear more about that. But that's a great wish. Okay, Audrey.
I so many things, but maybe
I know that's the hard thing. That's why this is hard. One wish.
Okay, one wish would be to see every parking lot and parked car to be replaced by a tree or a bench or a slide or a football goal.
Rip up the parking lots. They paved paradise. Yeah, that is great. I love it. Get rid of car parking. That would stop the problem, wouldn't it? Okay, Maria Jose, over to you. Let's put you on the screen.
Yes, hello. Well, I would like to ask to have again a walking world. So where within cities you can walk to the places you need to go daily, where it's safe, it's convenient, it's comfortable to walk around and also to use the bike without having the sufficient space to do so.
That's great. Pedestrianized cities, a whole city pedestrianized without any car parking. I'm going to come and live where you guys are living. Okay, and Matthew, finally, one wish from you.
Well, thank you, Fairy Godmother. I want all of the other wishes, plus I want you to fulfill my prediction, which is that in 10 years' time, we will have shown that cities can be climate neutral, that it is deliverable, and that the money will flow to fund those things, realizing all the beautiful benefits that my co-panelists have just described, because those things do come together. If we can address the climate neutrality, we'll get the better air quality and all the rest of it, and that this model is then being adopted and rolled out across the European Union and across the world. Thank you.
Spoken as a true policymaker. Matthew, thank you very much. And thank you to all our panelists. Can we get the audience on the stage in a COVID-friendly way, or is that possible? Were you joking about that, Matthew? Okay, so let's get everybody...
John, what is your wish?
And a round of applause, please, from Glasgow to our fantastic panelists. Can we hear them? Matthew will have to hold the microphone.
Some of them are too shy, and the others are taking photos, but we're all here, and we're now going to sing a song. Yeah. Hello, everyone online. Thanks very much. It's been a great panel. We've really enjoyed it.
Thank you very much. Thank you very much. Good night, everybody.
Walk 500 miles.
Okay, good.
Perhaps the panel stays.
Roberto, we need direction. Or Mark, do you know what's happening now?
The panel can stay, and the rest we ask to leave.
Recording stopped.
Thank you so much.